Much. Good morning, committee. It is now 8:30. We are unmuted to the broadcast and the recording, and you may call to order whenever you are ready.
Thank you. Good morning. This is Russell Ginden, Principal Deputy Fiscal Analyst with the Fiscal Analysis Division of the Legislative Council Bureau as staff to the Economic Forum. And I will attend to agenda item 1, which is roll call, and then turn it over to Chairman Billings. So for roll call, we have Marvin Levitt.
Here.
Jennifer Lewis.
Here.
Frank Streschley.
Here.
Chairman Craig Billings.
Here.
And Mr. Chairman and other members of the committee, member Linda Rosenthal let the chair and I know that she had a work event come up that she could not get out of. Thus, we'll let the record reflect that member Rosenthal is absent and excused. And with that, we have a quorum of the members available for the meeting. And with that, Mr. Chairman, I'll turn the agenda over to you and be willing to assist you as needed to execute the agenda this morning.
Thank you so much. I'd like to welcome the members, the presenters, staff, and any members of the public to this meeting of the Economic Forum. I'd especially like to thank the Legislative Council Bureau's Broadcast and Production Services staff for their assistance with the meeting. I'd like to start the meeting by reminding you that the Economic Forum is statutorily required to provide a forecast of unrestricted general fund revenue for the current fiscal year 2021, 2022, and 2023 of the next biennium on or before December 3rd. This is the forecast that is required to be used by Governor Sisolak in developing the executive budget that will be submitted to the legislature for the 2021 regular session. We'll have several informational presentations today. Additional presentations as well as preliminary forecasts will be presented at a meeting to be scheduled in the second week of November. And we'll then have a meeting on December 3rd to approve the required final general fund revenue forecasts. In the June meeting, we discussed the possibility of having some additional meetings of the forum this year. After additional consideration, we have decided that such additional meetings are not necessary. If a significant change to current circumstances materializes that might require additional consideration from the forum, I will work with staff to evaluate it and make a determination as to whether an additional meeting is needed. I'd like to take this opportunity to thank my fellow members for their service to the forum. Forecasting in this environment will no doubt be extremely challenging, perhaps even more so than during the recession of 2008 and 2009. Today's agenda is fairly long, but given the circumstances, I felt it was best to err on the side of more information than less. If we're not able to get through all the items in the meeting, I will work with staff to defer items to the November or December meetings. It is my plan to go through the items in the order they're listed on the agenda, other than to accommodate a couple of presenters that have other obligations and therefore need to move forward in the agenda. I'd like to ask if there are any other members that have opening remarks. And if they're not, then I would like to proceed with any public comment under item number 3. Anyone else from the forum?
I do not.
Okay, great. I would ask our BPS staff to assist me in facilitating this agenda item. And I would also ask Mr. Ginden as staff to the forum to assist me as needed in conducting the agenda today, as you so graciously offered to do.
Chair Billings, the public line is open and working. There are no callers at this time.
Okay, thank you. Russell?
Mr. Chairman, the next agenda item is approval of the minutes, and under this one, we'll need a motion and a second, and then a vote of the members for approval of the minutes from these would be from the June 10th, 2020 meeting.
Okay, hopefully everybody's had a chance to review those minutes. Can I please get a motion?
I'll make a motion to approve the minutes.
I'll second.
All in favor?
Aye.
Aye.
Thank you.
Actually, Mr. Chairman here, I think I lapsed into the old world for a little bit, so let me get back into our virtual world. Let the record reflect that all members, Member Lewis, Member for Streschley, and Member Levitt and Chairman Billings voted in the affirmative for approving the minutes under this agenda item. And that way I'll avoid me having to do the roll call for everybody, but I did see everybody vote aye in affirmative. So with that, Mr. Chairman, then we can proceed with the agenda, which is the presentations. And so under agenda item 5, which is the presentation on the status of the mitigation and management of COVID-19 cases in the state and the current situation regarding businesses being allowed to operate. We have Caleb Cage as chairman of the COVID-19 Mitigation and Management Task Force and the State of Nevada COVID-19 Response Director, as well as Julia Peak, the Deputy Administrator of Community Services from the Division of Public and Behavioral Health at the Department of Health and Human Services. And with that, we will have them start their presentation. And Mr. Chairman and members of the committee, what we're going to be doing here today is all the presenters will be sharing their screen to do their slide set for the members as well as the public that might be watching. And if there are any technical difficulties with any of the presenters being able to share their screens so that we can see their information, I have all the presentations on a flash drive here, and staff can attempt to go to the witness table here and bring their presentations up. If such of an event does necessitate itself, I would ask then the presenters would have to let staff know as to progress through the slides for their presentation. And thank you, Mr. Chairman. And with that, we can move forward with agenda item number 5.
Good morning, Mr. Chairman. I'm going to do a video and audio check. Can you see my screen?
Yes,
Okay,
I can
great.
see. I can see you.
I talked over you. I apologize. Could you say that again?
No problem. Sorry. I can see you. I cannot see what you're presenting, if you're presenting something.
Okay. Let me make sure I get that right here. I apologize.
Caleb, it seems to be working for me. I can see.
Okay. Okay, great.
I'm content following along in the the printed version. No problem.
Okay, great. Thank you very much. Just wanted to make sure everybody had a chance. I'm joined here this morning. Good morning, Mr. Chairman, members of the Economic Forum. My name is Caleb Cage, the Nevada COVID-19 Response Director in the Office of the Governor. Delighted to be here with you this morning with my colleague, Julia Peak, Deputy Administrator with the Division of Public and Behavioral Health and at the Department of Health and Human Services. And today we're going to give you a presentation of mitigation and management efforts during the response to COVID-19 in the state of Nevada, as well as our ongoing reopening process, which, as I'm sure you all know, has significant economic impact on the state of Nevada and will continue to do so going forward. As you can see from the overview slide here, we have a number of slides that we'll be going through. Our intent here is to provide a high-level overview of the situation as it stands in Nevada and where we are, and then to leave plenty of room for questions at the end. We understand you have a full agenda, so we're going to be moving relatively quickly. And
Mr. Cage,
Julia,
I'm sorry to interrupt.
Yeah.
I'm sorry to interrupt, but we can't see your presentation at all. This is broadcast. If you could stop your screen share and then start it again so that we can all see it.
Sure. Can you see it now?
We cannot see it.
Okay,
So at the bottom of your Zoom client, if you hit that green share screen button, and then it should give you the option to choose the application.
and nothing is populating for you at this time, I take it.
That is correct.
Worked previously? Julia, do you have the presentation? Could you try screen sharing?
I could, Caleb, but all of us in the chat can see it just fine. So I don't know if it's an issue specifically on the other end, but all of us can see it just fine. That said, I will try to share my screen as well.
Thank you, Ms. Peak. We are not seeing it. The members are not seeing it, and neither is the public. So the committee could be at ease for just a moment while we sort through this. Please stand by.
Can you see the PowerPoint now?
We cannot. Mr. Gendon is going to run it from the committee room. So if everyone could just stand by for just a moment while we get that set up.
This is Russell Giddon. So I have the presentation for this agenda item up on the screen. And so hopefully now people can see it. And Mr. Cage and Ms. Peak, you'll just have to sort of let me know what slide I need to be on. And you'll be seeing them on the screen. So you may have to just provide me direction.
Thank you, Mr. Gendon. Thank you, everybody, for your patience. Mr. Chairman, if acceptable to you, we'll go ahead and continue. So slide number 2 here provides an overview of where we're going here this morning. Again, we want to save plenty of time for questions at the end. Slide, please, Mr. Gendon. It's important to note this information was pulled on Monday in order to make the presentation deadline. So information has been updated or will be updated today and is updated on a weekly basis. You see a high-level overview of where we stand, kind of a once over the world dashboard here with our total tests, confirmed cases, and deaths, which are key metrics on the left side, and all the way to hospitalization and intensive care capacity, or occupancy rather, on the right side. We'll dig into this in a little more detail as we go. Next slide, please. Each one of those, or most of the metrics that were on the first slide, are presented here. The top is, of course, cumulative. This is tests, and tests is test represents a key capacity here in the state for our ability to monitor what's going on with the virus in the state. One of the things that we want to point out here, and this will be a common theme, and Ms. Peak, jump in at any moment. I know we have some slides later with your information specifically, but if you have anything to add, don't hesitate. If you see the bottom graph here, there is the tests have been relatively in July and August had a great increase, and have been, if you really average it out, have been fairly steady in September and October. Again, this is really just a measurement of how well we are tracking what's going on in the communities rather throughout the state. And again, I'll leave a lot of the detail on this for questions. Next slide, please. With the over 1 million tests that we've conducted in the state of Nevada, this is where we start to see the outcomes and the trends. We, again, the top graph on each of these charts will show cumulative, so growth over time, and the bottom is the daily new cases. Really important to point out here that we are looking at these trends. So the trend, as you can see, early to mid-June, we started to see an increase that created that wave. And currently, right now, starting in mid-September, we are in what appears to be a slower growth, an increase, but a slower increase over time. And we don't know where the ceiling is going to be, but this is where our mitigation measures will help us to manage this. I ask you to look at these cases right now aligned with their timelines, and as we get to the other outcomes, you'll note that they're all tied directly to these with respect to deaths and hospital occupancy and capacity and otherwise. Slide, please. So where we saw back in June an increase and an uptick, you'll notice that on this slide on the daily deaths on the bottom, the uptick is basically the same. We see a similar increase and decrease over time, but it's 4 to 5 weeks to the right of our cases, and that is due to the nature of identifying the virus within people, as well as it's the course that it runs in eventually resulting in death, tragically, for a percentage of the patients. So this slide shows, or this slide in the dashboard shows our cumulative deaths from the virus, as well as the offset from the from infection. It's important to note that in that 4 to 5 weeks, that is represented as in the gap between the daily new cases and the daily death slide. That is when we see the strain on our hospital capacity in the state, and that means that people are going to hospitals. They're going to special areas for COVID positive patients. If their situation deteriorates, they're going to intensive care units. They're using therapeutic drugs and ventilators in order to be maintained. And unfortunately, in a percentage of those cases, they do not recover, as is represented here. But the important thing that we're measuring is that the three important things that we measure for this are the number of infections, the severity of the infection, which is represented by hospitalization, and of course, the cases that result in death. Next slide, please. So this again is from Monday. This is a slide that we use. This is a slide that we use internally that shows how we are doing throughout the state. We don't use it internally. We don't produce it on our dashboard just yet, but it will be soon. And it assesses the state based on 3 criteria. The first is the average number of tests per day per 100,000 for a community, and that should be greater than 100. The next is the case rate per 100,000 in the last 30 days. And that should be, if it is greater than 200 cases per 100,000, then the community is flagged for that. And then a test positivity of greater than 8%. And I can go into some detail on what all of that means, but suffice to say, these are the criteria that we use at the state through the task force, which I will get into here momentarily, to monitor increased exposure risk and increased disease burden within communities. Next slide, please. Julia.
Good morning. Thank you for the opportunity to talk today. I'm going to provide some information on our case investigation and contact tracing efforts. This has been a major part of the COVID response in our state. Initially, we developed 2 goals. Those goals remain. As part of COVID, one of the most important things is to respond quickly and timely to both cases and contacts. So as Director Cage mentioned, testing is key. Testing allows us to find cases and then quickly reach out to them, interview them, and find possible places of exposure, but more importantly, those close contacts so that we can let them know they've been exposed and then they could be put on a period of quarantine. So as you see, within 24 hours has been our goal. Our local health authorities have developed major capacity for case investigation locally, and we've worked with a surge staffing company to provide contact tracing. As noted on this slide, we are at about 99% of the contacts within the week noted having been contacted within that 24 hours. So the team is doing really well in that area. About a quarter of our cases are identified through traditional contact tracing and case investigation. This relies on the case having not only names, but contact information for the people that they've interacted with. A close contact is defined as someone who was within 6 feet of the individual for 15 minutes during the period of time in which they were contagious. One of the ways that we've worked to supplement traditional case investigation and contact tracing is through development and utilization of apps, specifically an exposure-based app we called COVID Trace. The other thing that we're very lucky to be working with is with Apple and Google on the EN Express notification. 2 nights ago, Google sent out to all Android users the opportunity to turn on EN notification. What this does is it allows individuals who were within that proximity that we described to be notified on their phone that they've had an exposure. This is totally anonymous. It's not fed back to the health department in any way. It's for an individual to understand that their phone was in the proximity of somebody else's phone who tested positive, and then they could seek testing or reach out to the public health entity and we can support them. So far to date, we have over actually 50,000 as of last night downloads of the COVID Trace app. We've identified, as of 2 cases, 12 exposures. We now are moving into a period of developing COVID as part of our normal infectious disease surveillance. One of the big wins that will improve public health in perpetuity is being able to fold COVID into a statewide disease management system. We did not have that prior to COVID. We had different systems that we used for different diseases and also geographically different systems. So our partners at the Southern Nevada Health District are working to build that statewide system. So like influenza, sexually transmitted diseases, foodborne illness, we will all be on the same system for COVID. That will allow us to transfer cases quickly between public health jurisdictions. A couple other things I'd just like to mention that are part of our long-term planning. We did get a good amount of funds through the CARES Relief Fund Act. That has supported hundreds of our staff for case investigation and contact tracing. And as you know, that ends December 30th. Luckily, we do have another grant called the Epi and Lab Capacity Grant, and that's through CDC that will run the duration of 30 months. So luckily, we will lessen the staffing that we'll have December 30th, but we do have a sustainable source of funds so that we can spend through that 30 months or at the time it runs out. We also keep a really close eye on hospitalizations. One of the challenges that we're going to be facing now through February, March is that we are in a period of dual influenza and COVID season. And so we really need to watch our hospitalizations closely. That's going to be a challenge. And so the messaging right now is to get flu shots so that we can hopefully keep our hospital capacity at a level where it can support COVID and not necessarily a really difficult influenza and COVID dual response. Vaccination in our state is a real challenge. We have the lowest vaccination rates for adults in the nation. That's for flu and other things. But as we look at how COVID vaccination could potentially be a game changer, our public health system and local leaders are trying to figure out how we increase both influenza and COVID at the time vaccination so that we can get this under control. And with that, I'll turn it back over to Director Cajun. He'll talk about our task force and additional response.
Thank you, Julia. I appreciate the update on that. Next slide, please. What we've attempted to do this morning is provide some context on where we are and where we've been here in the state in terms of both the infections from the virus as well as our response. I want to commend Julia and her team for all of the incredible work they've done on the contact tracing and the public health response to this in general. Obviously, the slide here shows a very small snapshot of the policy framework that we've used going forward. It starts at Directive 24, and I wanted to spare everyone a long dissertation on how we got to this point. As we all know, when the pandemic hit back in March, there was a declaration. There were a number of immediate mitigation measures resulting in a stay-at-home order that lasted for a number of months or weeks, and then a reopening that resulted in the slow climb that we saw back in July, August. So just jumping through those, what I think has occurred, the way I view it is following the declaration on March 12th of this year, what we've seen is an evolving response over time that has shown that has been based on what we have seen as effective through scientific input from the local, state, and federal level. The first major mitigation measure that was put in place after the initial reopening, which included baseline standards of the number of people who could be in gatherings and occupancy rates and so on, was the Directive 24, which required face coverings in most circumstances. This was late June 24th. I believe it was signed and it went into effect on June 26th and has remained in effect and will continue to remain in effect for the foreseeable future. For the foreseeable future. Again, in mid-July, we saw that great increase over time due to exposures and the climb, and Directive 27 was signed, which created the three criteria, which I talked about earlier, or a version of the three criteria I talked about earlier, and identified communities, 7 counties at the time, that had increased exposure risk due to those three criteria. They had met at least two of the three criteria, and that resulted in bar closures for those communities, again, based off of federal recommendations and what we were seeing throughout the country as well. Directive 30 rolled back Directive 27, and I realize this gets complicated, but again, this is an evolving process. Directive 030 created the COVID-19 Mitigation and Management Task Force, which Julia and I serve on with colleagues from throughout the state. And the idea of this group was to really take a targeted approach to not do industry-specific closures, to work with counties that met two of the three criteria, or at least two of the three criteria, and to work with their contact tracing teams to really look at mitigation and management measures that would address the community spread or the outbreaks that they were experiencing, instead of doing countywide in some of our, especially our larger counties. We were seeing it in the major populated areas, but not in other areas. So the mitigation task force reviews these criteria for each county on a weekly basis. We are now meeting every 2 weeks, so we'll meet again on Thursday, and we're working with the local health district or the community county leaders to determine what mitigation measures need to be in place if they are experiencing increased mitigation measures over time. Directive 33 was recently released as well, which changed the baseline standards from 50 people to and 50% occupancy across the board to 250 people following specific safety guidelines and procedures, or 50%, whichever amounts to fewer people. And then Directive 34, which allowed for youth sports and adult sports in some fashion to exist throughout the state. It's important to point out that from the beginning, this response has been federally supported, state managed, and locally executed, and local governments have had from the beginning and will continue to have the ability to put increased restrictions on gatherings or other aspects of community life within their counties, within their jurisdictions, if they believe that is necessary or will be helpful, and that is something that we are starting to see signs of happening as we are working through the task force. Next slide, please. So, Mr. Chairman and members, we're happy to answer any questions that you may have. And again, thank you for the opportunity to present here this morning.
Thank you for taking the time to present. And obviously, it's an incredibly dynamic situation. And I want to commend you and others in the state that have done a great job under very difficult circumstances. So thank you. I guess, thinking about the forum's mandate and having to look out a couple of years, you obviously have no control over a vaccine, which is an important piece of the puzzle here. But can you talk maybe a bit about the state's view on rapid diagnostic testing and, some of the mitigants that we might encounter along the way to a vaccine that would allow inbound economic activity? So, how do state folks coming here to start to return? Do you have any insight on that?
Absolutely, Chair Billings. I am happy to provide some operational input on that. Julia, if you're comfortable providing sort of what that arc looks like from the public health standpoint, I think you might be a better expert.
Caleb, I apologize. I got disconnected from the Zoom. Will you repeat the question for me?
Yeah, so let me answer. Go ahead, sir.
Please, go ahead.
Let me answer here, Julia, and then I'll tee it up for you. So the chair asked, basically, we are sort of the projection that the Economic Forum needs to make over the next couple of years will be impacted by the development of a vaccine. And so if I may restate the question, is how do we bridge to that vaccine? What are the rapid testing or other intervention measures that may be taken? And I'll just start by saying I think that what we have in place right now in terms of contact tracing, and again, this is Administrator Peak's bailiwick, but what she and her team have built has gone from literally a number of contact tracers that can be counted in the dozens to nearly 1,000 contact tracers and case investigators in the state that are rapidly working to identify tests. And what this does is, again, as you noted, if we have relatively quick turnaround of tests, and right now we're seeing an average of 2-day turnaround for tests statewide. That's an average. Of course, we understand that means there are higher and there are lower. But between public and private labs throughout the state, we're having 2-day turnaround. And that means that we can, through contact tracing case investigation, we can identify the number of contacts that are exposed really quickly, relatively quickly, much more quickly than we were before, and conduct interventions at that point. So strengthening and maintaining that capability is going to be very significant. The rapid tests that are being developed, whether it's the self-administered new test from Abbott that are rolling out to states around the country right now, or the clinically based Abbott or other rapid tests that are used for screening are in place now. They are in demand with limited supply and are often not as sensitive as PCR tests are. So what we are seeing or what we continue to see is technology or other solutions that are going to allow us to identify that more quickly. We've heard of some exciting examples. We've heard of some exciting technology here in the state of Nevada that's being developed for global use, and we believe that will continue to be a technological and scientific focus as we continue forward. And I'll stop there and turn it over to Julia.
Caleb, I think you covered everything. I would just add that vaccination will be a game changer in this, in addition to the rapid testing or point of care testing, as that gets better. These laboratory manufacturers are developing such amazing tools that will allow us to more quickly identify individuals. Key to our case investigation and contact tracing, but with all infectious disease like this, vaccination will be a game changer. And so at this point, we're looking at how do we increase vaccination, specifically major efforts right now with flu. So hopefully the efforts with flu will help our efforts with COVID. I do just want to recommend, again, the things Caleb and I repeat daily, that we know how the disease is transmitted. We also know how it's not transmitted, and that's through social distancing, masking, washing hands regularly, environmental cleaning. Those are all tools that have been improved and used to address COVID. Those remain in place. I think as we look at options for schooling, options for work, many of us are still telling us to reduce the spread. And so in addition to vaccination, all the current efforts that our community is taking is absolutely slowing and
Sure. Thank you. Yeah, from a community spread perspective, I understand. My question was more targeted towards how do we get people comfortable getting on a plane, and particularly for the southern portion of the state, coming here and inspire their confidence in our ability to allow people to safely gather, because that obviously will impact our projections, right? Particularly for gaming tax and certain other tourism sensitive taxes. But thank you very much. Anyone else from the forum?
Yes, can I ask a question? I recognize that I'm asking for sort of a guess, but if based on what you know and what you think might happen, what would be your best guess as to the rest of this fiscal year in comparison to where we are right now, as it relates to cases and testing and all of that?
So I'll take a shot at that first, Mr. Levitt, and Julia, if I misinterpret or misspeak or you have anything to add, please don't hesitate. So Caleb Cage, for the record, what would be my best guess going forward? What we're seeing right now is the current trend is that we are on an increase of cases here in the state. We need to see if that, of course, where the stealing of that trend is, where our and what the impact on our hospitals is going to be going forward. I think what we're also going to see is what we really hope is the case is that we are working in sync with local health authorities, local health districts, and county governments in order to identify mitigation measures that will have the least economic impact and disruption as possible in order to maintain critical hospital capacity and reduce the impact of the spread. So again, what I think we're experiencing right now is what's going on around the country, and that is a slow increase over time. It is yet to be determined what that, again, whether that will be a shorter curve over a longer period of time, a shorter curve over a shorter period of time, or otherwise. But until we have a vaccination, an effective vaccination, and in place, that's what I believe will continue to happen. Julie, anything to add?
I would just add that vaccination, again, remains a question mark for us. We were told by our federal partners to be ready in early November to start getting very limited vaccination. But it's yet to be determined when we could get that. Also, when there'll be quantities large enough to be given to the general population. Vaccination testing can change that when you're comfortable getting on a plane and going to larger events. If you get a result in 15 minutes, or larger events, specifically those that are 250 and larger. I've shared this in the past, but you're truly concerned about the people within the 6 feet around you. And so ensuring that your social distance, regardless if there's 250 people in that battle, social distancing and masking of the group around you. So I think that hopefully gives people comfort. The other thing is Nevada is doing a lot in the exposure notification efforts. And that's a technology that our residents and visitors and workers can use that can help them quickly identify that they've been exposed and take action. So I think Nevada is moving in a really solid direction for controlling COVID, but there are question marks related to vaccine and other things. But in areas that we can control, Nevada is doing really well.
Yeah, from a testing and contact tracing perspective, again, I really, for whatever it's worth, I would commend you and the state on doing a great job. It's under very difficult circumstances. So if there's no additional questions, anyone?
I have one question. This is Jen Lewis. I was curious what the messaging is going to be for the holiday season, if there's going to be any kind of specific, because to me that seems like a pretty ripe chance to transmit the virus, but I wasn't sure if there's a plan, what the plan is for. I know you guys have a plan.
Thank you, Ms. Lewis. Caleb Cage for the record, and again, Julia, jump in if you have anything to add. I think yesterday there was a press release from the governor's office regarding Halloween festivities, and we've seen a number of parades like the Nevada Day Parade and Veterans Day parades and those sorts of things that have been postponed, as have of course large events and otherwise. I know that right now there are in the guidelines for safe gatherings in the state, going off the top of my head, the guidelines for indoor gatherings are recommended to be at fewer than 10 people, and for outdoor gatherings to be, these are family gathering type events that would be around holidays, or outdoor gatherings are fewer than 25 people. So those are sort of where we're at on the messaging right now. I know, I believe it was Dr. Fauci yesterday or the day before started talking about things like Thanksgiving and other wintertime holidays that are coming up, those being concerned. So again, making sure that we are following CDC guidelines on number of gatherings, and then the messaging would also include, as Julia has pointed out a number of times, download the app, practice social distancing, and wash your hands and communal areas. And if you are symptomatic or believe you've been exposed to somebody who's symptomatic, go get tested. Julia, anything to add on what the messaging would be?
I think that was perfect. The only other thing I'll take the opportunity to add is that one of the challenges with COVID is we see people take really great mitigation efforts around strangers among patients if you're in a healthcare setting, among patrons if you're in a business. But as you get together with either your coworkers, with people carpooling with your friends or with family members, the level of comfort goes down and your mask probably comes off and your distance lessens. And so that's probably a message that I think we should, there's a false sense of comfort in those settings where it is family, friends, coworkers. So masking and social distancing will remain the way to address exposure. But that is a challenge as we look at spread right now.
Thank you.
Great. Well, thank you very much for taking the time today. Really appreciated it.
Our pleasure. Thank you.
Russell, shall we carry on?
Thank you, Mr. Chairman.
Jen, broadcast.
Go ahead,
I'd
Jen.
like to take a brief look to see if we can resolve the screen share issue before we move on to the next item.
Mr. Chairman, if that's okay with you, if we could just sort of sit in place for a bit and see if we can get this resolved. We're still having issues with regards to some of the participants being able to see the slide decks.
Everyone on both the presenter Zoom call and the member call, as well as in the Carson City room, able to see the Nevada Legislature's website?
Yes.
I'm getting thumbs up in the Zoom.
This
Mr.
is
Gaines,
room
can you see
4100, yes.
that? Okay, great. I believe I'm going to stop this share now and we should be good to go. Thank you very much for your time.
Thank you, Jen. Mr. Chairman, then I think with the conclusion of Agenda Item 5, we can move on to Agenda Item 6, which is presentation on the federal coronavirus and aid provided and its use to mitigate the impact of COVID-19 on the residents, businesses, and the state budget. So with us for this agenda item, we first have Leslie Molenkamp, Budget Officer from the Governor's Finance Office. And then after that, we have Mr. Jeremy Aguero, a principal with Applied Analysis. And so, Jen, they can share their screen, or is it just best that I bring it up here from the witness table?
I think we'll go ahead. This is Jen again. We'll go ahead and let them share, make sure that works. We should be good to go.
Okay. So, Ms. Molenkamp, if you can try and share your slide deck, and we'll see what happens, sir.
Okay, can you see my screen okay?
We can in 4100. Can the members see it, which is the most important?
We are good here. You may proceed. Thank you so much.
Okay, perfect. All right, good morning, Mr. Chairman and members of the Economic Forum. My name is Leslie Molenkamp, Executive Budget Officer and Coordinator for the Coronavirus Relief Fund for the State of Nevada Governor's Finance Office. I have on the line with me today, Director of the Governor's Finance Office, Susan Brown, as well. And we are here today as a resource to give a high-level overview of COVID-19 federal aid received by the state of Nevada. Jeremy Aguero from Applied Analysis will be following to provide more in-depth details as well. So when funding came in, it was very fast, and there were 4 federal bills that were passed in 6 weeks, worth almost $2.9 trillion. And we're not going to talk about the trillions that came in, but instead we are going to focus on what Nevada received, which we currently estimate at $20.8 billion as of October 1st. So the first bill, first act that came in was the Coronavirus Preparedness and Response Supplemental Appropriations Act 2020, and this was passed on March 6, 2020. To date, approximately $8 million has come into Nevada, mostly aimed at public health and medical response. So the second act passed was the Families First Coronavirus Response Act, and approximately $401 million has been received in Nevada. And most of this funding centers on paid sick and family leave, free coronavirus testing, expansion of unemployment benefits, food assistance, and additional protection for frontline health workers. The third act passed was the big one, and this was the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act. Nevada has received approximately $17 billion from the CARES Act, with the largest amount of assistance going to the Paycheck Protection Program. It also went to aid businesses, healthcare, farmers, airports, and transit agencies. It also went to funding for education and childcare, and two of the biggest allocations were for cash payments to individuals and increased unemployment benefits. The fourth and the final federal act to date that has passed is the Paycheck Protection Program and Healthcare Enhancement Act. Nevada has received approximately $92 million of these funds since its passage in April. And this act increased funding to the Paycheck Protection Program. It provided additional emergency economic injury disaster loans. It expanded lab capacity for COVID testing, and it provided additional funding for hospitals and COVID testing, including for rural health clinics. So we'll be showing you a breakdown of how all of this is categorized in a moment. But if you are doing the math now and you're adding all those up together, you're going to see that we have an amount of approximately $3.27 billion that's not showing up here in this breakdown. And it's not shown here because it is the amount of programs that have been funded by multiple bills or other federal sources. So they've been funded by several bills or from different areas. So we just wanted to point that out. So now let's take a look at the breakdown of the funding received in Nevada. So as stated earlier, Nevada's share of COVID-19 federal funding from all four of the federal legislative acts is estimated to be $20.8 billion. Here is a breakdown of what funding was received in Nevada. And taking a look mostly at the pie chart here, you can see the biggest piece of the pie is from the CARES Act. It's approximately 82% of the total COVID-19 federal funds received. We've listed here the federal COVID-19 funding by category. And you can see that the largest amounts of federal funding have gone to economic relief at $12.2 billion, unemployment relief at $5.8 billion, and disaster response at $1.3 billion. So since the CARES Act dollars are the largest part of the funds we've received so far, we are going to take a quick look at the CARES Act funding in Nevada now. So as you recall, most of the federal aid came from the CARES Act, and Nevada's share is estimated to be $17 billion. To give a little bit of background perspective on this, this again is estimated to be 82% of the total funding received that we know of. We've highlighted here that approximately $9.7 billion or more of the CARES Act funds have gone directly to entities within Nevada. And this includes direct payments to individuals through the Economic Impact Aid to Individuals. It also has been as direct payments to small businesses through the Paycheck Protection Program. So those two areas in particular have been direct payments to individuals. It is important to note the state was not involved with this direct funding. It went straight to recipients, and we wanted to highlight that. So moving on to where those funds are going, we provided some highlights here of a few major CARES Act allocations. And Again, you can see that an estimated $2.56 billion was for economic impact payments. An estimated $2.1 billion was for Small Business Administration economic injury disaster loans. Approximately $4.21 billion went to the Paycheck Protection Program. And we have listed here as well $1.25 billion that was provided to Nevada as part of the Coronavirus Relief Fund for disaster response. Now, much of the CARES Act dollars have come in directly to our citizens, our hospitals, airports, and other places. But we do have here on this slide a snapshot of the dollars that have come in directly to state budget accounts. And you can see here that approximately $1.19 billion has come into the state through approximately 26 different federal programs. Each of these programs vary in their duration as well as their uses. And we are finding that several programs have the same allowances. So deciding which fund to use first is paramount because they have the different durations as well. So various state agencies are managing these funds, and we are working with a wide range of federal partners. And you can see on the slide, we've listed the acronyms for some of those federal partners that we are working with. There is no single federal resource available where you can find this information collected in one spot, which is a bit of a challenge. Each federal agency manages its own program and provides information very specific to only the program it manages. So it is a bit of a puzzle at times putting the pieces together. So as far as the programs, we're going to take a look really quick here. You can see that all of the programs that received COVID-19 funds that went directly to the state's budget account, those are listed here. And if you take a look on the top left corner, you can see that the largest amount on this list is the Coronavirus Relief Fund, or the CRF. And that allocation was $836 million. These funds are for disaster response for the state and smaller local governments as well, and we will be covering this next. So the Coronavirus Relief Fund, or the CRF, it was the largest amount of federal CARES Act dollars received directly by the state. And to get into a little bit of background and detail about this, Title V of the Social Security Act, Section 5001, created the Coronavirus Relief Fund. Legislation provided how the fund was to be appropriated and the amounts that would be paid to each state, larger units of local government, the District of Columbia, U.S. territories, and tribal governments. Nevada's total appropriation was $1.25 billion based on population. This was the minimum payment amount that a state could receive. Local governments with populations over 500,000 could elect to receive their portion of the allocation as a direct payment from the Treasury. And Clark County and the city of Las Vegas have higher populations that meet that threshold, so they were eligible and they chose to take their portion of the funds directly on behalf of their populations. The state of Nevada received the rest of the allocation, which, as you remember, was the $836 million amount. And of this, $148 million went to local governments outside of Clark County with populations of less than 500,000. The allocation breakdown is presented here for your reference. And you can see here that Clark County received $295 million directly from the Treasury for it on behalf of its population. The city of Las Vegas received $118.9 million for its population. And then local governments outside of Clark County were allocated the total that I mentioned before, $148 million from the state's allocation. And then, of course, the remaining funds for the state to use for eligible purposes was $687.5 million. Now, the legislation also provided how the Coronavirus Relief Fund was to be used. And there are three main rules that govern the use of the Coronavirus Relief Fund. The first one is that expenditures must be necessary due to the COVID-19 public health emergency. The second rule is that costs must not be accounted for in the budget that was in place as of March 27th, 2020, when the CARES Act was passed. And the third rule was that funds must be used for costs that were incurred from March 1st, 2020 through December 30th, 2020. And we are currently working diligently to ensure these funds are spent for eligible uses by this date. It should be noted that the Treasury also provides additional guidance on the uses of the fund, and that's through two main documents. There is a guidance document and a frequently asked questions document. These have been updated 7 times in the last 5 months, and the most recent update we had was in early September. So the use of these funds is constantly evolving, and we are staying on top of all those changes. So our last section we will cover is where the state is at with spending the Coronavirus Relief Fund. So let's take a look at where we are at with expenditures, obligations, and remaining funds. So here, as of October 1st of 2020, you're going to see that on the left-hand side of this screen, you're going to see what has been approved and finalized as far as the use of the Coronavirus Relief Fund. Approximately $556.4 million have been approved and finalized for expenditures using the Coronavirus Relief Fund. On the right, you're going to see what is currently pending, which is $278.8 million. Again, this is allocations pending or in process. And if you take a look at these two figures, we're going to give you the bottom line amount here, which is what you're seeing is that we have about or approximately $842,000 that is not allocated in some manner. However, it should be noted that this could be impacted by congressional changes or changes to the Treasury guidance. So these are definitely targeted amounts. They're not set in stone, and the final allocations may be impacted by any upcoming changes. So with that, that does conclude our presentation. Before I turn it over to Jeremy Aguero from Applied Analysis, I do have Director Susan Brown of the Governor's Finance Office on the line with me to answer any questions you may have.
Craig Billings here. Thank you so much for that. Very helpful. Your presentation didn't really speak to the cadence of this money and the timing. I guess I infer, just based on watching the news, that much of this was front-end loaded. So if you think about the process that we have to go through of trying to forecast activity within the state, the impact of many of these programs feel as though, pending further congressional action, they are in fact tailing off. And it seems as though that's the case from the last slide that you had where the unallocated amount was quite small relative to the total. Do you have any commentary on how much firepower is left, if you will, and how dependent we are on that further congressional action?
This is Leslie Molenkamp. I'll probably speak to that first and then see if Director Susan Brown has anything to add. I can say that we definitely have been managing these funds as though they will, the use of them will end on December 30th, 2020. Because it is an ever-changing environment, and it has been through the summer, we have had indications at points in time that there may be a different uses available of the fund, or that it might be extended. But at this point in time, we definitely are managing it as though these funds will no longer be available after December 30th, 2020. We are prepared, though, to respond should anything change on those, but we are also prepared to spend every last dollar should this not be extended, or if there are not any additional allowances that are provided in the future.
Can I ask a question about, if I understand your presentation properly, it appears that the state has received money for offsetting expenditures relating to the virus, but has not received any money in direct payment for revenue losses experienced as a result of the virus. Is this correct?
This is Leslie Molenkamp again. Yes, that is correct. One of the main rules of the use of the Coronavirus Relief Fund, and I believe this carries over to a lot of other federal programs that we've received aid, is that it cannot be used for revenue replacement. That is one rule of the use of the funds that is a solid, is very directly stated.
Thank you very much.
Mr. Chairman, this is Russell again, and if there aren't any other questions to members, then if it's okay with you, we can allow Mr. Aguero to attempt to bring his slide deck up and proceed with his presentation under this agenda item.
Please, thank you.
Mr. Chairman, good morning. For the record, my name is Jeremy Aguero with Applied Analysis. I'd like to first extend my thanks both to you and the Legislative Council Bureau for the opportunity to present to you today. I'd also like to extend my gratitude to both Director Brown and Ms. Molenkamp for the remarkable job that they have done in reporting information in terms of the federal stimulus. My job today, or what was requested by Mr. Gendon today, was to provide a little bit of background, a little bit of additional information relative to how those federal stimulus dollars are affecting the collection generation of general fund revenues in the state of Nevada. I'll be relatively brief, but be happy to answer any questions. I'm not going to go through what Ms. Molenkamp already did, although her analysis is the precursor to my analysis. And so we're talking about $20.9 billion that has made its way or will make its way into the state of Nevada, which is fairly significant overall. I think it's important to point out that if we look at real domestic growth in gross state product between the first quarter and second quarter of 2020, our state is down 42.2%, which is the highest rate of decline relative to gross domestic product, annualized gross domestic product, anywhere in the United States, tied with Hawaii. Obviously a function of our tourism-dependent economy, but nonetheless pretty significant in terms of the magnitude that we've seen in decline in economic activity by comparison to the declines that we've had in revenues generated at the state and local level. Annualized gross domestic product on the left-hand side for all industries for the state of Nevada, and the relative drop that you see, that's enough to put us in last place. And on the right-hand side, I've shown the decrease in the leisure and hospitality industry, which, as everyone here is very well aware of, the important role that it plays overall in our economy. COVID-19 has impacted us substantially. The thesis that I'm providing here is that the stimulus funds have masked the magnitude of that decline, both economically and fiscally in some ways. Federal stimulus amounts to roughly 11% of Nevada's pre-COVID-19 GDP, as it did for the nation as a whole. The idea of the stimulus was to allow the nation and our state to hit the pause button, if you will, while we got to the other side of the COVID-19 crisis. Once we started coming to the other side, the idea being that our economy would pick back up. Obviously, the big question is whether the COVID-19 crisis is going to cooperate relative to that plan or whether there'll be additional stimulus. So GDP decline is $25.4 billion. Federal stimulus is $20.9 billion. You get the general idea in terms of the offset. This is the CARES Act funding allocation. I'm just using this as sort of a way to guide our conversation. For a moment, there are many different elements associated with that funding. I will start by just talking about the stimulus checks and unemployment insurance or direct payments to consumers that are buoying or bolstering, however you want to think about it, their spending activity. I think it's important to understand the order of magnitude of the CARES Act, just how much money was pumped into the United States economy. This is United States disposable personal income year-over-year growth on a month-by-month basis. If we look at the CARES Act, it generated about $2.8 trillion, or roughly 3 times the level witnessed during the Great Recession relative to disposable income increases as a result of direct payments to individuals. It's unprecedented in modern United States time, and it was designed to do exactly what I mentioned a moment ago. Obviously, those numbers have started to come down as the amount of stimulus works its way to actual consumers and is reduced from that initial inflow of capital, those direct payments to individuals, but nonetheless, huge increase overall. The way the United States did that was by essentially putting more money into domestic circulation. This is the M2 money supply and the year-over-year percentage growth rate. Again, you get the idea. The United States government created the stimulus by putting more money into domestic circulation, and by doing so increased total disposable income of United States consumers, something that will not be sustainable in going through time. The fundamental question that's before us today is, what did consumers do with that money, and what do we expect them to do with that money on a go-forward basis? Some have spent, others have saved. Obviously, the majority are somewhere between those two. The United States personal savings rate is shown on the left. The year-over-year change is shown on the right. You can see that the savings rate increased dramatically and has come down significantly since that point. The reason that it increased so dramatically is we gave people a lot of stimulus payments, but they didn't have a lot of things to spend that money on. I think it's important to note that not only do we provide stimulus payments, but then those stimulus payments were at least ostensibly designed to provide relief to making sure people could pay their bills, put food on the table, those type of things. There were also bills that they were no longer required to pay or didn't have to pay in under some circumstances. Obviously, things like utility bills were delayed for many people, as well as things like the moratorium on evictions or people delaying mortgage payments, for example, would have offset the amount of those expenditures and would have caused increased flows into disposable income or spending income among those consumers. You can see the differential between the average levels and the current levels on the screen. Those personal expenditures, consumer personal expenditures at the United States, you get kind of a sense of what the trend has looked like. A dramatic drop down, followed by an increase overall, $12.1 trillion from February 2015 in terms of that growth rate, and then you see kind of where we are today. Our level of expenditure is roughly the same as where it was 5 years ago. The household spending of stimulus, even though we brought more money in, where has that money gone in the state of Nevada? This is from the United States Bureau Pulse Survey for the week ending September 28th. It's the last available data in terms of how the stimulus payments were used around the United States and in the state of Nevada. 77% of those households reported using those money for mostly household expenses. And how those households use that money is on the right-hand side of our chart. Food, utilities, household supplies, rents, vehicle payments, and the like are significant. And those are suggesting that it's sustaining our consumption overall. There was another question that was generally asked about how households used those funds over the past 7 days to meet spending needs. Where were they getting that income from? Regular income, savings, credit card loans. I'll just highlight for a moment stimulus payments and uninsurance payments, which suggested that as much as 1 out of every 5 households were using some type of stimulus just to meet housing needs during the worst portion of the economic downturn. There's also United States data on unemployment and recipient spending that also supports the conclusion that unemployment payments and direct payments to individuals have buoyed things like taxable spending throughout the United States and most certainly here in the state of Nevada. This is the change in spending among unemployment recipients. It's for the United States. Unfortunately, we don't have these data for Nevada. This is a number of different categories. I'm just going to gray out apparel here for a moment, gray out everything but apparel for the moment. You can see that what happened with the growth of things like apparel until the additional $600 began. You can see the growth that happened after that, and then what has happened once the $600 expires. We believe the same trend is happening here in the state of Nevada. This is our taxable retail spending in the state of Nevada. These are trailing 12-month totals, $63.3 billion as of February 2020 prior to COVID-19, $61.1 billion as of July 2020 in terms of trailing 12 months. The federal stimulus accounts for about 32% of Nevada's pre-COVID-19 taxable spending. The decline that we've seen thus far in taxable spending is about $4.2 billion, and the stimulus is $20.9 billion. There is little doubt that the stimulus is significantly offsetting the declines that we would otherwise have had in taxable retail sales. To put a bit of a different emphasis on this is taxable retail spending in inflation-adjusted terms for the state of Nevada during the Great Recession on the left-hand side, during the current recession on the right-hand side. Of course, during the Great Recession, our unemployment rate in the state of Nevada increased to 13.9%. By way of comparison, our unemployment rate during the current recession increased to 30.1%, and our taxable retail spending has actually been higher in inflation-adjusted terms. Again, what's the explanation for that? We believe it to be stimulus propping up consumer expenditure activity. This is taxable retail sales in terms of the share of total. I've just taken May through July, the last 3 months that are available. Food, service, and drinking places, which includes the majority of spending at hotels and casinos, is obviously the largest share of our total. Vehicle parts and dealers. And now I'd like to show you, this is 2019. This is what those same data look like, but for the last 3 months in 2020. And you can see that there's been a fairly significant shift. You see that the first two, just as an example, food services and drinking places declined dramatically in terms of its share. Motor vehicle parts and dealers increased. At the bottom of my chart, you will also see a substantial increase in non-store retailers. This is the Amazons of the world and the others that are non-stores, but we purchase things from, and retail sales and use taxes are generated. Those substantial changes in things like motor vehicles, building materials, and gardening equipment, non-store retailers are a shift that we believe are notable and going and projecting over the next couple of years. In addition to that, I'd like to point out a couple of, I think, important elements. This is Nevada taxable retail sales growth, the top 10 sectors through the last 3 months available in 2020 compared to the same period of 2019. You can see that non-store retailers have increased dramatically, as have a number of other categories. The overall growth rate during this period is actually down at 9.8%, and yet somehow consumers are continuing to spend significantly more on things like building equipment, motor vehicles, and general merchandise stores, while you see that others are actually declining. These shifts in spending, we think, are important and will largely inform how taxable retail sales will perform. Another example of this shift is in gross gaming revenue. Gross gaming revenue as of August 2020 was $743 million. That's roughly the same amount of gross gaming revenue we generated in the state of Nevada in 2003. There are obviously other effects that we've seen take place overall in terms of this trend. I will not go into all of those now, but clearly a substantial effect relative to even the trends that we saw going into the COVID-19 crisis relative to where we stand today. Again, another indication of where we are from a stimulus spending. This is a chart that I like to show to demonstrate that. On the left-hand side is the the month-over-month change in gross gaming revenue for the Las Vegas Strip, which is down 39.2%. By way of contrast, the Las Vegas locals market was actually up last month by 10.3%. Again, this was something that would be very unusual historically. What explains it is an unprecedented amount of stimulus getting into the hands of consumers, compounded by the fact that there's, there's a limited number of ways those consumers can spend that money. Direct payments to individuals. Of course, we have the payments to businesses, mainly small businesses, in the way of the Paycheck Protection Program, commonly referred to as the PPP, another $4.2 billion overall. If we look at the Nevada Paycheck Program and the summary of loans, there were roughly 46,000 loans that were issued. Most of those were small businesses. And before I go through each one of these, or instead of going through each one of these, I think that it's important to point out that about 46,000 businesses were covered and about 430,000 jobs were covered. This is effectively a grant to those businesses. It is keeping many businesses in Nevada afloat today, and is certainly dampering the impacts we would otherwise have expected to see as a result of the COVID-19 crisis. Obviously, things like our primary source of revenue from businesses, the payroll tax, the modified business tax, as it's properly referred to. These are gross wages and salaries. We don't have a huge amount of data, but the PPP is covering around 33% of all the jobs in Nevada and 35% of wages and salaries. Again, we think this will last a bit longer than the direct payments to consumers because of its nature and because of the way that businesses are managing it. Nonetheless, incredibly important relative to the offsetting effect it will have on our consumption. Beyond that, there are a number of other allocations, the coronavirus relief funds, other work programs, transit dollars, and the like. These are all flowing in to our communities. The state approves $29 million for coronavirus relief funds. I just asked my staff to find one of the articles. I know you're going to hear a number of these. We are finding ways to bring more money and put the dollars we're receiving from the federal government to the economy. Those are being allocated in any number of different ways. This is the allocation of just the coronavirus relief funds, not only at the state level, but to the local government level, appropriately allocating those funds in accordance with federal guidance. That having been said, these are funds that governments have used in different ways, some more aggressive than others in terms of ensuring that wages and salaries are paid, or that the functions of government are continuing to act in their normal course. I think it's important to note that there's a ripple effect associated with it. Yes, governments pay relatively little in terms of taxes to one another, but they pay a significant amount of money in terms of wages and salaries. Those wages and salaries go back to the neighborhoods of those employees and are spent in restaurants or doctor's offices or grocery stores, many of which also generate taxable retail sales. The policy considerations that the state of Nevada has put forward are affecting those revenues, affecting how they're ultimately used, and I would suggest will also be an important factor in moving forward. With that, Mr. Chairman, thank you again for the opportunity to be here, and I'm happy to answer any questions that you or the balance of members may have.
Craig Billings here. Thank you very much. Really appreciate your time and efforts. I actually don't. I thought it was a very well-constructed presentation, unfortunately confirming some of the things that I thought would be the case. So I don't have any questions. Does anyone else from the forum?
Jeremy, real quick, if I heard you correctly, there is still PPP money flowing out into the economy. When do you see that tapering off or running out?
Mr. Stressley, I want to correct that in terms of what I said. I don't believe that there are still money flowing in from the federal government into the PPP, but rather from information that we have in terms of how much of those dollars have been spent already, that continues to be held, a significant amount of that continues to still be held today by those businesses. We believe that those funds will probably carry us through the first quarter of 2021. It's hard to fashion a model that takes us much further than that.
Thank you.
Jeremy, As you all know, come the part of December, we have to make projections as to state revenues for the rest of this fiscal year plus the 2 fiscal years. I have great respect for your opinion. I wonder if you could give us, if you had to do this, what economic assumptions would you make for these periods of time?
Mr. Levitt, thank you for the kind comment. I'm very concerned about 2021 and 2022. The models that we're operating on make the assumption that we will have a vaccine generally available by the first quarter of 2021, and that vaccine will be widely available within the next 12 months. We also make the assumption that our economy, the nation's economy, will be able to adapt to living with COVID-19 as opposed to simply waiting for a treatment or a vaccine to become available, and that will allow us to ease up. That having been said, Mr. Levitt, the combination of diminished stimulus going into 2021 and the reality of our tourism-based economy, which has done I think a pretty good job of finding ways to mitigate this challenge, but at the same time has to deal with the fact that roughly 16% of all the visitors are convention and meeting travelers. Those are going to take some additional time to come back. 14% of visitation is our international travelers. Those are going to take some time to come back. I know you're going to have other presentations that deal with all of that, but going into 2021, I think we have to be looking at an elevated unemployment rate. We have to be looking at reduced stimulus and a continued economic downturn that we're going to be facing. Do I think it's going to be the full magnitude of what we faced over the past few months when our economy was essentially shut down? No, I don't. But it is the long arc of the COVID-19 crisis that keeps me up at night. I am much less concerned about our economy operating at 25 or 30% of its productivity for 3 or 4 months than I am our economy operating at 70 or 80% for 3 years. And I think that is very much the potential of what we could have as a result of COVID-19 as we try to regain our footing for an economy that is, all due respect, all the remarkable work that's been done around economic development, and it has been remarkable. We remain the least diversified economy of our size in the United States today, and the vulnerabilities associated with that are going to be problematic. Mr. Levitt, beyond that, I think when you start to look at how consumers are going to consume, what type of jobs are going to come back, how long small businesses can remain sustainable, and then on the other side, the potential demand on public services associated with the increased instability among the social network that we have, the increases in homelessness, housing instability, our ability to get schools back up and running. And I think the pressures on state and local governments are going to be dramatic for the next couple of years. And so, I would certainly urge you to be conservative in your outlook.
Thank you.
Members of the Economic Forum, Chairman Billings informed me that he had to step out and take care of an urgent business matter. So he directed me as staff to keep the agenda going. So are there any other questions for Mr. Aguero with regards to this agenda item? I'm not seeing any. Thank you, Ms. Mullenkamp, Mr. Aguero, for your presentation and information on this agenda item. With that, then, I will ask the members that will move on to agenda item 7. And this agenda item is the presentation on the rental assistance programs for residents and businesses funded with coronavirus federal aid. And with us today, we have the State Treasurer, Zach Conine, and then Steve Akoff from the Nevada Housing Division of the Department of Business Industry. And I see the treasurers already have his screen up. So, Mr. Treasurer, if you are able to share your screen, and I see it's already up. So thank you, Mr. Treasurer. And I will turn the mic and camera over to you. Thank you.
Thank you very much. Good morning, everyone. I'm Zach Conine, your state treasurer, and I'd like to thank our team who is handling the technology aspects of the presentation so as to make sure that it works. I'm here to provide the committee with a brief presentation regarding the Commercial Rental Assistance Grant, or CRAG program. CRAG was a CRF-funded program our office worked on alongside the Governor's Office of Economic Development and the Department of Business and Industry. As a little bit of background, on July 29th, the Interim Finance Committee heard and ultimately approved the Commercial Rental Assistance Grant Work Program, which allocated $20 million of the coronavirus relief funds that you heard about earlier to the Governor's Office of Economic Development to put together a commercial rental assistance grant program, which is aimed at supporting Nevada's small businesses and nonprofits negatively impacted by the pandemic. A working group comprised of leadership from my team, GoEd, B&I, Business and Industry, designed the program and is working alongside a vendor, National Development Corporation, in order to implement that program. From an eligibility perspective, eligibility requirements were listed on page 53 of your materials, but in short, the program was aimed at Nevada small businesses and nonprofits who employed 50 or fewer full-time employees and who had lost revenue of more than 30% as a result of the pandemic. As noted on page 54 of your materials, program information was publicly announced on August 10th, and applications opened on Monday, August 24th at 8 a.m. The applications were supposed to close Monday, August 31st, but we decided to keep it open for another week to give businesses more time to apply. We also made some changes in eligibility along the way, and I think you heard this a little bit earlier on, but as new CRF guidance has come out from the feds, we're also working with other states, cities, municipalities, counties around the country to look at best practices. And so one of the best practices we've realized is that making these applications easier, requiring more attestation and less documentation, is more effective at getting the dollars out the door. And this makes sense, right? When you've got small businesses dealing with all the crises they're dealing with right now, the easier we can make it for them, probably the better. And you'll see as programs go on, either from our office or from the counties or the cities, they're typically trending away from complexity and more towards expediency. During those changes, we extended the deadline, as I mentioned. We changed the standardized award to flatline it at $10,000 for all businesses, regardless of size of revenue loss, and we removed the requirement that entities must not have received more than $5,000 in Paycheck Protection Program or other funds. Again, originally the intention was to get those funds to businesses that hadn't been able to take advantage of other programs, but as we found, some businesses had taken just a small amount of PPP, and to Mr. Aguero's point, wasn't enough to get them through the entire process, so they needed additional help. As noted as on page 55 of the materials, the application was split into two phases, with the initial eligibility applications submitted by that Tuesday, September 5th at 5 p.m. date. Applicants who submitted a pre-application and were approved to move forward then collected the necessary information and documentation to verify eligibility. Documentation was due on September 23rd by 5 p.m. If you go to page 56 of the materials, you'll see that the program received a total of 831 fully submitted applications, with an additional 33 applications that did not meet the deadline and which were manually processed by our staff. Most of those were due to technology issues or emails going to an applicant's junk folder, things like that. And in general, with all of the state programs, we've gone as far as we can to be flexible with businesses. Deadlines are not hard deadlines. We're attempting to try and get as much money out the door as possible. As of yesterday morning, 648 of that total 864 have been approved for CRAG funding, totaling just under $6 million, $5,967,782.12, if we want to speak in Treasury terms. Approval emails and instructions for landlords are currently being sent out by the vendor. 69 of the 864 were denied, most often due to an inability to substantiate the minimum required revenue loss of 30%, or the applicant being the owner of the building rather than a tenant. This program was originally designed, of course, for the dual purpose of rental relief and landlord relief. These payments went directly to the landlords. So in some circumstances, instead of it being a rental situation, it's actually a mortgage situation, right? Where perhaps the business and the building owner are the same person with separate entities. And that wasn't the intent of the program. So individuals who are in that situation were denied. The remaining applications are pending final review and approval. They often have something else going on that we're trying to sort out. And so we're working directly with the applicants to clarify or get additional information. There's additional slides in the deck covering additional details and data on the CRAG, such as location, number of employees, whether or not they received other funding support, and more in interest of the committee's time and the agenda you have in front of you. Happy to go through any questions there, but we don't need to go through each of those slides unless you'd like to. Happy to answer any questions that we have. Thanks so much for having us here today.
This is Russell Gideon at Stats of the Forum. Are there any questions for the State Treasurer, Mr. Conine?
Yes, it's Craig Billings here. Thank you so much for the presentation. Can you also, could you kindly also talk to kind of the cadence and timing and tail of this program and how much duration do you think is left with respect to some of this assistance? Just trying to get a sense for how it will bridge into 2021 and beyond.
So by intention and given Treasurer Conine for the record, sorry about that, Chair, nice to see you. Given the nature of the funding from a CRF perspective, none of this will tail into 21. All funds will be expended through this program, I expect, by the end of this month, maybe tailing slightly into November. But there won't be any funding moving into the next year on this or any of the other CRF economic dollars that you're seeing, coronavirus relief fund dollars that you're seeing under current federal guidance. Now, the Congress gets together and passes a bill, changes that deadline. It's in basically every draft that's come from either side of the aisle. So I think if an additional stimulus bill is found, extensions of time will be part of it. But I don't know that anyone thinks that that's a high likelihood right now. Certainly the market doesn't.
Thank you. Any additional questions? Okay. Russell, back to you.
Thank you, Mr. Chairman. For the record, Russell Gideon with the Fiscal Division. So we'll move to the next agenda item is agenda item 8, which is the presentation on the Southern Nevada residential and non-residential construction outlook. And this will be presented by Brian Gordon, who's a principal with Applied Analysis. Whoops. Oops, sorry. Mr. Eckroth, sorry, I apologize. I was trying to take care of too many different electronic devices. I apologize, Mr. Chairman.
No problem, Mr. Grannon. I'll defer to the treasurer he's been absolutely involved in this process. So if he would like to provide an overview first, and then I can provide some details.
Thanks, Steve. If it's all right with the chair, we can give a little bit of overview on how we got here, and then Steve has some updated numbers.
Please. Thank you.
All right. So as we know, Nevada has been one of the hardest hit states during the COVID-19 pandemic, as thousands of workers across the state have lost their jobs and have suffered reductions in pay. Now, we know from the last Great Recession that housing instability leads to economic instability, right? For all the reasons why we think it would. And so our office has been very focused on trying to find ways to avoid that secondary effect of economic instability through housing instability. Additionally, as we're asking Nevadans to stay home for Nevada, we need to make sure that they have homes to stay in. So we started working on rental assistance relatively early in the process. You just heard about some of the commercial rental assistance, but the residential program is obviously much more significant and much larger. To date, we've created something called the Coronavirus Housing Assistance Program. It's a statewide program administered by different agencies in different parts of the state. In Washoe County, it's administered by the Reno Housing Association. In the rurals, it's the Nevada Rural Housing Association. And then in Clark County is administering it through a series of 14 different community partners, all working to get rental assistance out on the street within their populations. To speak scope, thus far. There was $30 million that came in from the state from our coronavirus relief funds. That was split up to $20 million to Clark County, $5 million to the Reno Housing Authority, $5 million to the Rural Housing Authority. Additionally, Clark County put $30 million into that program, so that's a total of $50 million in Clark, and an additional $10 million went to support the eviction mediation program, which most of which we believe would be deployed in Clark. So from a scope perspective, about $60 million in Clark. Rural is still working on their original $5 million allocation. In Reno and Washoe County, there was $5 million from the state, plus an additional $2 million from the city of Sparks from their coronavirus relief fund allocation, and $1.5 million from the city of Reno, for a total of $8.5 million in Washoe County. Based on current trend, it seems like Washoe is probably going to go through a lot of that money, maybe not all of it. Rural will probably go through a lot of that money, maybe not all of it. And then, of course, given that it has 75% or so of the population, we expect the need in Clark County to exceed the money is available to it. So in total, about $73.5 million out. Now, to speak to size and scope of the problem, we've heard a little bit of this before, and I think you'll hear a little bit more of it. The housing instability problem in Southern and in all of Nevada is significant. Aspen Institute recently published a report saying that about 140,000 households are at risk of eviction by Q3 of this year, which goes up to about 180,000 households are at risk of eviction by December. Now, we've got a strange kind of confluence of events. The governor's eviction moratorium expires today, but in addition to that, there's a CDC moratorium preventing eviction for non-payment of rent for a majority of Nevada families. It's not everyone, but it's a majority of Nevada families won't be able to be evicted if they avail themselves of the CDC program. That CDC eviction moratorium currently goes through the end of the calendar year, and then so evictions could theoretically start at the beginning of the year. And now the problem is, amongst other problems, I suppose, one of the problems is that all of the dollars used to spend for these rental assistance programs also expire on 12/30. So we have an unfortunate confluence where evictions will be able to start at the exact time that we run out of federal dollars or run out of flexibility to use federal dollars to support them. So we've been working to try and get those dollars out early, to use it more as a preventative method as opposed to a someone at risk of eviction method. And to that end, we have, as I discussed with the commercial program, shifted the requirements and the processes around rental assistance to try and make them easier. To that end, we've moved towards an attestation method. The easiest way I can describe that is one of the requirements is that you say that you've been impacted by COVID-19 in order to access coronavirus relief funds, right? That's one of the triggering points. Additionally, you needed to show under this program that you had liquid cash assets of under $3,000, that you met certain area median income thresholds. And so we moved to an attestation level. So instead of needing the person to send us all their bank records and then go through those bank records to make sure that they're compliant, we're instead having them attest that they fall within the compliance, and at the same point, we're kind of retaining audit rights and the ability to go back under penalties of perjury to make sure that they actually do. To give you a scope standpoint, more money was put out during the first week of this program in the Rural Housing Authority than was put out during the entire month of September. So we know that it's speeding up the process, and we expect that when it rolls out in Clark County, which it should be doing actually today, we'll see an increase in those funds going out. But to answer the tail question, all of those funds will be spent before the end of the year because they have to be. With that, I'll turn it over to Steve to go through kind of the current status of the program, but happy to take any questions.
Thank you, Mr. Treasurer. For the record, Steve Bakeroth, Administrator of the Nevada Housing Division. Treasurer Conine covered pretty much most of the ground. I did want to give you some updated numbers and exactly what is happening in Clark County. Currently, as of October 8th, which was the latest numbers that we have, so a little updated from what was provided to you earlier this week. They have gone through $8.3 million in funding, assisting over 2,000 households. And as was indicated by the treasurer, they're planning on launching their new attestation process, call center, and web-based portal today. And we will have links to that through housing.nv.gov. as well as the Clark County websites. In Washoe County, as was indicated, there's actually 8.5 million in coronavirus relief funds available to the Reno Housing Authority. From the state standpoint, the 5 million that was initiated to them, right now they've spent down about $500,000 of that. They're going through the other funding levels first. They anticipate probably spending the bulk of their money. However, I do want to let everyone know that there is a clawback provision in their agreement. So as we monitor this going forward and the supply chain and the demand chain sort of changes based on the moving of the eviction moratoriums, we are monitoring that, and then we can reallocate those funds down to Clark County if necessary, or back to the governor's office if that's where it ends up. In the rural counties, they've dispensed as of October 8th over 800,000 in disbursements, and they anticipate spending close to 4 million of their funds by 12/30. That has increased dramatically, as was indicated, since the attestation process was started 2 weeks ago. And we anticipate that will continue to increase in both the jurisdictions that I just mentioned. Lastly, I want to mention we are on a weekly informational call with the governor's office, the treasurer's office, Chief Justice Hardesty, Legal Aid, Clark County, Dieter, to provide the updates on the funds expended so everybody sort of knows where we're at these various levels. And with that, I will take any questions. Thank you.
I'm happy to ask a question since it looks like Craig was going to ask. What is the plan for January? I see the number of unemployed people, and I don't see that improving through January drastically. What is the plan for next year with eviction money? Are we likely to see another infusion?
So Steve Acroft, Administrator of the Nevada Housing Division. We know the CRF funds are due to expire. There are some other funding sources that typically have not been used for rental assistance, and those are emergency solution grants and CDBG. The division actually has some oversight over the Nevada non-entitlement ESG funds, and in fact, we'll be having a call later today with the jurisdictions that also receive those funds, which are Las Vegas, North Las Vegas, Reno, and Clark County, to sort of find out where those ESG funds are going to be used and what their overall plan is. Typically, those funds are used for rapid rehousing, homeless shelters, things of that nature, but they can be used for rental assistance. And we have received as a state a total of $40 million to deal with that. Those funds expire in about 2 years. So there still potentially is some funding available. It is more difficult. We can't use an attestation process, nor can we help as many people because the income limits that HUD puts on it are capped at 50% AMI. Our program currently is open to 120% of AMI, but we need to find out how those jurisdictions are going to use those money and so we can sort of develop a statewide plan. CDBG funding goes through GoEd, and I'm not going to speak to exactly how that gets allocated, other than to let you know that they provide that to local jurisdictions, and rental assistance is a applicable use of the CDBG funds. It would be up to the local jurisdictions to figure out exactly how they're going to dispense that money, because it can be used for a myriad of different things.
Thank you.
Okay. Thank you so much. Appreciate it. I don't have any questions. If there's no more questions, no additional questions from the forum, then Russell, I'll turn it back to you.
Thank you, Mr. Chairman. And now we will proceed with agenda item 8, which is the presentation on the Southern Nevada residential and non-residential construction outlook. And this will be presented by Brian Gordon, with principal with applied analysis. And so, Mr. Gordon, if you could attempt to share your presentation slides, and then we'll turn the camera and microphone over to you. Thank you.
That's great. Thank you, Mr. Gindin. I appreciate the opportunity to be here. Chairman Billings and members of the Economic Forum. My goal here is to walk you through what we're seeing in terms of the real estate market here in Southern Nevada. And my understanding is you also have presenters for Northern Nevada and a whole host of other topics for your day today with a pretty lengthy agenda. So I've got a number of slides here. My goal was really to...
Mr. Gordon, I apologize for interrupting. Mr. Gordon, we don't see your slides. I don't know if you were able to share them and it didn't work or not.
Oh, I hit it.
There we go.
Maybe now I'm in a...
We have it now, Mr. Gordon. I apologize for interrupting,
Yes.
but we're good to go now. Thank you.
Operator error. I'm glad you said something now, Russ, as opposed to 20 minutes from now.
Okay, thank you.
Appreciate it. You can see me okay, I'm assuming now. I do see the little green bar on top, and we practiced this morning. So nonetheless, the goal here is to talk about what's happening in the real estate markets in Southern Nevada specifically. I'll walk you through some residential market data. I'll also walk you through some commercial market data that we're seeing here locally in the southern portion of the state. You've got a number of slides, and I'll refer to them as handouts that in my mind, when we put this presentation together, the goal was to have a reference tool to the extent you needed it. I don't know that I need to dwell on any particular slide for too terribly long, but I did want to at least hit the high points of what we're seeing here as it relates to the housing market, as well as the commercial side of the equation. And I'll just start at the top here and let you know that we're seeing a residential market that is really moving counterintuitively to the broader economy. So you guys are looking at a number of economic indicators, a number of economic reports, which are ultimately driving the fiscal projections that you all are tasked with forecasting out a couple of years. And to date, the residential housing market has been impacted very little by what we've seen as a result of COVID-19. And so the residential market in particular is sort of moving in an opposite direction relative to the economy. We're continuing to see prices rise. We're seeing sales continue to happen. And my goal here is to try to identify why some of that activity is happening and give you a little bit of an outlook. I think the last time I spoke to this group related to the fundamentals of the housing market, we tend to focus on population growth, employment growth, income growth, and now as well as interest rates that ultimately drive demand in the housing market overall. From a population standpoint, we look at a number of indicators. The two I've got on the screen for you right now are just really designed to give you a snapshot of where we're at today. In the pre-COVID environment, we were averaging about 5,900 new driver's license surrenders, meaning people were moving in to Southern Nevada, exchanging out-of-state driver's licenses or ID cards for local ID cards. That allows us to measure the pace of and volume of folks that are moving into the local market. Clearly, when the DMVs shut down, businesses shut down, that was also shut off. And DMVs today are appointment only. And so you're still seeing in the most recent month of September, about 4,800 people did exchange driver's licenses. This gives us a sense we're starting to see some of that resurgence in terms of the in-migration. Again, I don't want to leave you with the impression that people stopped moving into Southern Nevada based on these driver's license surrender data. My point here is that we're continuing to see the output or the indicators demonstrating folks are moving here. And then from an electric meter connection standpoint, how many homes are connected to the power grid here in Southern Nevada? That number has grown over the last year on average at about 1.7% overall, and we're continuing to see that pace of expansion, meaning more people are bringing more homes on and connecting to the power grid. From an employment standpoint, you guys have seen these charts. I don't need to dwell on this. My point being here, the current environment is much different than what we saw during the Great Recession. We lost over 135,000 jobs during a 2.5-year cycle. We now have lost nearly 250,000 jobs during the last 2 months, and now we've started to see a lot of that come back. We've actually added about 116,000 jobs in the last few months, meaning we're still down about 126,000 jobs overall. So we've brought back about half of those jobs to date. Again, jobs are ultimately what allow folks to buy properties, residential properties, move into them, remain gainfully employed, and pay for those properties. So year-over-year growth rates, we like to focus on those. During the Great Recession, we lost over 100,000 jobs. I mentioned that in a single year. Now you get a sense of where we're at. We had a long run of about 8.5 years where we're reporting year-over-year growth consistently, year in and year out. Clearly what we're dealing with is an anomaly, but we're starting to see some improvement there. If we look at those jobs that have been lost, the 126,000 jobs or so from pre-COVID to where we're at today, the bulk of them, 55% of them or so in the leisure and hospitality industry, no surprises there. And you see some of the other major sectors in terms of where we've seen job losses. And in percentage terms, leisure and hospitality sector is down about 24% in terms of the number of people being employed in that particular industry. The unemployment rate, I wanted to spend a minute to focus on that so you can see the trend here. Clearly, the run up where we're at today, just to put this into perspective, during the Great Recession, we hit a peak unemployment rate of about 14.1%. So today we stand above where we were at our worst point during the Great Recession. And so that seems fairly concerning just from a numbers standpoint. There's a number of other indicators we like to focus on as it relates to the health of the economy, but specifically here, just wanted to point out that we are still well above where we were at our worst point in the prior cycle. As you all know, the official dates of the Great Recession spanned from the end of 2007 into the middle of June of 2009. That peak unemployment rate here in Southern Nevada, 14.1%, was triggered in September of 2010, so about 15 months after the official end of the national recession. So we may have some runway of continued elevated unemployment levels overall. Personal income growth, you saw some of the national data from my business partner earlier this morning. These are the local numbers in terms of annualized personal income growth. Again, off the charts, largely related to stimulus-related activity. And then the fourth element of the sort of fundamentals that I thought were worth focusing on are really mortgage interest rates. Again, these are effectively at all-time lows. This has provided the consumer with more buying power. They can afford more for a home given where interest rates are. And so, again, I think this has helped to prop up what we're seeing in the housing market. The expectation would be that rates will continue to remain relatively low over the next 12, 24 months. Jumping into the real estate, was there a question? I'm sorry. No, I just heard some feedback. I apologize for that. The resale market, we're taking a look at a national survey in terms of folks' plans to buy a home. As you are well aware, folks have been coming out in droves and continuing to invest in residential properties. Only 8.6% of folks suggested that they were nationally delaying plans to purchase a home, and about half of those suggested they'd be waiting a year or longer. Here locally, we have very limited availability in the resale market. We're looking at about 1.5 months of effective availability. The number of homes listed in the MLS relative to the number of homes that are being sold, and you get how much availability there is in the local market. This is woefully undersupplied. My sense is that if there were additional units on the market, we'd actually be selling more product than we are today. But this gives you the long run sense of where availability has trended. And what that has done is it resulted in increased prices overall. So these are data from the Las Vegas Realtors Association. On the left side of your screen, you're seeing single family median home prices in excess of $337,000, up almost 9% year over year. In condo and townhouse, your attached product has continued to escalate significantly, up 14%. Again, prices are continuing to rise despite the economic climate that's taking place. So despite the fact that we have 15.5% of the population unemployed, I guess that means that we have 85% of the population that is employed and continuing to look at residential properties, and we're seeing those transactions take place. Those are the Las Vegas Realtors Association data. We also track all sales taking place of all product types. This just demonstrates where we're at across the board, including transactions that don't involve realtors. Nonetheless, median price is about $300,000, up 9% as well year over year. The reason I point this out is when we look at all single family product in other markets around the country, these are the largest major metros in the United States, you get a feel for where we're positioned relative to some other markets. To the left side of where Las Vegas is positioned, you see all of the communities along the coasts, including California, and what their median home prices look like. And then to the right, you see more Midwestern, Southern, and even some Eastern markets and where their home prices are. I like where we're positioned from an affordability standpoint relative to everybody on the left side of the chart, and that's where we're seeing the majority of the in-migration come from, with over a third of people that migrate into Southern Nevada coming from California specifically. So they're bringing a lot of wealth and equity with them to a much more affordable market. And again, we like where we stand from a positioning standpoint there. This is the sort of pre-COVID snapshot, and what I think is contributing to some of what the activity that we're seeing in the local market. Prior to COVID, everybody went along their normal routine and where they were spending their time. And then now with where we sit today, everybody is now doing everything from home, right? I noticed a lot of folks on this call today are working from their home. They are working out from home. They're educating their children from home. They're really not going on vacations. And so people are just generally spending a lot more time in their personal residence. And I think they're rethinking their accommodations and their lifestyle. And so I think we're seeing folks that are really out looking and considering other opportunities in the local market, which has helped to fuel the housing market a bit. Again, more anecdotal than anything. And when we take a look at the number of closings that are taking place, the left side of your screen are just annual totals. You see during 2019, we closed over 46,000 resale homes during that time frame. And if we look over the last 12 months, the monthly data is on the right, you can see over nearly 41,000 closings taking place. March was a phenomenal month in terms of the number of transactions that closed. Again, those were all in escrow prior to the shutdown. In the March timeframe, we did see some slowness in April and May, but we still had closings in excess of 2,000 units per month, and we've continued to see that rise. So we have really a shift going on. The traditional sort of spring selling season is now shifted over more into the summer and fall months, and so we're still seeing some pretty decent demand overall in the resale market. And again, I think if there was additional availability, we'd probably see quite a bit more of that activity taking place. The number of defaults, you can see that spiking. No surprise why. There's been forbearances in place on mortgages and the like. In the U.S., the average mortgage default is about 8%. Locally in the state of Nevada, we're about at 9%. The hardest hit markets are tourism-based economies: New Jersey, Nevada, New York, Florida, Hawaii. So you get a sense of what that looks like. Importantly, and again, I like this from a positioning standpoint, people have equity in their homes today, well, more so than they did leading into the last cycle. So I think that provides some level of stability as well if we start to see pricing give way at all. The new construction market has continued to move forward. We've built and closed about 10,000 homes last year. We're on pace for similar activity. Prices have continued to bounce around a bit. Again, more a function of the mix of product taking place than prices actually declining. The cost of labor, materials, and land have continued to remain elevated. Number of units being permitted has continued to remain relatively stable during this past year relative to prior years. In the for rent market, you've already heard some commentary about the eviction moratoriums that have been in place and those expiring today, the federal CDC guidelines. And again, eloquently described earlier on, there are opportunities for folks to continue to take advantage of those opportunities if they're in situations that don't allow them to move forward. But from a Nevada-wide standpoint, the Census Bureau produces this pulse survey data, demonstrates that approximately 11% of households were not paying their rent during the last month, and their expectations going forward on whether they are likely to pay it in the following month or not. So while there are some big numbers of potential folks that not paying, it's important to keep in mind what those numbers look like from a percentage or relative population standpoint. Again, these have bounced around over time, but we're in a little bit better spot than we have been recently. From an apartment standpoint, I've got occupancy rates here. I've got rental rates here. The point I wanted to make is that as these moratoriums burn off and folks are required to move, the reality is I think we're going to just see a shifting around among properties in the rental market. Assuming that these individuals aren't actually leaving the market, we should see continued stability, although we're seeing some concessions rise. There may be some softness in rents, but as long as people are continuing to occupy properties, it should have less of an effect going forward. With regard to the commercial markets, I'll hit just the high points here and then open it up for questions. A couple of items, commercial mortgage-backed securities, we're continuing to see some volatility there, but I think the important thing is that we remain below where we were during the Great Recession for a number of those markets. The office market, I'll flip through just a handful of slides here. I think one maybe worth stopping on are the number of completions in the market relative to the amount of absorption in the office market. Look, the office market is reacting, responding, and adjusting to the COVID-19 new market realities. And I think we'll continue to see that happen going forward. We have a lot of folks working from home. Clearly, the office market is challenged or has the potential to be challenged if people decide to continue to work from home. We don't see all of the effects today reflected in the current market data, as it's going to take some time for a lot of this activity to flow through. Importantly, we don't have a lot of inventory under construction today. We've got about 500,000 square feet that are actively under construction. Again, developers have not been overbuilding in the office segment. We've been absorbing a lot of products since the Great Recession. I think developers will be much more measured in terms of their approach going forward. But nonetheless, we would expect to see some adjustments taking place in the market. I'll jump to the industrial market. Again, this has been the bright point in the commercial sectors over the last several years. Significant amount of demand. I'll show you here the completions versus absorption. So how much space is being built versus demanded. During the last 5 years, the industrial market's brought on about 24 million square feet of product, a lot of that in the big box distribution segment of the market. And that has largely been filled. The Amazons and others of the world that are filling up these major distribution buildings, that's been pretty key to the performance in the industrial market. Some of the smaller product is expected to vacate, and we've seen some of that happen so far. Today, we've got about 6.9 million square feet of product under construction in the industrial market. And we'll see how the market responds to that. But clearly, the growth in non-store retailers, you heard these figures earlier. We just have more online sales happening. So distribution buildings are really benefiting, and we're seeing the demand there. And the retail market, again, this has been a pretty measured pace of development activity. We're not seeing a lot of retail centers being built from the ground up any longer. It's typically been measured along with rooftops, but we've seen some softness there in terms of the overall development side of the equation. Again, the retail market is changing. You can see the vacancy rates by product type, rents. Importantly, as you are well aware, the retail market is seeing a number of bankruptcies and reorganizations that are affecting demand in the retail market. Nonetheless, we only have about 500,000 square feet in the development pipeline, or being built today, I should say. Number of planned projects, but those are unlikely to move forward. So with all that, I think the best way to just summarize my thoughts really are, we have a health crisis that is ultimately going to dictate the economic climate, not only nationally, but here in Southern Nevada. And ultimately, that will impact what's happening in the real estate market. To date, the residential market's been able to sort of withstand what's happening in the broader economy. And I think, the reality is that this will probably continue at least for the next next quarter or two. The bigger concern is that the longer the economic weakness hangs on, assuming that spans another 12 or 24 months or longer, we get to be a little bit more concerned about what the local economy looks like and ultimately what the local housing market looks like at that point. But I think we're much better positioned going into this cycle than we were last cycle. A lot more equity, a lot more skin in the game for people. I think there's a lot higher likelihood that people will be, there'll be a disincentive for them to walk from homes. Again, I think the dynamics are a little bit different, so I like our position relative to the last cycle, and happy to answer any questions that the members may have.
Thanks, Brian. Craig Billings here. Thank you for the presentation. I sense that, and Jennifer might have some insight here as well, but I sense that the stability in housing prices has a lot to do with kind of adjacent states and the fact that there are neighborhoods that are, or states rather, and cities that are kind of harder hit than we are from a number of perspectives, really related to the virus, not so much the economy. And do you think that dynamic can continue over the course of the next year or so, and really notwithstanding the potential economic fallout of a lot of the dissipation of the stimulus that we were talking about earlier in this meeting, that we could continue to see housing prices stay steady simply because of in-migration and the fact that it's actually perhaps worse elsewhere? How should I think about that how should we think about that over the course of the next year or so?
Yeah, thank you, Chairman. I guess the way I would tend to think about it is, in the near term, yes, I think these trends can continue. I do believe that folks are moving from some of these more high-density communities. I mean, we hear anecdotally that there are people migrating in from your San Francisco's, LA's, and other areas in California that know they're working from home for the next 12 months. And they've just decided, instead of renting or being cooped up in a smaller apartment in a high-density urban area, let's look at our alternatives in other markets. And Las Vegas, I think, is on the list, and we've actually seen some of that activity. They may or may not be telling their employers whether they're moving or not, but my impression is that there are some of those folks moving here. One, for the lifestyle that may afford them owning their own home. That's much more affordable than what they're experiencing in their current community. But it's also this more suburban lifestyle from a health standpoint that gives them some comfort that they may be better positioned than some of the higher density urban centers. And so, yes, I think some of that's happening. I think that will continue to happen in the near term, over the next 3, 6, maybe 9 months. I think ultimately the science behind the virus itself will dictate how consumers start to respond. Do I think that's going to continue into perpetuity? Probably not. But look, we've always had about a third of the folks coming in from these higher density, higher priced markets like California. And so that gives me some comfort that we will continue to see that. And those, assuming the fundamentals remain relatively consistent between both sides of the border, if you will, between California and Nevada, we'll continue to see that going forward. So I think in the near term, relatively low inventory, I think record low interest rates, and then this health concern in California will help to fuel continued demand in the housing market. Now, I think the further we get out, assuming economic weakness persists, to your point, 12 months out or longer, and folks are struggling to make payments, or they're having a challenge to continue to afford either their rent or mortgage payments, then yes, I think that becomes the bigger challenge, and then that could potentially let some air out in terms of prices. And then I think at that point you would start to see, probably and potentially in advance of that, you start to see more homes come on the market. You see greater on the supply side of the equation. That has the potential to create some additional opportunity for softness in terms of overall pricing. Look, do I believe that we can continue to see home prices escalate, by another 9% on top of 9% over the next year or two consecutively? It seems pretty unlikely. I would imagine there'll be some sort of resetting, but that feels to me like it's beyond the 6-month time frame that I was just sort of referring to. So I think there are some concerns more longer term that we need to be mindful of.
Got it. Thank you.
Mr. Gordon, can I ask a question? I think as you're aware, the state receives substantial monies from sales tax from some of these large construction projects. And I think some of them we've had in the pipeline over the last couple of years have provided some stability to our sales tax, as well as providing substantial employment in these difficult times. Now, I know that several of these large construction projects are either completed or nearing completion. What do we have in the pipeline right now that would replace those, that would shore up this sales tax and this construction activity, other than residential construction?
Member Levitt, I think you're thinking about it absolutely correctly. These major construction projects are wrapping up. Stadiums, convention centers, resorts. These multi-billion-dollar projects are their construction activity is going to come to an end, and yes, that has the potential to impact sales-related taxes on those materials. So in terms of major projects, I don't know that in the current environment we'd expect to see any large numbers of massive projects moving forward like we've seen over the last 3 to 5 years. I don't know how you backfill that component of the sales tax. Now, clearly, as you mentioned eloquently, the residential side of the equation appears to be continuing to move forward. And remember, we're only building 10,000 housing units right now. If we think back to the last cycle leading into 2005, 6, and even 7, we were building 35, 40,000 homes. Today, we're at 10. It's much more measured. Going into this cycle, I could argue that we were undersupplied in terms of just housing in general between the for sale market as well as the for rent market. Everything was filling up and selling relatively quickly. So I do think there's a little bit of runway there in terms of the ability to continue to construct housing units going forward. And so you'll continue to see those sales taxes generated on those materials materialize. And so you'll see some of that move forward. But big scale projects, I think, are going to be coming to an end, and there's going to be really relatively few of them to backfill that gap.
Thank you.
I have a question about sort of going forward. Do you think we'll see a bump in real property transfer tax as landlords get tired of landlording? I've just wondered, there's a lot of mom and pop guys that think being a landlord is like a dream job and they're just going to rent out 4 houses. And at some point, through either short sales or just aggravation, is that going to cause people to start selling their houses and taking rental units off the market?
Member Lewis, that's a fair question. I think we've seen a little bit of that activity taking place. With leases in place on a lot of those single family homes, if you will. I think their ability to sell them in big numbers is a little bit more limited just because you have tenants locked into those. But I think there's a lot of gains on paper right now for a lot of those landlords that are operating in the single family market. And would they like to realize some of those gains and potentially stave off any sort of downturn in price points? Yes, I think that's probably where some folks would be looking. But at the moment, prices have continued to rise, and people are still generating additional equity. And in fact, probably more equity than they're making on the actual rental of the properties themselves to some extent. But is that possible? Yes. We're tracking right now at about 10% below in terms of the number of resale closings. And again, I think that's largely been a function of a lack of supply in the market. I think we could see additional resale closings if there was inventory there. So if some of that product does come to market, yes, I suppose there's some potential upside on the real property transfer tax. But man, selling 45,000 homes in a year, I don't know how much more above that level we could actually get. So maybe there is a bump, but I probably wouldn't be too aggressive on that particular line item in the budget.
Thank you.
Great. Thank you very much. Russell, back to you.
Thank you, Mr. Chairman. For the record, Russell Ginden. So proceeding with the agenda, the next agenda item is item number 9, and this is the presentation on the Northern Nevada Economic and Housing Outlook. With us today, we have Brian Bonifant, who is project manager with the Center for Regional Studies at the University of Nevada, Reno. And also with him is Eugenia Larmore, president of EK Economic Consultants, to present the information on this agenda item. So I would ask those two, as needed, to bring up their material and make their presentation.
Thanks, Russell. Thanks, Chairman, forum members. So yeah, I'm going to go cover the housing outlook in the north, and then I'll hand it over to Eugenia, who will quickly cover the major economic indicators in the Reno MSA. So housing 101, let's get into the supply. Here it goes. Okay, these are the new units added to the Washoe County tax rolls for the last 30 years. Broken down by the red is the multifamily units and the blue and the single family units. Pretty much this year is the first year we surpassed that level of pre-Great Recession number of units added to the supply. But as you see in the red, beginning of 2019, we're adding more multifamily units than single family units to the tax rolls. Again, starting in 2019, you can see the blue bars pretty consistent. Causing, real property transfer tax to stay pretty flat, those revenues. Plenty approved units in the pipeline. We track them, and we're tracking 13,000 units that are under construction, 14,000 are approved, 43,000 behind that pending. It's really the what National Association of Home Builder Economists pens as the 5 Ls, the limiting factors of labor, lending, loss, laws, and lumber. In our area and maybe down south, you can add litigation to that. But plenty of projects and approved units in the pipeline. It's just about those limiting factors moving forward. This looks at the listings of existing single family homes in just Washoe County, total listings in the blue. That's broken down by owner occupied, vacant, tenant occupied, and under construction. We take the under construction, and that was covered in the previous slides, and we're just going to focus the tenants only runs about 4% of your total listings. We throw those out. We're really going to focus on the owner and vacant. Runs over about 2,000 this summer about listings, and you see what happened with what happened to COVID. It started in March, and then through these peak summer months of June, July, August, the decreases. And on the back end of that decrease in the supply is the demand on top of that. If you go in the listings, you could pull out the pendings out of these owner and vacant listings, and a total of 380 non-pending homes in August. Very, very low. On the rental market, to show that demand, we popped on Zillow. On 9/11, there was only 100 single-family homes available on Zillow on 9/11. A third of our single-family units are rentals, according to tax cap data, income properties. So 100 units out of 44,000 single-family shows you that demand across the board for sales and rents. Multifamily run about 2,000. Look at the total inventory, that brings us to about 3.4% vacancy rate across all products A, B, and C. Looking forward for the construction, moving forward, if you look at the 3 decades of data going back of new population added over 10 years, you look at the new units added over 10 years, and you do that new door per new pop, 0.41 during the 1990s. We got a little crazy in the 2000s, so that popped it up to 0.51, and now in the last 10 years, we're back at that 0.41 that we experienced in the 1990s. So at that rate, if you look forward, State demographer is projecting over the next 5 years about 42,000 new persons, or about 8,500 persons per year. That calculates into 3,500 new units per year at that population growth rate. If we bump it up to 10,000 new persons, then you can expect 10,000 units to be built. Let's look at the demand population. This is the sources are the census in red, and blue is the state demographer, the official sources of our population, showing what's occurring in 2020. First time we popped over 9,000 in quite a while. State demographer is the only official source for the county level projections moving forward for Washoe County, well, for all counties in Nevada. And state demographers generally at these 5-year projections never want to go out on a branch to show a 2 or 3%. They generally like to decrease it down to a 1% as they grow out, because they just don't have those tea leaves to tell you how much population we're going to be adding in 5 years. So this will be interesting to watch. Here's the growth rates for the both sources over the last 20 years. And as you can see, we've yet to really match those pre-Great Recession growth rates. State demographer showing 2019 that we did finally pop over that 2%, whereas the Census Bureau is not following that. In 2019, of course, 2020 represents this decennial 100% count, which should provide a really good adjustment of where we really are. Although you hear about these problems with the census taking during the COVID times. So it'll be interesting to see what those results do to Nevada and its counties. Across the region up here in the north, there's that Washoe County 2.1. Lyon County surpassed Carson City in population in 2019. If you remember back prior to the Great Recession, Lyon County was led the way in growth rates of all counties in Nevada at 3.5%. They're still struggling to kind of get that overlap, and I'll get to that later as to the reason why. Important to understand population and current houses, because 2/3 of your demand for housing is organic. Those who move within the same county in the past year. And your urban counties are much more footloose than your rural counties, as this data shows. 13% move in a given year in Washoe County, and Clark County it's 14%, whereas overall United States it's 8%. So 2/3 of your housing demand internal. The remaining 1/3 is in migration. A third of our in migration is California. A third is the balance of states outside of California and Nevada. And then the remaining third, and this is just in Washoe County, the remaining third is the balance of Nevada counties and in foreign in-migration. Clark County always represents the biggest source by far of in-migration in Washoe County, and a lot of that has to do with students. Of course, with in-migration, you have out-migration in order to get to your net migration. And you can see in this data, this is, again, just Washoe County Tesla announcement in 2014. You see what that does to that net in-migration, the bottom, bringing in all those jobs in the last 5 years, what that's done to the in-migration. However, if our availability of homes, number of listings remain really low and our housing prices continue to double-digit appreciate, we expect the in-migration net to drop back down. Who are these newcomers coming to the area? By far, for our area to Washoe County is millennials, 20 to 29-year-olds, represent almost 1 out of 3 new persons to Washoe County. That compares to overall U.S. 14% of the population. So we are benefiting from communities who are losing this population. Looking at the incomes, the top is all those 15 and over in Washoe County. The bottom table is those who moved here in 2019, and you see a lesser income in the upper brackets, the lesser population in those upper brackets. And that, again, it goes back to those ages of 20, 29-year-olds, who a lot of them are students with no income or very low income. Looking at the educational attainment and bumping up those ages to 25 and over, top table, all residents of Washoe County, bottom, moved in 2019, and 1 out of 8, over 1 out of 8, have graduate or professional degrees we saw come in 2019. So that's really good, also good metrics for our area of who's coming here. This is new single family sales in Washoe County, just new single. Number of sales in blue and the bars, and the values are in the red. Pre-COVID, 2020 started off with a very big jump in demand in new single family sales, the most since 2007. And we saw just a tad bit of turn off in May, but now they're back up through the roof. And a lot has to do we feel is with the prices, when we do a seasonal average on this data and we look at those prices in the red, the builders have really have figured out how to deal with these increasing construction costs, which continue to increase with lumber in 2020. But we're seeing them bring their margins down and control their margins to make this product still valuable for the buyer. This looks at the existing single family market. Listings, the decrease in listings really killed the market in latter part of 2019. This stumbled into 2020, and that's really what put the crimp on these sales. But you see what happened in May, June, July, August of the perk up in sales. This is kind of that anecdotal documentation of maybe more in-migration, more demand. They're just going to buy, whatever. So we're seeing actually some pretty good numbers come in. Let's do some seasonal average on that. See a little bit of increases. The takeaway from the existing sales is the appreciation. You're not seeing much slowdown in that, especially now with the high demand. This looks at the rental multifamily market. Vacancy rates, 2Q at 3.32. Still very low. However, 2Q is usually would come in our area below 3% and sometimes below 2%. We do have 5,800 units under construction right now, which is adding to this inventory. Is helping these vacancy rates start to increase. This 2Q20 at 3.32 is the highest vacancy rate we've seen for a 2Q since 2013. So we're starting to see that effect. In fact, if you run the seasonal averaging on that data, you see the bottoming out of that vacancy rates occurring with all the inventory coming in. This should also help with this vacancy rates and also put that downward pressure on those lease rates in the red. Affordability. This is a big issue in our area, especially now. The red are the quarterly year-over-year median values of just Greater Reno Sparks. It doesn't include Tahoe. And the blue line is a 4% annual appreciation rate that we've been using for decades that we calculated through 1990s. 1990 to 2001 is what gave us that rate. And we like that rate. We get a lot of pushback, a lot of debate on that 4% annual. But if you look back over the last 6 quarters, we started to correct and mellow to that 4% rate, which is very good because of our income and wage trends, right? But however, with the COVID coming in, the demand coming in, the supply disappearing, July up to 436, August 442, September's coming in about 440. So 3Q, you're going to probably see double-digit appreciations, and we expect to see these double digits continue into 2021, probably throughout the whole year, unless we get some more supply. Looking at the incomes, 2019 recently came out with both median family income in the green and median household in the blue. Big jumps in our area. This is just Washoe County, but significant jumps in incomes of 14% in households. Probably one of the biggest jumps since World War II. Median family at 8%. If you look back since the income started increasing, we're running 5-6% annual increases on incomes in our area. Jumping into wages, this is 1Q. Jumping to 2020, some more current data. This is the most current out of Dieter. 1Q wages, I've been showing both Washoe County and Story County because Story County has that Tahoe Reno Industrial Center and is part of the Reno MSA. But look at that 1Q over 1Q growth in wages of 17% out there in Trick. Now their hourly wages out there at $33 an hour. That's $7.50 more than the average wage in Washoe County. Who would have ever known? Although Washoe County is still being healthy increases also. A lot of talk of stagnant wages, stagnant incomes, and affordability in our local media. But as you see, if you compare our income growth and wage growth with the inflation growth, which is in the red, you see for the last couple of years, and especially in 2019, how we have had real income and real wage growth in our area for years. In fact, when you throw that extremely low record level mortgage rates into our affordability and these increasing wages and income. You see with this affordability index that affordability has gotten better since 2018. The last 6 quarters, our affordability has improved. If we look at break down these industries we have throughout the Reno MSA, and we look at those jobs, and we look at the product on the right side of all your housing product, new single family, existing single family, your attached product, your rent product, your apartments, we look at qualifying incomes based on these wages, we find that all industries for workforce housing can afford at least an apartment at the current rent rates. Looking forward, the non-residential construction really is the industrial. I mean, I think we all know that, the Teslas and the Googles, which is out east from us, the Howard taking care of the housing in Reno Sparks area. But the future of the next few decades for our region up here is what's happening in the Tahoe Reno Industrial Center and eastward. You've got contiguous to TRIC is Northern Nevada Industrial Center, who has an approved developers agreement with Lyon County to go with 10,000 acres of industrial. Roger Norman, Lance Gilman pushing the Tri-2 development southwest of Fernley, taking down land currently. Victory Logistics District is bringing in industrial development to the north of Fernley. The Pyramid Tribe expressing interest with data centers and industrial above Wadsworth. You have the Hazen Complex in Churchill County, which then goes over to the Fallon NAS, who's expanding their regions. You have the NV Energy initiating their new power corridor up to these projects from the south, from the Las Vegas area, with billions of dollars of spending and construction. This is the next decades. The dots are your residential developments that we track in the Dayton south of TRIC, and then Fernley to the east. This is kind of our next barriers for the next decade is the housing and growth to the east of Reno Sparks, which if you look back to the demographics of our in-migration is fulfilling these jobs in TRIC, which is 29-year-olds, is how do we bring amenities out to these areas so 29-year-olds will buy homes out here, and also the infrastructure of water, sewer, and power to these mostly vacant lands. So look forward to this region blowing up. I mean, it's already blowing up. If you look at the listings, the bottom line of these real estate activity of the listings dropping in, this effect on the both new home prices and existing home prices, mostly green arrows. If you look at Washington County, Carter City, Dayton, they are all above median values of Las Vegas. Fernley's the bright spot of affordability in our region. You can still buy a new home for below $300K, an existing home for $275. I'm now going to turn this over to Eugenia Larmore to cover the rest of the major economic indicators in the Reno MSA.
Thank you, Brian. Good morning. It's still morning, and thank you for having me here today. My focus is on the details of the Northern Nevada Reno Sparks economic indicators. You will hear a lot of national or statewide levels.
Ms. Larmar,
information will be.
I apologize for interrupting. It doesn't appear that when you went to share that your slides came up. So.
Oh, let me try that again.
Okay, I apologize.
Shows me sharing, but I'll try again. How's that?
There they go. Thank you very much.
Perfect. So we'll just take you'll look at this indicators at the state level. This is just a quick, more detailed dive into these at the Reno Sparks MSA level. First we'll start before COVID. We created this Reno MSA leading and coincident indices back in 2015 to look at the expectations for the Reno economy as represented by the leading index, which combines a number of local, national, and state series into one number that we can track over time. And the goal of the leading index is to predict where the Reno Sparks economy is going to be headed in about 6 to 12 months. The coincident index, which is a combination of two employment indices, really presents the economy as it is right now. So we can track where the economy is currently and where we expect it to head in about 6 to 12 months. So this is the index through February 2020. We were prior to the pandemic impacts, and what we were showing is a slightly slower expectation of future growth. There was a lot of talk of the recession coming, though the expectations kept being pushed off to, at that time, to probably late 2021 into 2022. So some expectations of a little bit of a slowdown, but still significant growth as represented by both of the leading and the coincident indices. And part of that growth was due to the significant economic development efforts in the area, including, as Brian mentioned, the Tesla choosing the Tri-Center as its home, and the resulting growth in the manufacturing and the construction and the warehousing industries. This graph shows the location quotient data for the region as represented by the four neighboring counties, showing that construction and manufacturing industries in the region were not only more concentrated in terms of employment than the national levels in these industries, but they also were growing in terms of their employment. So we call those star industries. Not only are they significantly important in the region, but that importance continues to grow. Transportation and warehousing was also a mature industry, which means it was very concentrated, but the growth in the industry has slowed. So this shows that, again, prior to COVID, we had significant diversification. We were moving away from accommodation and the leisure and hospitality industries that we focused on in the early 2000s and into manufacturing and construction. So COVID happened, the economy was shut down and has now mostly opened, but with some restrictions. So what has that done to employment? This table looks at comparing each month of the impact, the COVID impact period, to the same month of the previous year. So for example, when we're looking at March, we're looking at the difference between March 2020 employment compared to March 2019 employment. And what we can see, obviously, the impact in March was not significant because the shutdowns did not occur until mid to late March, but we can see the loss of employment starting in April, and with April being the highest month, and as the economy reopened, that impact, that negative employment impact, has lessened, though it remained as of August of this year at about 14,000 jobs less than August of last year. Some of the industries were obviously more impacted than others. The leisure and hospitality industry is still about almost 6,000 jobs fewer than it was last year. But some industries, such as manufacturing, continued to grow. Government gained about 400 jobs compared to the same period last time. What is interesting is not only the impact on the different industries, but the wages associated with these industries. I'm sure you have all seen the headlines that the recession, the pandemic-caused recession, has impacted various households and various income levels differently. And this shows how, in that the leisure and hospitality industry, the most significantly negatively impacted industry, has some of the lowest average wages of all of the industries in Northern Nevada. Again, this shows, and most of the impacted industries with a severe loss of employment are those in the lower wage categories. So this does show that in terms of employment impacts and in terms of impacts of loss of the wages, this was impacting the lowest and the most vulnerable income families in the region. Unemployment rate, this is compared at one point, state of Nevada had the highest unemployment rate. This compares the difference between the Las Vegas area and the Reno MSA, showing the completely different amounts of unemployment rates. The Northern Nevada area peaked at about 20% in April and has declined to about 7.2%, which is only about 2.5% above what the Federal Reserve considers natural unemployment. So this created you can see back in February, we were significantly below natural unemployment levels, which was indicated that we were not sustainable in our job creation. We had more job supply than we did job demand, or more job demand than we did job supply. And this has allowed us to have a little more of a labor pool. And we're not seeing the data yet, but we're hearing a lot of anecdotal evidence of the labor pool, the persons who are unemployed, primarily from the leisure and hospitality industries, moving into the growing industries of manufacturing. So we're going to have a shift in our employment again towards manufacturing, and a very hard position for the smaller mom and pop retail and restaurant businesses to find employment in the future. And with obviously increasing wages to, again, further making their finding employment a lot more difficult. In terms of gaming revenue, this compares August 2019, the period prior and through the COVID recession, all the way to the August 2020 data. As of August 2020, we're almost 13% down in gaming revenue compared to the previous year. This is, again, just for Washoe County. Part of we had lower declines in July and June. We're only about 7 and 8% below previous year's levels. Part of this increase in the decline was because August was a high gaming revenue generating year with Hot August Nights and other special events that attracted quite a few visitors to the area. We did not get those visitors this year, so gaming revenue is lower than we would have expected and is lower compared to last year. Also, this includes the loss of Harris, which closed sometime in March. So again, that gaming revenues decline is reflected in these numbers. Taxable sales actually started exceeding previous year's levels starting in May with the reopening of the economy. In May, revenue was 3% up. In June, it was 13.2%. And then the latest numbers we have for July 2020, taxable sales revenue is 11% up compared to the same time previous year. Taking a closer look at what is being impacted, and Jeremy covered this at the statewide level, food service and drinking places have had a significant declines in their revenues. Here we have a comparison of July 2020 numbers to July 2019, and also for the entire period aggregated for March through July. Significant declines in the food service and drinking places, partially due to this shutdown, but also because of the space restrictions, even as they reopened. Second, motor vehicle and parts dealers were also significantly impacted. But if you look at the numbers of July, I think they reflect what Jeremy mentioned, with gains of about almost $17.5 million in revenue. So some significant spending on vehicle-related purchases. Clothing and clothing accessory stores were also another big loss during the pandemic. And some of these, as I think Brian mentioned, some of these stores were having issues prior to the pandemic that were just exacerbated by the pandemic. The biggest gains, again, were in the building materials and the non-store retailers. Amazon and online retailers were really the biggest beneficiaries of the pandemic as people switched their purchases from in-person purchases to online. Airport passengers and cargoes. This is coming through the Reno Tahoe International Airport. The cargo numbers have fluctuated over time, so it's difficult to see how the pandemic impacted the numbers in the recovery, but we did see a significant decline when the pandemic first began. And the passenger numbers, again, continue to remain low. There is a significant increasing trend, but they remain low as people are still nervous about flying. And of course, this impacts the area's visitors, and we're still below the levels, again, an increasing trend as people become more comfortable and are coming to the area. But again, the total numbers compared to the previous years are pretty low. And so we looked at the leading and the coincident indices prior to the recession, and this shows what has happened since. And the leading index takes into account the gaming revenue, the airport passenger numbers, the taxable sales revenue, and then a number of statewide unemployment benefits, and then some national series to create these. So we can see, at least at the Reno Sparks level, that we have, I'm not sure if you want to call it a fat B or a U, but there is a significant trend of recovery. We're below the previous levels, but we are showing a lot of recovery and a lot of positivity in the area, with the downside of being that the coincident index, the employment index, has not significantly recovered to the previous levels. And kind of where do we go from here? As we talked about, the focus, the economic development activity that really shifted the focus from leisure and hospitality, which were the industries most impacted by the pandemic, to manufacturing and transportation, which are industries which may actually be benefited by pandemic, as there's quite a bit of talk of on and near shoring, shifting production and storage to either US or US neighbors to avoid future production disruptions and given other pandemics or other global uncertainty. These industries may actually benefit from the pandemic, and the Northern Nevada area, which has really concentrated into these industries, may benefit from the pandemic. But as Brian mentioned, we're expecting continuing population growth as well, with baby boomers leaving cities with higher tax rates, looking for the quality of life issues, and also working employees, not only the employees of the growing manufacturing industries, but also those who are working remotely and are not necessarily required to live at their place of employment, also coming to the area. And as Brian said, that will continue to drive housing prices and really necessitate a regional approach to housing. And that is all I have, and we're available for questions.
Thank you very much. Any questions from members of the forum?
Just a real quick question of the folks moving here from out of town, purchasing homes, et cetera. Is there data on how much percentage-wise are retirees versus people moving here for employment or moving out of the area that they were living in to work here remotely?
Yeah, builders do survey their buyers, and there are quite a lot of our current data right now. The Ranch Hera project, which is an upper income luxury housing, is last I saw reported was 45% Californians. Ryder Homes is more not really entry level, but 400, 500, 600K, and they do a lot of surveying, and that data does bump around. But again, it matches that in-migration data, about a third California buyers. So, the answer to the question is that it's a product by product basis, and they're the ones who survey. Not a lot of centralized databasing of who's buying what. But if you tap into the builders, you can get that data. And yeah, we're seeing a lot of California buys.
But is there data of those folks that are moving here, the number of retirees for Northern Nevada, such as Fernley, Fallon, Carson, Dayton, some of the more affordable areas?
I haven't seen the data for the outside of the rural regions. It is, that would be the sweet spots for the baby boomers is to purchase in Dayton, Fernley, Carson City. You've got larger lots, less congestion. The Fernley, the commute to the Tri-Center from Reno Sparks is horrendous, especially in the winter already. So the Fernley product, we do expect to really pop. They're selling about 150 homes per year in Fernley. In 2015, they sold 5 brand new homes. So we're starting to see the Fernleys come around. Again, it's that age issue. But I haven't seen data as to the age and, resident breakdown of these rural areas. But they're doing well. The builders and the sales are doing well in these areas. So I would think, because of the COVID and to get a yard and some space, for the baby boomers and a lot of sunshine, I could see this product doing well out there for the retirees. But the millennials, that's a different topic.
It's Craig Billings here. Just a question. We talked a lot earlier in our meeting about the potential dissipation of stimulus and the impact that it could have, particularly on Southern Nevada. How do you think about that relative to the leading and coincident indicators that you talked about in here, particularly in early 2021, to the extent there isn't some additional congressional-led or federal-led stimulus, rather? How should we think about the impact on Northern Nevada?
Absolutely. The stimulus has had a positive impact throughout the state. I think obviously a lot of that, not a lot, but a portion of that taxable sales was driven by the stimulus being expanded through the economy. But we also have had quite a bit less unemployment and impact on wages than Southern Nevada had. So I think while we will see a decline in some of the taxable sales, I don't think it's going to be as dire as it will be in Southern Nevada with the higher unemployment rates.
Thank you.
I think it's really interesting as we view the differences in the presentations between Southern Nevada and Northern Nevada, where Northern Nevada has gradually over the last several years made a shift away from the travel and leisure industries into more in manufacturing and other type industries. We can see the effect of this. This appears to be at least substantially less in Northern Nevada than it is in Southern Nevada.
Correct.
Not really a question, I suppose, just a comment.
From, sifting through the data for all these years, watching Tri-Center and Tesla, my personal opinion from the data is the abatement worked. A lot of pushback, a lot of, politicians not really liking that, the abatement. But if you look at, especially right now, those wages and income, especially in Story County, I would have to say that abatement worked very well.
Okay, thank you very much. Great presentation, appreciate it. Russell, back to you.
Mr. Chairman, then, with the conclusion of the agenda item 9, the next agenda item is item 10. And this is the presentation of new and expanding business development in Nevada based on economic development activities of the Governor's Office of Economic Development, the Las Vegas Global Economic Alliance, and the Economic Development Authority of Western Nevada. And so for this agenda item, we have Bob Potts, who's the Deputy Director of the Governor's Office of Economic Development. We have
Russell, can I suggest we take just a quick 5-minute break prior to the commencement of this particular item?
Absolutely, Mr. Chairman.
Okay, great. It's 11:26. We can restart at just a little after 11:30. That's all right. All right. We seem to have everybody back. Russell, back to you.
Okay. Thank you, Mr. Chairman. Again, I won't go through it all again, as I was stating before the break. We're on agenda item 10, and for that, we have Bob Potts, Deputy Director from the Governor's Office of Economic Development, Jared Smith, who is Chief Operating Officer with the Las Vegas Global Economic Alliance, and we have Mr. Mike Kazmierski, President and CEO of the Economic Development Authority of Western Nevada. And so I see the slide is up for the go-ahead. And so, Mr. Potts, I will turn the camera and microphone over to you. Thank you.
Very good. Can everyone hear me okay?
Yes, thank you.
Okay, very good. So, thank you. Good morning, everyone. Bob Potts, Deputy Director, Governor's Office of Economic Development. Pleasure to be here. Thanks for inviting me. So what I'm going to do is a little bit different than what I presented to the forum before, and I will get to economic development activity and what we're seeing, and I'm sure that will be complemented by the next two speakers on this agenda item. But I'd like to put things in context and how we think about them in economic development and the kind of work that we do. A lot of this you've heard before, but maybe hearing it one more time and built into a different context would be helpful as we're thinking about this. The other thing this is kind of predicated on ever since it was actually March 3rd, began holding weekly meetings with the Governor's Economic Advisory Group. The governor put this together in January of this year, largely to work on the state plan as well as GOED's strategic plan. Of course, then COVID hits and GOED really did pivot in everything that we're working with and what we're doing. But it doesn't change the underlying fundamentals of Nevada economy and the regions within Nevada. And I think it really is helpful to keep that in context as we think about where we're at now, how it's bouncing back, and kind of what we're looking going forward. So, so Eugenia just talked about, and she was using location quotients, and I'm going to kind of build on this. She just talked about what was going on in Northern Nevada, but this is what it looks like in Nevada as a whole. So to get everybody on the same page, location quotients, it's just the concentration within an industry, the number of jobs within an industry compared to all jobs, what that proportion looks like compared to the national average as a way to normalize the data. Essentially what it means, you have a location quotient of 1, you would have the same proportion of workers in an industry as the national average, okay? So on this slide here, anything above the horizontal line means we have a higher concentration of workers than the national average. Anything below means we have a lower concentration. Anything to the left of the vertical line means that over this 10-year period here, it's all annual data, we've actually lost ground. If it's to the left, it means our location quotient has gotten closer to the national average or below. It's slowing down. If it's to the right, it means that it's growing. So we can divide this into quadrants, and these are just kind of the terms that folks use on this one. So Nevada as a whole, tourism, gaming, entertainment is in that mature quadrant, right? So we're about 2.2 times more workers in that industry than the national average, right? The size of the bubble reflects the number of workers in that industry. On the star side, where we're actually above the national average and growing, is mining. 14,000 workers or so in that industry, 15,000. Fairly small bubble, but it is our star in the state as a whole. We have nothing in our transforming sectors. So the target sectors that GOED is focused on, our economic development priorities are, there's nothing where we're below the national average and we're losing ground, okay? In the emerging quadrant, that's one that really matters. And you can see that in all the other sectors, we're still below the national average, but we're gaining ground, so diversification is working. But you have to really look at what's going on in the different regions in our state. So here's what Southern Nevada looks like. And when you have 75% of the economy down south, it doesn't look wholly different than the state level, but there is a higher proportion. There's 2.5 times more workers than the national average in tourism, gaming, entertainment. And there's no stars, there's nothing transforming. And all the rest of the industries that we have as our target sectors are actually growing. We're gaining ground, but turning the ship takes a long time, okay? And so it's an effort that we need to kind of keep our foot on the gas on, and COVID has obviously given us more reason to do so. Now, if you look at Northern Nevada, and this gets back to kind of what Eugenia had in one of her slides, very different look. And quite frankly, it's the reason why we're seeing kind of the resiliency we're seeing in different regions of the state in light of this pandemic. Tourism, gaming, and entertainment is only, 40% larger than the national average. We have 3 stars: logistics, and manufacturing, natural resources. There is a little bit of concern with healthcare, but we've always known statewide, our location quotient for healthcare is about 0.67. So we're only 2/3 of the national proportion in healthcare, which is more reason to keep our foot on the gas in that industry. Pretty close to where the lines cross, so we'll keep our eyes on that one. On the emerging side, IT, aerospace and defense, and mining. So this is in the north. The balance of the state is very different, and we all know this. Mining is the sun that everything else revolves around. With a location quotient of 42.5, so it's over 42 times larger the proportion of workers in this industry than the national average. What that does is it forces all the other industries down on that x-axis line, so you can't actually see what's actually going on there. So what I've done on this slide is I've pulled the sun out, pulled mining out, so we can actually see what's going on with some of these other industries. Mature, tourism, gaming, entertainment, natural resources. What we consider natural resources is water technologies, clean energy, and agriculture. Okay. Aerospace and defense, those are the mature ones. There are no stars once you pull mining out. Healthcare and IT are problematic in the balance of the state, but we do see growth, as we have seen in all regions in the state, in logistics and manufacturing. Okay, so diversification is happening, but it's happening at different rates of speeds in different places in the state's regional economy. So that takes me to some of the current stats, and I know there's been quite a bit talked about on this call right now. But I want to kind of highlight why the current stats look the way that they do, based on some of the structural nature of some of them. So our August job count is 1.3 million workers in the state. So I want to go the economics group that we're having these weekly meetings with. We all knew that going into this pandemic that there was going to be a bounce back. This is not a downturn as a result of economic forces, at least not initially. Okay, it's a result to a policy decision in response to a health threat. And when we talk about the essential industries, the non-essential industries, stay-at-home orders, and the closures and stuff, that's what drove us down initially. We knew that there was going to be a bounce back. The question was, how high are we going to be able to bounce back? And if with federal funding assistance, would that be able to help bridge us across to get back to normal? And I say that in quotes, okay? The bounce back is here. Now we're on the long trajectory, pulling ourselves back out of this. If you look at the job numbers, in June, we jumped up 8.5% over the May numbers. July, we jumped up 1.3% over the June numbers. And in August, we jumped up 0.5% over the July numbers. So the rate of growth, getting our jobs back, has slowed down. In February, we stood at a little over 1.4 million workers in the state. In April, with the closures and everything, we lost about 287,000 jobs. And we got to set the state record of any state in the history of collecting unemployment rates at 30.1%. 242 of those 287,000 jobs were in Clark County. So 84% of the lost jobs were in Clark County. And again, it goes back to the essential, non-essential, what we were working with at the time. Folks, colleagues work close together, the visitors, where the pandemic could, okay? Most of that drop was tied to the service-based industries. If you look at service producing, it's down 22% versus goods producing was only down 3%. In Las Vegas, in the Las Vegas MSA alone, 290,000 folks are employed in leisure and hospitality. That makes up almost 25% of all the jobs directly tied to leisure and hospitality that are at most at risk to this downturn. Okay, the restaurants, casinos, the fitness centers, the golf courses, all of those. That compares, and then you need to think about the bubble charts I showed you earlier, to only 14.7% of all the jobs in the Reno MSA are in leisure and hospitality. Okay, so those structural differences matter. It takes time to turn that ship, though, so that you have that kind of diversification. We are doing a lot of work right now, working on our state plan. We were doing a 5-year strategic plan. We pulled that back when COVID hit to put together a recovery and resiliency plan. In that recovery and resiliency plan, trying to think about, okay, so how do we approach these different regions and support the bounce back, and how do we adjust for the different effects that are going on in the different regions? Okay, if you look at the August state unemployment rate, it was at 13.2%, right? The insured unemployment rate is at 13.7%. Part of the issue that we have, and especially in economists, where it's both an art and a science. We love to have the data. We love to have the numbers. We love to model things. It's a pretty clear way to draw hard lines around things. The data right now is very difficult to work with because it's moving a lot. A lot of it's modeled. A lot of it has error terms. A lot of it's going to be benchmarked back. What we're starting to see is that there's becoming a coalescence of different data series, especially like in the job series. So we get unemployment statistics. They're collected in a different way than the payroll job numbers are collected, which are collected in a different way than regular continued unemployment insurance claims. What we're starting to see is that there's becoming kind of a coalescence of those different series, so we have a better sense of what we're looking at now that this bounce back is kind of occurring. What we're looking at as far as challenges going forward in the long term, which statewide is. So if you look at the UII claims right now, it's roughly 190,000. If you look at the unemployed in the unemployment statistics data, it's about 197,000. If you look at the payroll data, it's about 134,000, which doesn't include the self-employed. So it's all kind of pulling together. And I'll talk a little bit about that in the next couple of slides that I have about what our expectations are going forward. That's not only built into this recovery and resiliency plan, but also what's coming out of the economic advisory group. Okay. All the conversations we have on a weekly basis, they're predicated, first of all, by having somebody from Health and Human Services talk about what's going on with the health situation, right? And so when that all happens, if there's another outbreak of COVID cases, what does that look like going forward? What does that mean on how that impacts economic recovery? So these are the headwinds that we kind of think about, and when they happen, how severe they happen, and things like that. So COVID, if we have another outbreak of that, what the severity is of it, vaccine availability and the efficacy of that vaccine, how widespread it is, how available it is, the fear and uncertainty that's tied to that. At the end of the day, so much of what's going to drive economic recovery is consumer and producer confidence, and nobody's going to really make major investment decisions until there's risk can be mitigated. So that gets pulled into it as well when we think about this, and whether or not there will be another additional tranche of federal financial funding and virus-related relief. So I put a couple of slides in here. John Restrepo with RCG Economics, he has been contracted with SRI and Brookings, other consultants that we're using for our recovery and resiliency plan. I pulled these out of here. He's part of all of these economist calls, and so what you see in this chart here ties back into a lot of the conversations we have, thinking about those four headwinds that I had just mentioned. Okay, so this is GDP going out to the fourth quarter of 2021. It's all so First thing it did is forecast out as though there were no pandemic. What would it look like in no pandemic? And then what's the most likely, what we're calling the base case here, and what are the error terms on the upside, the best case, and on the downside, the worst case, okay? So the best case, keeping in mind those four headwinds, GDP will be about 10% below what it would have been had there not been a pandemic. In order for that to happen, the severity of COVID in the fall and winter would have to be fairly similar to what we experienced over the summer. That a vaccine would be widely available in April, somewhere around in the spring, widely available and affordable by spring, which would lead to a small amount of lingering fear and uncertainty. And then we would also have received, before the end of the year, another tranche of federal financial assistance that would help push us through this. On the most likely case, the base case here, for that to happen, if that happens, we'd be 4.8% below what it would look like had we not had a pandemic. That's where those projections stand right now. For that to happen, a minor surge in COVID cases, hospitalizations, and death, the vaccine would be made available, but it wouldn't be here until July of next year. Okay. So along with that, you'd have self-isolation. There may be some shutdowns and pullbacks and that would go along with that. And there would be a modest tranche of federal financial relief, December, January, something like that. Okay. The worst case scenario, that's if everything kind of went sideways. You know, you had a big outbreak of cases. It was sustained through the fall and the winter. The vaccine, there wouldn't be a vaccine that would be really applicable and available until 2022. Self-isolation and heightened fears, uncertainty, further drops in consumer confidence, and no additional tranche of financial virus relief. That would be a drop of 19% of the no pandemic case, which brings us back to first quarter 2015 levels. Okay. On the non-farm jobs, I put this one in here, and again, it's kind of those four criteria that drive the difference in these. So the best case would be down about 1.3% below the no pandemic scenario. Again, fairly constant as far as summer. Vaccines would be available spring, April-ish. Small amount of lingering fear that would go along with that, and we'd get another healthy dose of the most likely case, the base case, would be a drop in jobs of 6.8%. Again, a minor surge in cases. COVID vaccine would be available mid-year. The response of self-isolation and fear would correlate with that. And then, again, there'd be a modest tranche of financial related relief by the end of the year. Worst case on the jobs, that would put us down to 2010 levels with about a 28% drop in jobs. Again, that's if everything went sideways. You got a big surge in cases, hospitalizations, and deaths that would go along with it. It would be sustained. There would be no more federal relief to go along with that. The consumer confidence would drop because of that, and no vaccine available until 2022. So that's kind of what we're seeing there. So this is what was put together, and it's in our draft plan. These really won't have changed much. This slide is what. So when I put together this economics group, I said I needed to have some sort of deliverable on a regular basis to help with policy decisions, decision makers, governor's briefings, things like that. And I asked the members, there's 8 or 9 of them, to say, hey, what would things look like, best case, worst case, most likely case for the unemployment rate, job growth, taxable sales in next March. So this started in March of this year. What is it? So if we compare February 2020, before this all hit, what does it look like in March of 2021? Okay, and these are the latest numbers after I get updates, and I don't get updates all the time, but we ask for them, and there's changes. And again, it's organic, it shifts based on current health conditions, what's going on nationally, internationally, a lot of other things. It's very difficult, right? Because we don't know some of those headwinds, how that's all going to happen. But this is fairly robust conversations. And I know it's been mentioned a number of times, a number of places already on this in presentations earlier, that the 20 million or the 20 billion, 21 billion in federal assistance that the state has seen has largely masked a lot of the economic fundamentals that underlie all of this. And the reality of what makes economies work hasn't really showed up. It's been huge. You need to do it. I mean, it's kept our retail sales, like I can say, it's kept all of that much healthier than it would have been otherwise. But it's hard to tell on the economic fundamentals how this all kicks back in going forward. And so that's why we wanted to present this in a way where you've got error terms associated with it. So if you look at the unemployment rate of 14%, most likely here, if you look at the still down 11.7% jobs by March into the first quarter of next year, that gets us somewhere around that 150,000 jobs dislocated workers that we're going to be dealing with for some time going forward, and the challenges that go along with that. Visitor volume growth at 28% down, and then the taxable sales growth down 18% is most likely. I think you all have these in your packets. I'm happy to talk about them later. Okay. Now I want to roll over into our business development pipeline. And the operative word in all of this is uncertainty and risk mitigation. What I asked Melanie Sheldon, our business development team, is to say, what's in our pipeline this month compared to the same month last year, looking at the prospects, these active projects. I think it's really interesting. I will add to this. We hold, early on we had weekly, now we have every other week calls with the RDAs that I also facilitate, asking them what they're seeing. And it's kind of the same story, and I'm sure you'll hear more about that in the next couple of presentations. But what's very interesting, in orders of magnitude, we have more interest right now than we had last year. Okay? That's all those blue up arrows there. Then it becomes mixed when you get mid-pipeline, right? Where some of them are up, some of them are down when you're looking at the number of companies we're talking to, jobs, build out jobs once they're fully staffed, as well as investments in the state. Then it just flips over when we talk about, and what I'm using here is companies that have actually pulled the trigger and have submitted an application, an abatement application, okay? And again, that's down orders of magnitude. So I think everybody's kind of in this pause, this wait and see, what does this look like coming out? I think that all the federal funding that's been pumped into the economy is making things kind of blurry, not knowing exactly, okay, so how much of this is actually productivity generated revenues that are holding up retail sales, and how much is coming from Treasury. So anyways, that's kind of where we're at. I tried to be as helpful as possible, as you guys have to think about what the forum's mandate is. And I'm happy to try to answer any questions if you have them.
Thank you very much. Craig Billings here. I actually, very, very well constructed presentation. I don't have any questions. Do any of the other members of the forum? Thank you, Bob.
Thanks.
Russell, back to you.
Mr. Smith, if you're ready to bring up your slide presentation, and then you can proceed with your presentation to the Economic Forum members. Thank you very much.
Good morning, everyone. First, let me check and see if you can hear me and see my slides.
Yes.
Perfect. So I'm Jared Smith. I'm the Chief Operating Officer here at the Las Vegas Global Economic Alliance. I want to first recognize Michael Brown and Bob Potts with GoEd for being such great partners and assisting us in what we do. I also want to recognize Mike Kazmierski, who is also on this call here, who is a counterpart to ours up north. And then I also see that Steve Hill is dialed in, and want to recognize Steve for having been a great partner to us over the last 4 years. First, let me begin my presentation today by saying, just to make sure you understand what our mission as an organization is here. You know, our basic mission is to grow the economy in Southern Nevada, and we do this through partnerships all over Clark County. And we specifically focus in on business recruitment and business retention and expansion with our local companies, which really is different this year, right, than past years. Normally, we would be giving you this presentation and really talking a lot about, oh, here's our business attraction efforts. This year's looked a little different. We've had to really dial in with our existing companies, not so much trying to find ways to help them hire more people, but to really keep those businesses afloat. So business development looks different for us in 2020. And just to give you a quick reminder of our partners, and this is sort of our web of partnership within our community. You know, we're partnering with economic developers with our local municipalities. We do that through our Economic Development Advisory Group. You know, our council of chambers and our local education partners. We really spend a lot of time in the community, and thankfully we do that because 2020 we really needed to dive in with these partnerships to assist our local companies more than ever. So this is an example of a typical project that we might see. You know, 50 primary jobs, you know, shooting for a decent pay of $24 an hour and up, absolutely dialed in on healthcare, and then 1 million in equipment, for example, and always focused on companies that are generating 51% of their revenue outside of the state of Nevada. And while this is not a comprehensive list of our target industries in Southern Nevada, in business development, this is what we tend to see the most. Of course, business headquarters, logistics and manufacturing, emerging technology, finance and banking, and autonomous systems. I will tell you that approximately 60 to 65% of our current pipeline is manufacturing and logistics. I want to give you a little bit of perspective here on project wins. So this shows you from 2016 to 2019 what our project wins look like. So this is the total number of projects of any size. We have not published our 2020 numbers just yet, but I will tell you right now, my estimate would be half of 2019. And that's because companies that we've been working with have put their projects on hold. And thankfully, they're not saying, hey, we're canceling our projects. They're just saying, we need to hold, we need to get through the pandemic and understand what our business, how our pivot, what that needs to look like. So bad news, but with a silver lining. This is the total number of jobs through projects that LVGA has worked. And you'll see tremendous results from 2016 to 2019. Again, we've not published our results for this year because we're just not there yet. I can tell you that we at least half. So I think that would be a theme for our results for 2020 here in Southern Nevada. Half of 2019 is what I would anticipate. Average wage has been going up, which is exciting. That's something that our governor's been dialed in on, and as has our board of directors. We really want to see our folks making a higher wage and having a quality job. And from 2016 through 2019, we really saw that result. This year with projects that we're working, I estimate right now around $20 an hour. So we're taking a bit of a dip. And these are, again, I want to remind you, these are projects that we're working. And I would say that if you had a question, Jared, why would you think that we would see that dip? Because the the companies that we're working with that are hiring, say, entry-level jobs in logistics, for example, which is a big driver, they pay anywhere between the $16 to $19 an hour range. And then CapEx. So our capital investment, again, shot through the roof in the past couple of years with some major project announcements in the past that large construction projects. An example of that would be Haas happening in Henderson. Again, my estimate for this would be less than half in 2020. We don't see a lot of projects in our pipeline that are looking to build or buy. In these logistics plays that we see, there's a lot of leasing, so there's not a lot of capital expenditure there. I would say that would be a major driver between last year and this year. So let me tell you a little bit about our project. I'm sorry, does somebody have a question? Okay, I want to tell you a little bit about our project pipeline. I'm showing you the difference between September of last year and September of this year. We classify our projects at LVGA by Class A, Class B, Class C. So a Class C project would be somebody who's just starting to work with us, or is either somebody who we think is maybe on the way out of our pipeline. So that would either be very early, or we're about to not consider them a prospect anymore. Class B would be a company who has either come to the market or scheduled a visit to come to the market and do a site visit with us. So a step above just being your typical prospect. And then Class A, these are wins or just about to be a win. And that would be at the opinion of our team member. So I want to tell you that the difference here, I mean, it just really doesn't look good for Southern Nevada. You know, our Class A projects, our wins are down 52%. And if you think back to the slide where I said, I'm estimating our total number of projects to be about half of what they were, this data proves it. Class B, so these are, again, I want to remind you, these are not just our initial prospects, but somebody's taken a little bit more of a step towards learning more about the community. You know, that's down 33%. But to bolster something that I heard Bob Potts say, if you see here in Class C, we are at the beginning stages of seeing a lot more interest in Southern Nevada. So I think that is very positive, but it's really going to be positive for 2021. Not so positive for right now, because these projects don't move through our pipeline quite that quickly to see that bubble up for announcements by the end of this year. Our total jobs are down, obviously, in our pipeline, and our average wage is down. So not great news, but the silver lining here is we're anticipating 2021 to be a lot more positive than this. So this just puts in perspective the total number of projects for you on those percentages. And I know you have a copy of that, so I won't walk you through the same slide again. Rankings. So this is how our community, our state is being perceived nationally. So you can see that we're up in top states for doing business, and then yet Business Facilities says, you know, we're dropping down for business climate. What concerns me here would be economic job growth, which would be this slide, down to number 43. And that data comes from the Bureau of Labor and Statistics. So mixed results in what we see in rankings. I want to give you just a few thoughts on what I think 2021 is going to look like. 2021 is going to be a year of economic recovery, but it could be slow. We don't know the cadence in which things are going to ramp up. The signs are good now, but we don't really have enough data. We're just starting to see that surge in our pipeline. I think that many industries, they're going to be looking at Southern Nevada are going to be looking at us as an opportunity to lower their overall business costs. I also think that states will be incredibly competitive in the areas of incentives and marketing and how they go after job wins, because every state is trying to replace these jobs. So I think that the competitiveness between Nevada and our neighboring states is going to definitely increase. I also think there's going to be a high potential for accelerated automation. And I know we've all looked at this in the past, automation not being so great for employment numbers, but if companies are trying to bring down their cost of business, I think one of the first ways they're going to do that is through automation. Now, we know that companies are already looking at automation, but I think this is going to increase the speed in which they get there with those decisions. And small companies are going to be more nimble with expansions, I believe, than larger companies. And so to give you a little more on that, I predict in 2021 that our project pipeline will be full of these smaller announcements and not these big 2,000 job announcements. But I want to remind you, the data on this is very early, so that could change. And then lastly, there is hope, right? So 2021 can just be a real year of opportunity. So there's a lot of conversation around reshoring. And I do think that is absolutely possible. I think nearshoring could actually be even more possible. So here in Nevada, we compete with Mexico for manufacturing projects. And Mexico is still a pretty low cost of doing business. What I could see happen is products being made in China, products being made in Mexico, being shipped into Southern Nevada, assembled to make a larger product and then shipped out, which would be fantastic for our foreign trade zone activity. I believe that there's increased opportunities to attract companies that are vacating. Let me just leave it at a neighboring state that we all know is a very high cost market. We're starting to see inquiries from the west of us coming to us even higher than they have been. One thing I will just kind of end my comments with this. You heard Bob talk about the layoffs that are happening around customer service, around leisure and travel. This is very concerning. And what's going to be incredibly important is that our workforce investment boards, our universities, and colleges and high schools and everybody involved in education, anybody that can be involved in training, that we pay particular attention to retraining and reskilling of these folks that have been furloughed or laid off. And the good news is we can train them for higher paying jobs than maybe they lost. But workforce is going to continue to be incredibly important. And I don't mean just the availability of it. I mean the quality of it. And do we have that trained worker? And other states are going to be competing with us in that way. So that concludes my comments for today. Again, I want to thank you, Mr. Chairman, and everyone here on this call. While some of these comments may have sounded a little bit dire, I do believe that that 2021 can absolutely be bright. Thank you very much, and I'm happy to answer any questions.
Thank you for the presentation. Appreciate it. Very helpful. Feels like a bit of an air of uncertainty. So either neither bright nor dark, but just TBD. Would you agree with that sentiment?
I would. 2020 is just absolutely unbelievable for anything that we could see. But and I think Mike is going to probably back this statement up. We are seeing large amounts of activity and new projects for 2021. So I think that is incredibly bright. But just keep in mind, when you announce a project, let's say in February of 2021, it's still going to take a little time for that company to get up and running, for us to see the economic impact, would be faster for a tech company that's relocating to one of our innovation centers. We'll see a slower return on that announcement if somebody has to build something.
Helpful, thank you. And then did I hear you say at the beginning of your comments that that Steve had joined as well? Steve Hill?
I see Steve in the guest list there.
Mr. Chairman, he will be on following agenda item.
Okay, great. Makes sense, yeah. Thank you. Thank you very much. Russell, back to you, unless anyone from the forum has a question. Okay, Russell, back to you.
Okay, Mr. Kazmierski, I saw him up on the screen, so if you can bring your slide deck up and share it with us, and we'll let you know if it doesn't show up. Otherwise, please proceed with your presentation. Thank you.
Okay, I assume you can see that, so let me get started. Russell, Chairman, members of the forum, I'm Mike Kazmierski, CEO of EDON, the Economic Development Authority of Western Nevada. We're, like many of the RDAs, a nonprofit. We are a community board, the only community board in our region that blends government, business, education, and other partners together to address economic development needs and community needs. Our area of responsibility is pretty much the metro area, Reno-Sparks, and the I-80 corridor, including TRI out to Fernley. The more rural opportunities in the region are addressed by the Northern Nevada Development Authority out of Carson City. Our strategic plan is pretty simple: attract great companies, keep them here, and help organic growth through startup activity. We work with the community, and workforce development is important to all of that. Our attraction priorities pre-COVID, pretty simple: technology, corporate headquarters, high-paying jobs with a focus on the Bay Area. We have been successful in attracting more and more technology companies to the region. The trend continues to be up. And none of these technology companies were in our community 6 years ago. And that's a pretty impressive stack of tech that we are planning to add to pretty significantly in the next year or two. You may have noticed this in Brian Bonafont's briefing, but it's a pretty important statistic. It shows where the average annual growth rate and median job rates have been dramatically up. You can see the flat before we really started aggressive economic development, and this is coming out of the recession. This median household income is up 47% in 7 years. So that has allowed us to better deal with our greatest challenge, which is affordable housing we'll talk about later. First, COVID hit, the world changed. We reacted as many did. The difference here is because of our diversification, bringing in over 200 companies in the non-tourism, non-gaming area, including advanced manufacturing, logistics, distribution, technology, and others. We have managed to diversify. If you look, really starting about 2014, 2015 on, our unemployment rate continued to be lower than the Vegas metro area. And the pandemic hit, and you can see our recovery has been fairly quick. In fact, we're below the national average now on unemployment. Because of that, and because our workers are working, manufacturers are working, logistics employees are working, technology workers are working, most from home. Our sales tax revenue is actually up over the last several months over last year's number by more than 10%. So that shows that the economy here has not felt the same impact as a more tourism-based economy down in Vegas. Post-COVID or during COVID, we moved or shifted to take advantage of some of the opportunities, continued to work our Bay Area attraction efforts, which are really bearing a lot of fruit. We shifted to pharma, medical manufacturing, and onshoring. We know that's coming back to the U.S., and we want to be a place for it. And certainly remote workforce talent attraction. Getting talent here is important as we bring more companies in that need a quality workforce. Just some pending announcements. These are companies that have agreed to come here. We are teeing them up for announcing in the next 90 days. again, you see mostly manufacturing, which is pretty exciting, and more technology. And our hot prospect list up, we're working with about 150 companies right now. This is really those coming close to making a decision. What's really exciting and scary at the same time is if you look at our leads and projects, we get somewhere around 15 or so a month on average. And in 1 month in August, we had 42. What that tells you is we are seeing dramatic increase in interest and prospect activity, even though corporate travel with the East Coast and the Midwest has pretty much been shut down. On the attraction side, a lot of good news, a lot of activity, but we've got to help the companies that are here. So we work with retention, expansion, workforce development to assist the companies that are dealing with the pandemic and other issues, other challenges they may have to face. The biggest challenge right now is workforce. And you can see with the companies coming in, paying higher wages, a lot of the employees are leaving one employer and moving to another for pay raises, causing more and more of the companies here to have to raise wages, which is why if you go back to the beginning, you see where we're up 47% on employee wages, median household income over the last 7 years. It's driven by demand for employees and demand for talent. We have to invest in reskilling. Many of the gaming tourism jobs are not coming back. They're being automated in many ways, replaced, modified, and those employees with reskilling investment can easily fill a job that pays them far more in some of the industries we're bringing in. And just some of the upskilling initiatives we're working on now in partnership with the community college, university, and some of the state programs. Robotics is really the key. From a symbolic perspective, a robot isn't all that exciting until you understand it requires coding knowledge. It requires other skills to allow that robot to do what's needed. All those are based on STEM education that is not permeating our education system adequately. We do have a robotics lab we're going to launch here in December, a partnership with Tesla and UNR, which will help us put more emphasis on robotics. And so that's the attraction workforce side. The last piece we focus on is organic job growth, entrepreneurial growth. We have a team that works aggressively to help startups be successful and attract startups to the region. Our tech attraction side has been off the charts lately. More and more of the technology companies in the Bay Area, the startups, the founders, the investors are looking for other places to do business. And we just happen to be fairly close. So they're looking at us pretty positively. We do have our own seed fund we set up here. We are investing in companies. It also allows us to attract companies that are looking to participate in the seed fund. It's very important to get those initial dollars into a company and help them have proof of concept on their idea so that they can grow their company here rather than somewhere else. And there's a lot of programs we support to help the ecosystem connect and support the entrepreneurs. With all that said, like every community, there are a lot of issues out there. We're dealing with all of them in some way, shape, or form, but the biggest one, you heard Brian Bonifant's presentation, we have issues with housing. We certainly have fewer housing units even being produced than what we need. And these impacts affect a lot of other things. They drive up the prices, they affect homelessness, they increase sprawl and traffic and all the other things associated with not having adequate housing. This is a good chart to show where we've been and where we are. You can see before the recession, we had a lot of single family housing units. In fact, we were producing and filling more with 2/3 of the population than we are now from a housing perspective. In purple are single family housing. You can see where our single family housing is pretty much flattened out post-recession. While we're producing units, and it looks like they're everywhere, it's not nearly adequate to the demand. You see some of the green here, those are townhouses and condos. And then what we're filling the gap with now is apartments. It's the only thing people can afford, and even those are fairly high priced in comparison to where they were pre-recession. A lot of things we're trying to do to help that. Housing affordability is a national problem. I think it's going to be an increasingly concerning state problem, and up here we've hit the critical level. The second area of high concern for us is education. Clearly, the state budget is under duress. There will be more cuts, more than likely, in the year or two ahead, at a time when our education institutions are underfunded to begin with. This just affects their ability to meet the needs of our employers of the future with more technology training and STEM training. Education Law Center didn't rate our education system very high, so especially when it comes to funding effort, funding distribution, and funding level. We're only one of 2 states that have all Fs in that category. Finally, we report out metrics to our board on a monthly basis. GoEd sits on our board, and this is just a track of the main areas we focus on: attraction, retention, entrepreneurial growth, workforce development, and financial. And we track this and report this on a monthly basis. The place we need help or areas we need help, I mentioned workforce development training, especially robotics and coding. Funding for education and local governments, the reset upon sale state legislation that should have been heard at the last session would have helped. Things like that are those opportunities we can't afford to let pass going forward. Support for entrepreneurs. We have a great opportunity to make this the most entrepreneurially friendly state in the nation. Affordable housing I mentioned, and support for RDAs. For every state dollar we get $4 in local support. It's actually $5 now. And we are really struggling from an investment perspective as some of the companies that have supported us, gaming institutions, for example, are struggling to manage the pandemic. So that's really it for me. If you have any questions, I'd be happy to answer them.
It's Craig Billings here. I don't have any questions. Does anyone else from the forum have a question? Thank you very much, Mike. Appreciate it.
Okay, my pleasure.
Russell, back to you.
Thank you, Mr. Chairman. So that concludes agenda item 10. The next agenda item is agenda item 11, and this is the presentation on the current status and outlook for the tourist and convention/trade show market in Nevada. And for this agenda item, we have, as was discussed previously, Steve Hill, who is the Chief Executive Officer and President for the Las Vegas Convention and Visitors Authority, as well as we have Jennifer Cunningham, who is the Interim Chief Executive Officer for the Reno Sparks Convention and Visitors Authority, Brenda Scolari with the Director of the Department of Tourism and Cultural Affairs, and Mr. Kyle Schultz, who is the Research Manager of the Division of Tourism, Cultural Affairs. And I saw Mr. Hill on the screen, and I already see the slide deck up. So, Mr. Hill, thank you, and please proceed with your presentation.
Thank you, Mr. Ginden. You hear me okay?
Yes, we can.
Yeah, okay, thank you. Mr. Chairman, members of the forum, I'm Steve Hill. I'm the CEO of the Las Vegas Convention and Visitors Authority. I appreciate the opportunity to be with you this afternoon. I certainly do not envy the job that you have in front of you, as you've obviously seen, and I'll reflect a little bit. The range of outcomes is as broad as we can all imagine. So your job ahead of you over the next several months, I understand, is very difficult. We all appreciate you doing it. Trying to figure out how to use the technology. Thanks. A number of things that I'll mention you have heard already today. The dependence on tourism in Southern Nevada is obviously very high. This just provides some perspective, not only of our dependence on it, but how it compares to the dependence from other destinations across the country. That dependence is down somewhat, as you've seen. Mr. Potts showed that in the location quotient. but it is still the driving economic engine of Southern Nevada. The next three slides are travel, both in the drive market, the domestic travel and international travel as it relates to the United States. So you can see drive traffic has recovered pretty well since the April-May timeframe. Las Vegas is actually producing better than that. We have recovered more significantly, almost to the point, and I'll show you a little later, where the drive market has returned to pre-COVID levels. Understandably, air travel is significantly down and is gradually recovering both across the country and here. And again, Las Vegas is overperforming in comparison to the rest of the country. And then international travel is down pretty significantly across the country and here in Southern Nevada as well. When we think of international travel, really need to split it somewhat. Obviously, Canada and Mexico in normal times functionally act like additional states in terms of visitation to Southern Nevada. They are our largest international markets. Overseas at this point, there's really virtually no travel from overseas from an international standpoint. Employment in our industry was hit really harder than any other industry and continues to be a significant cause of pain for so many workers in this industry. It will certainly take time for that to recover, but employment is down about 25% from where it was prior to the virus. You can see here the impact that employment had during the recession a decade ago. The impact now is significantly greater and will take some time and really growth, I think, in the destination, not just a recovery, but some of these jobs will undoubtedly be permanently lost without growth in the destination. You can see that our visitation is down 57%. The convention meeting segment, and that is a broad variety. Think of the major shows like SEMA and CES and some of the major corporate events. But we categorize anything in the meeting and convention segment as an event that brings 50 or more people to Southern Nevada. So we had 24,000 of those types of events that brought 6.6 million people during 2019. That includes events like weddings, which are a number of those. That segment is starting to recover a little bit, but functionally it is really not in existence right this minute. Leisure segments recovered about 50%. That is driven, no pun intended, driven by the drive market, but we are seeing a gradual return of the fly-in market as well. Here you can see what the statistics look like at the end of August. They have improved somewhat since then. So I-15 daily traffic over the last couple of weeks really has started to mirror what those same weeks were in 2019. So we are basically back to a fully recovered Southern California drive market. But it is the market that is the majority of our visitation at this point, rather than just 45 or 50% of our visitation a year ago. Airport passengers down 61% at the end of August. That will, you'll see in September and October, some gradual improvement in those numbers, but certainly nothing approaching what they were a year ago. Here you can see room nights occupied versus occupancy rates. We base occupancy rates on the number of rooms that are available. And even now when properties are reopening, they are not reopening 100% of their rooms in most all cases. So room nights occupied are down 58%. That's total rooms in the destination, while occupancy is down 45%. Obviously, from a competitive standpoint, that allows room rates to drop, and they're down 18% at the end of August. Gaming revenue has not dropped at the same level as visitation or occupancy, really for I think probably a couple of obvious reasons. One is that the locals market is a larger portion of the entire group of visitors to or customers of resorts across Clark County. And they're spending because there are really less entertainment options, less opportunities for their spending. So they are visiting casinos on a somewhat higher level than they did a year ago. And given that our visitor segment is down, their proportion of that spending is up. In addition to that, the people who are our customers who are visiting Las Vegas now are a larger proportion of casino customers. And from a set of opportunities for spending and entertainment in the destination, obviously the casino floor is available. Some of our entertainment venues, certainly all of our entertainment venues, were not, and they are starting to return. But that has driven the gaming per room night occupied up very significantly. So we're in the 350 or a little bit above in the last few months, compared to kind of historical numbers that are around $200 per night. We had seen some increase in that over the first part of this year. This just shows you a little graphically the difference between the number of rooms that are built in Las Vegas, nearly 150,000. Turn that into, multiply it by 30, it turns it into room nights available, versus where we are right now with the number of rooms that are actually available for customers to occupy. We kind of debated how to show April and May. If you look back on that period of time, really about 15% of the 150,000 rooms were actually available. The rest in the resort corridors and then the gaming establishments were basically closed. And as you've heard from really a number of the presentations that you've gotten today, these same 6 themes for the most part continue to come up in what they have said. The timing of the vaccine and the rollout of that vaccine are critical to projecting the future and the recovery of Las Vegas. We tend to agree with Jeremy's assessment that a vaccine coming out in the first quarter with a distribution over the next 6 to 12 months is the most likely outcome. And as you've seen, the ranges around that are very wide. We also see that our customers are becoming more and more willing to live in an environment where they know COVID exists, but they need to get back to their lives. And so that is causing kind of gradual recovery in the face of having to live with the virus. And we also see that our customers or potential customers' travel indicators move in pretty close coordination or in correlation with the health metrics. So when the country's health numbers improve, customer sentiment improves. When the health numbers start to deteriorate, that sentiment starts to deteriorate as well. But the general trend also includes some slight improvement in customers' willingness to travel in the face of the health situation, rather than a complete correlation to the health situation. International recovery will certainly take time. All of these markets have an effect on Las Vegas. It's not just the health and safety situation in Nevada that matters. It is the health as well as the economic situation in each of these markets as we move forward, and that affects our customers' ability to travel. I will point out that, and this is also something I know you know, but the meetings and conventions have become even more important to our recovery. And being able to do so as soon as we can is important, because what we're seeing is customers looking out into the future, both to plan and to consider whether to actually hold those meetings and conventions. That timeline is starting to stretch out. When this started, it was a kind of a 3 or 4 month outlook for if a meeting or convention was booked, are we going to be able to follow through with that? What we're seeing now is that is stretched out to 6 or 8 months. So we are all now in conversations, for example, around meetings in the second quarter of 2021. And if we don't see improvement, a clearer path toward having those meetings, we have customers who are looking to potentially cancel or looking to actually move to a different location that does offer them the opportunity to have that meeting or convention. So the situation we find ourselves in now, the decisions that we're making now are starting to affect that industry or that portion of our visitation out 6 to 8 months. As people have mentioned several times, the stimulus was exceptionally helpful. The first stimulus package that passed was exceptionally helpful in basically bridging over the economic issues that the virus faced. That is coming to an end. There is still some available, but certainly coming to an end. We've got a party who thinks we need $1 trillion in stimulus. We have another party that thinks we need $2 trillion. And the result of that has been none so far. So we would certainly ask that stimulus and the importance of that stimulus be recognized and move forward. We're going to need it for the recovery of the country as well as Nevada, and particularly this industry, which has been the hardest hit industry, not only in Nevada, but in the United States. We hear this from all destinations across the country. So that will play a big role in how quickly we can recover. So with that, Mr. Chairman, members of the committee, or members of the forum, I'm happy to answer any questions you may have.
Thank you very much. It's Craig Billings here. I think everybody's aware of the extent to which Las Vegas is a pretty complex beast that requires a lot of levers to really tick. The dearth of group and convention business, I think the impact on the city really cannot be understated. It is what drives pricing power midweek. It is what drives a tremendous amount of operating leverage through the town, and employment will be unusually dependent on its return, actually, because of those factors. It's easy to fill an integrated resort on the weekends. It's very difficult to fill it on weekdays, and you can't lose money all week and then make it back on the weekends, right? It's no way to earn a living. So with that in mind, I guess that, a couple questions. One, do we think that we will have, do you feel like, and when you talk to big, big booking, big convention organizers out there, do we feel like we're going to have a pre-vaccine return to the extent that we have better clarity on rapid testing and other measures to create a safe group experience? That's kind of point one. And then point two, citywides are important, and we've seen those citywides like CES get canceled here over the course of the past couple months. What is your latest thinking as we try to forecast into 21 and 22? What is your latest thinking on the likelihood of citywides?
Chair Billings, Steve Hill. I think the conversation needs to be bifurcated between corporate events and some of these major citywides are put on by associations. So Consumer Technology Association, for example, puts on CES. A number of the citywide events are put on by associations, or they are put on by for-profit trade show companies. And the profit motive for those associations or the for-profit companies really drives them to need to have these shows happen as soon as they are available to happen. They're willing to do virtually anything that they can to assure both our state and their exhibitors and attendees that they can have that show in a safe and healthy way. So whatever those protocols need to be, they're willing to do. And moving those shows to a different destination is possible but difficult. And so most are having to make the choice of, having to just respond to the situation in Nevada. From a corporate side, many of those meetings are more of an expense center than a profit center, or at least some combination of that for the corporations that are putting those on. And there's a lot more of those shows. The attendance is probably pretty similar, but corporate events are exceptionally important, as you well know, to Las Vegas. They are both the citywide association and trade shows, as well as the corporate events, have to spend a fair amount of money in advance of the shows in order to make them happen. So, and particularly in the corporate events, they're starting to look out 6 to 8 months, saying, if it doesn't look very likely that we're going to be able to have those shows, we're probably not going to invest the money that it takes to keep that show viable for 6 months. So the corporate shows, frankly, are looking out further, generally more at risk. The major citywides want to come back as soon as they are capable in Nevada of doing so.
So, okay, thank you. So I guess what I would infer from that is that on the corporate side, we'll have a lot longer notice to the extent that we think those aren't going to happen. And on the citywides, there will naturally be a tendency to kind of hang on and make the decision a little bit later in their process. Is that a fair assessment?
Chair Billings, that is a fair assessment, and it is what we are seeing. I think it's what the properties and the destination are seeing They're seeing shows right now cancel in the second quarter of next year, starting to be concerned about the third quarter of next year if we are not able to have a different message for those types of events.
Okay, thank you, Steve. Anyone else from the forum have any questions for Mr. Hill? All right, should we go up north?
Thank you.
Thank you.
Mr. Chairman, then next we have up Ms. Cunningham with Reno Sparks Convention Visitor Authority, and I saw her come up on the screen. So again, hopefully she'll be able to get her document to share. And Ms. Cunningham, please. And there it is on the screen. So thank you very much. Please proceed.
Can everyone hear me?
Yes.
Perfect. Thank you. Good afternoon, Mr. Chairman and foreman members. We're getting close to our lunchtime hour, so I am going to be as succinct as possible and kind of whip through some of the things that we're experiencing in Northern Nevada. This is what we're looking at for cash occupied room nights. And if you look at the 539,000, that represents August of last year. We're at a 25.6% decline in occupied room nights when we compare to last August. Average room rate is recovering. We're only realizing a 12% decline for August of 2020 versus August of 2019. So we're feeling good to see that number go up. Taxable room revenue, which is what we're all most interested in. We're seeing August compared to prior year is a 39% decrease. And actually, while we're on this call, I was just looking at some of the preliminary numbers because on the 15th is when we get the room tax collections. And the numbers for September continue, these numbers are continuing to improve. So we're looking at a 39% decline. For September, it's going to be a bit less than that. So that's really encouraging news on our room revenue numbers. Brian Bonifant kind of touched on the airlines a little bit, but I want to talk about what we're looking at like in Northern Nevada at the Reno Tahoe International Airport. Of course, departures are down. We've got fewer destinations. What's interesting, though, is as airlines are looking to leisure destinations to move their assets to, we're getting a lot of activity and interest from some of the airlines to seasonal put in some new service. So we have not had Palm Springs nonstop for, I don't know, at least a decade. And we've got Alaska looking at that. As we know, Southwest is going into Palm Springs, serving other markets. JSX has been speaking to us. We have a deal with them for Burbank, and we're looking at Orange County. So the great news is Reno is benefiting from, I think, the outdoor recreation and that kind of reputation of our destination is really helping us as travelers are looking for that kind of a vacation these days. Real briefly, I'd like to just talk about some of the trends as they relate on a national level, but as they relate to Reno. The third bullet point under travel trends, what we're seeing, and I've got a few slides about this, but the vacation rentals, they're really remaining strong and increasing year over year because obviously as travelers want exclusivity, and we're fortunate to have Lake Tahoe in our background, and that has been a very desirable site for travel during COVID. And also, our destination is poised because of the demand for outdoor activities, but this has actually been a challenge for us because there has been over tourism at Lake Tahoe this past summer and these past few months. And it's been a challenge that we've needed to try to dial back and harness a little bit. With respect to the meeting side, definitely I echo Mr. Hill's comments about many of our convention groups, especially the associations. That's their major source of revenue that they have on an annual basis. So they are looking to how do we continue to have an annual convention, but make it a hybrid so the numbers will be smaller of the people meeting in person. However, they want to continue to do so. We're noticing also on the meeting side, throughout COVID, the activity that we've had with sports groups has stayed pretty steady for the most part. We're still hosting bowling events, not the United States Bowling Congress, but smaller bowling events that adhere to the governor's protocols and restrictions. Equestrian events have continued in our Livestock Event Center, and then other things like baseball events and tournaments. So we've been able to hold on to that, and we are seeing interest in continuing to book some of these types of activities and tournaments. So going to the vacation rental, taxable room rental, you'll see if we look back to kind of 17 to 20, there's a 36% increase, which isn't surprising. I think it's just become more and more popular. But when we compare 19 to 20, 2019 to 2020, that's a 9% increase over the COVID period where the hotels were all realizing a decrease. And the percentage of our room revenue that comes from vacation rentals in fiscal year 19, it was a 4.7% of our room revenue. Then in 20, it is fiscal year 19-20, that increased to 6.5%. For the month of August of 2020 right now, the room revenue from vacation rentals was actually 12% of our budget. Let's see. And then just you'll see that the occupied room night is increasing, but where we're seeing the impact is a lot of those properties up at Incline Village and the rates, the nightly rates that they're getting, and we're definitely benefiting from that. And that is really the end of my presentation, and I'm open for questions.
Any question from the forum members? I don't have any. Thank you.
Thank you very much.
With that, Mr. Chairman, under this agenda item, then we have Ms. Clary and Mr. Schultz from the Department of Tourism and Cultural Affairs.
Good afternoon. There we go. Can everyone see my screen?
Yes.
Wonderful. Well, thank you so much for the opportunity to share some of our research with you today. Our forecast represents the economic indicators that we watch as the statewide destination marketing organization. It includes both charts that are predictive of travel trends and speculative outcomes based on data modeling. There we go. The first travel indicator is the most dire health measure, which is hospitalizations due to COVID. This is quite often what travelers perceive at a destination as safe, kind of a leading indicator in regard to that. This chart, like many in this presentation, depict 3 assumption levels. They are best case, mid-level, or most likely, and worst case scenarios. The red line depicts actual hospitalizations per month to date. The worst case depicts another business closure or restrictions due to seasonal caseload or other factors. The second spike that you see in the dark blue line mimics the one in July when restrictions were lifted. The mid-level blue line, or most likely scenario, assumes slow but steady recovery. The best case at the bottom, the light blue line, assumes a vaccine comes to market in the spring. COVID severity sentiment, when potential travelers were surveyed with the question, in the next month, how do you expect the severity of the coronavirus situation in the US to change? The greatest percentage of respondents who expected COVID severity to worsen was in April at 71.3%. Thus far, the highest response indicating perceived improvement was in early June, but has declined since then. This represents statewide airport volume for both McCarran and Reno Tahoe. The red line shows quarterly volume growth since 2014 until the statewide closure last spring. The growth since restrictions were lifted depict a best case with monthly volume over 4 million by April of 2021. Worst case, the dark blue line depicts another shutdown. Traffic volume, traffic data from the Nevada Department of Transportation in both northern and southern Nevada show road travel has recovered faster and shows less variability between likely recovery scenarios. Road trip sentiment. When surveyed, respondents continue to show high levels of preference for road trips over air travel. Convention attendance has come to a virtual standstill since the pandemic. Best case doesn't have any attendance activity until January 2021, and at low levels even then. Worst case assumes no convention attendance through the end of 2021. Conference sentiment, among those surveyed, sentiment around attending conferences or conventions has shown to be very stable throughout since surveys began in March. Still, nearly 3/4 of travelers remain hesitant to travel for a conference or convention. Some other economic indicators to consider. Some of these slides might be duplicative, so I will go through them very quickly. Consumer confidence index. Consumer confidence fell about 30 points after the start of the pandemic, has yet to show any form of robust recovery related to spending. We view consumer confidence as reflective of a willingness to spend related to travel. U.S. payroll employment, growth in employment has slowed every month since June, suggesting that recovery to pre-COVID levels of employment is still quite a ways off. Wages and salaries. This chart depicts the slow recovery of wages and salaries over recent months. The U.S. unemployment rate, there has been a similar slowing in the domestic unemployment rate seen over recent months, currently at 7.9%. U.S. employment by industry, though each industry is above 4% in terms of unemployment, the leisure and hospitality sector has the highest unemployment rate of any sector by a wide margin at 19%. The travel industry clearly has been the hardest hit by the pandemic. Other travel sentiment indicators, concern about contracting the virus. When asked, how concerned are you personally about contracting the virus? Respondents expressed concern about contracting the virus at a steady level since March. Though there have been some ebbs and flows, concern about contracting the virus has held steady. These word clouds indicate how those surveyed describe their feelings about travel. Though negative descriptors still predominate, like scared and unsafe and cautious, some positive words like excited, ready, and confident are present as of September. We feel like this is evidence that travel demand is building. Comfort and community sentiment. When those surveyed were asked if they feel comfortable going out in my community to restaurants, local attractions, and undertaking local activities. The response line shows that as people gain comfort engaging with their own local communities, it becomes more likely their comfort zone for travel will expand. Avoiding travel sentiment. After a high of nearly 83%, roughly half of travelers currently say they plan to avoid all travel until the coronavirus situation is resolved. However, this concern has flattened recently, and it's currently at 53%. Travel mindset. Over half of the travelers now indicate they are ready to travel in some way. This is up from 43% in July. Destinations associated with the virus. When asked what destinations they associate with COVID issues, Las Vegas fares well, unlike in New York, Florida, California, and Texas, which were listed as destinations of high concern. Desired destinations. Another very positive indicator is that both Las Vegas and Nevada score among top of mind destinations in the next 12 months, indicating both will recover relatively well once a vaccine is available. Travel spending. This shows that compounding losses in visitation during the pandemic, travelers are also signaling that they have less disposable income to spend on travel and expect to spend less in the coming 12 months. In summary, some of the key takeaways from this research are high-level economic indicators show slowing rates of improvement, suggesting a long recovery period is underway. Returns to travel will be determinant on health situations and concerns. Fear levels around contracting virus largely unchanged over the past few months, suggesting a similar lengthy recovery in travel. Though fear levels remain elevated, many travel sentiment indicators are either slowly trending in a positive direction or remaining stable. However, travel sentiment is still far from normal levels. Though travel levels remain depressed, Las Vegas and Nevada still top of mind as destinations for travelers. This does provide hope that pent-up travel demand will lead to a quicker travel recovery when the COVID crisis passes. Our visitation forecast. Nevada room demand. Similar to other patterns, the light blue best case line depends on availability of a vaccine in the spring, with room demand approaching 2014 levels by fall of 2021. Room demand is still well below pre-COVID levels, even in the best case, as you can see on this chart. At its peak in 2018, room demand was at just over 58 million. Best case scenario in 2021, only reaching 51.9. Average daily rate, best case scenario has ADR returning fastest in Las Vegas and Washoe County. Worst case depicts a large dip in early 2021. This depicts Travel Nevada's room tax collections. Travel Nevada is funded entirely by lodging tax, 0.3% of statewide collections. Reflective of both ADR and room demand, best case shows a return to pre-COVID monthly room tax collections in July of 2021. This chart depicts also our funding levels at a high in 2018 of 26.6 million, with a most likely funding scenario in 2021 of 15.5 million. As a caveat to kind of the limitations of this forecast, the sample size of the surveys that were done by destination analysts at the beginning of the pandemic is relatively small. It's about 1,200 people, but they were surveyed weekly since March. And as some of my colleagues have expressed prior, there are so many volatile factors at play, including health concerns, domestic and international political outcomes, the distribution of a vaccine and its availability, consumer confidence, travel sentiment, et cetera. Any one of those factors could very deeply affect or skew the outcomes depicted in some of this modeling. But it is our best guess at the economic health of our metro and rural tourism communities in the state. That concludes my presentation. If you have any questions, I'm happy to answer them.
Craig Billings here. Thank you so much. Just can you remind us again, the presumption on vaccine timing underlying all of your best case forecasts was what? Or vaccine timing, and is it vaccine development or vaccine distribution?
It's vaccine coming to market in the spring of 2021.
Okay, thank you. Anyone else? Okay, thank you, Brenda.
Thank you so much.
Russell?
Thank you, Mr. Chairman. So we can proceed with agenda item 12, which is presentation on the Nevada insurance markets. And for this agenda item, we have Nick Stozic, who is the Deputy Commissioner, and Jeremy Gladstone, who's the Assistant Chief Insurance Examiner, and they're both with the Division of Insurance of the Department of Business and Industry. And then after that, we have Heather Korbolik, who is the Executive Director, and Jennifer Krupp, who is the Chief Financial Officer from the Silver State Health Insurance Exchange. And with that, I see the slide presentation up on the screen for Mr. Stozic and Mr. Gladstone, so please proceed. Thank you.
Good afternoon, Mr. Chair, members of the forum. I appreciate the opportunity to be here today and present at the Economic Forum on behalf of the Division of Insurance. My name is Jeremy Gladstone, and I am the Assistant Chief Examiner of the Life and Health Section at the Nevada Division of Insurance. I am here today with Nick Stozic, Deputy Commissioner at the Division of Insurance. We will be presenting on information on Nevada's insurance market. Hopefully we will be. No. Excuse me. For my portion of the presentation, I will be focusing on the products in the life and health markets. The following chart shows historical written premiums for life, annuities, accident, and limited health products. The premiums collected on these products have seen consistent growth over the last 7 years, with the exception of 2016. Based on the written premium projections for 2019, the premiums collected on these products have grown almost 34% since 2013. While preliminary numbers are not available for calendar year 2020, the division does anticipate an impact from COVID-19 on these products and project that 2020 will end with written premiums flat with little or no growth. The following chart looks at one of the products included in the previous slide and isolates the premiums and deposits specific to life insurance in Nevada. Over this period, life insurance premium written and deposits have increased 40% for life insurance, starting at $2.76 billion in 2009 and projected to be at $3.86 billion by year-end 2019. Prior to 2013, life insurance premiums and deposits were relatively flat and then spiked in 2015 at $3.8 billion, only to decline in 2016 and 17. 2018 and 2019 saw growth of 15.4% and 4.72%. While life insurance does tend to be a more resilient product during economic downturns, the COVID-19 pandemic represents an unprecedented event in Nevada's history, and there is no certainty on how the pandemic will impact premiums. Historically, life insurance premiums have experienced a decline during economic downturns, and the division will continue to collect data to determine if similar experience will occur with the COVID-19 pandemic. At present, the division is projecting flat premium with little or no growth for 2020. The next slides and that proceed will focus in on Nevada's healthcare and where Nevadans are currently getting their coverage. The data collected for this pie chart represents data as of year-end 2019. Overall, these numbers have remained relatively consistent over the last several years. It is important to note that from a tax perspective, that not all health plans sold in Nevada are required to pay premium taxes. The fully insured plans in the individual and group markets pay premium tax along with managed care organizations in the Medicaid market. The plans offered in the self-funded group market, Medicare market, and TRICARE VA healthcare markets are not subject to premium taxes. With the increased unemployment from COVID-19 and the loss of medical coverage for employees, the division anticipates a shift in how Nevadans are covered. While we don't know exactly how the shift will occur, given the impact of COVID-19 on the gaming industry and the increased unemployment in this sector, some of the loss of covered lives will most likely occur in the self-funded group market and the large group fully insured market. Based on Medicaid's projection of an increase in covered lives of approximately 100,000 lives in the next two fiscal years, the division would anticipate a little over a 3% increase to Medicaid's share of Nevada's population and a drop in the self-funded group market below 30% of the state population. Given that self-funded group plans do not pay premium taxes, this shift could result in an increase in taxable premiums between these two segments and may offset tax premium decreases in other taxable segments. This slide looks at the various health lines of business written in the state and shows a breakdown of the membership and premiums written. The top three health lines of business in Nevada based on written premiums for calendar year 2019 were Medicare, Medicaid, and group comprehensive insurance. These three lines make up 85% of the written premium in 2019. When considering the potential impact of COVID-19 on the health premiums in the commercial markets for 2020 and beyond, the division looked at a variety of factors, including market shifts due to loss of unemployment, premium rebates due to COVID-19, and special enrollment periods. Based on these factors and the division's premium projections, we estimate a drop in premium tax for health lines ranging from $11 million for the optimal scenario to $25 million for the worst case scenario, or 11.8% or 26.8% of the projected tax premium. Please note that these projections do not take into account the additional premiums that would be collected due to the shift to plans in the managed care Medicaid market that was discussed in the previous slide. In looking at the ACA health markets, there has been a decline in overall premium for all markets when looking at the last 2 years of data. However, in looking at the year-over-year change from 2018 to 2019, we see a shift in the premiums collected. The individual and small group markets experienced a drop of 6.29% and 14.85% respectively in written premiums, while the large group market saw an increase of 5.16%. Some of the factors that may have contributed to these changes are the elimination of the individual mandate for ACA plans, as well as the introduction of the association health plans, which offered additional options to sole proprietors that were forced into the individual market under the original guidelines of the ACA, as well as small employers seeking alternative, more cost-effective options. The overall price of healthcare under the Affordable Care Act has seen some significant increases for Nevadans in the individual market. However, recent years have seen some stabilization of those rates. While the average rate change continues to increase, the high rate increases that Nevada's individual ACA market experienced through 2018 have stabilized, and the last 3 years have seen more modest rate increases. The higher approved rate change for plan year 2021 is a result of continuing increases in claim costs driven by an increase in cost and utilization trends, deductible leveraging, expensive technology, and the potential impact of COVID-19. While there are some downward drivers which are expected to offset the magnitude of these increases, the net effect is an increase of the plan year 2021 premium in the individual health insurance market in Nevada. In looking at the rate changes for the small group market, the historical changes have seen less dramatic swings, with the highest rate change occurring in 2018 at 7.91%. Overall rate changes have consistently remained at 3% to 5% for the small group market. When we look in more detail at the individual ACA market, we can see the stabilization, which was reflected in the previous slide on the approved rates. The graph in the top left corner shows average premium for a 40-year-old in Nevada by rating area. While the premiums for more rural areas of the state have always been higher, there was a clear spike in premiums for individuals in rating area 3 in 2018. This spike is visible for all rating areas and is followed by a period of stabilization where rates dropped and then leveled off in comparison to the heights of 2018. Another sign of the historical instability of the market has been the exit of carriers from both the on-exchange and off-exchange individual market. The early years of the ACA in Nevada saw the greatest participation in both markets, but as rates increased and the profitability of the market came into question, Nevada saw many carriers making the choice to not offer plans in certain rating areas or to exit the market completely. Since that time, and with the stabilization of the market, Nevada has seen a return of carriers to both the on-exchange and off-exchange markets. Plan year 2020 saw the entrant of a new carrier, and plan year 2021 has 2 new carriers entering the market. The on-exchange market participation matches previous heights for several rating areas, with 5 carriers in rating area 1, 4 in rating area 2, and 3 in rating areas 3 and 4. While the off-exchange market has not experienced the same return to the market, there have been several new entrants to the market since the lows of 2018. Going into plan year 2021, there will be 6 carriers in rating areas 1 and 2, 4 in rating area 3, and 2 in rating area 4. At this time, I'd like to hand it over to Nick Stosic, Deputy Commissioner at the Nevada Division of Insurance, for the remainder of our presentation.
Thank you very much. Let me try to get my screen coming up. All right, can all of you see that?
Yes.
Perfect. All right, well, thank you. So again, Chairman Billings and members of the forum, for the record, my name is Nick Stosic. I am a Deputy Commissioner with the Nevada Division of Insurance. And I'm going to use the remainder of my time this afternoon discussing the property and casualty markets in our state, in addition to the combined written premiums. And as you can see from this slide, the health insurance accounts for 39% of the state's written premium. And then life and annuities, along with some other health-related products, make up 28%. And then our property and casualty insurance represents approximately 1/3 of Nevada's total insurance written premiums. Written premiums are reported by carriers to the National Association of Insurance Commissioners. And the NAIC reports that we have access to are unfortunately all based on a calendar year basis. So we always have to try and determine year by year, fiscal year versus what we're showing you, always on a calendar year basis. Unfortunately, due to the pandemic, there are some delays in NAIC reporting, and the 2019 Nevada report card that we utilized to provide a lot of the information to you has not been released in time for this meeting. So Jeremy and my 2019 written premiums, some of those are based on an estimated basis from other NAIC reports that are available. Nevada's report card is expected to be available by the end of this month, and we're happy to provide members of the committee a copy as soon as it's issued. Now, as you can see from this slide, the direct written premiums for property and casualty insurance have steadily risen over the past 7 years, growing from $4 billion in 2013 to over $6 billion of annual written premium during this past calendar year. Numerous lines of insurance make up the property and casualty market. However, automobile insurance accounts for over 50% of the P&C direct written premiums in our state, with annual written premiums exceeding $3 billion. 89% of the state's automobile market is derived from personal auto lines such as cars, private passenger trucks, motorcycles, and recreational vehicles, while the other 11% are vehicles written in the state's commercial markets. So Nevada's automobile written premiums experienced significant increases in 2016, 17, and 18, with annual increases of 9.6%, 11.6%, and 14.6%. And we estimate the 2019 calendar year will show a 9.2% increase. And the increases in automobile written premium have been due to a combination of growth of Nevada's economy and population, rate increases due to higher frequency and severity of losses, and the 2017 Nevada Legislature's increase in Nevada's minimum automobile liability limits. And because automobile liability insurance is mandated by Nevada law, written premiums have historically been somewhat insulated from an economic slowdown. However, we do have some recent history looking at the Great Recession. And looking at that particular time period, the beginning of the recession and the first year with automobile premiums, the state did see a reduction of 1.7% in 2008. And then that was followed by a larger reduction in 2009 of 4.9%. And then from that point on, we saw a period of really not much change. We lost another 2.3% in 2010 and 1.3% in 2011, and finally saw the premium start to increase again in 2012. The state's automobile insurance market has been impacted by COVID-19 in ways that we didn't experience during the last recession. Really, the biggest change is due to significantly reduced driving from the periods of stay-at-home restrictions, more workers now working from home, as well as some insurers changing their assumptions of a sustained reduction in miles driven. A large number of Nevada carriers provided refunds or premium credits to Nevada consumers. It's estimated that in Nevada, approximately $109 million of premium relief were provided to Nevada's drivers due to this pandemic. And obviously that would be $109 million of expected reduced written premium for this fiscal year. The division does expect the written premium impacts of carrier refunds and credits to be relatively minor in absolute terms, but we would project the annual auto written premiums for this coming year may decrease by somewhat less than 4% as a result of a single wave of the COVID-19. Now, moving to Nevada's homeowners insurance markets, unlike automobile insurance, the average premiums for home insurance have remained relatively unchanged during the last 9 years. It's been reflective of a relatively stable and healthy home insurance market. The health of the economy does impact home insurance written premiums through the purchase of new homes and increased rebuilding costs. In recent years, Nevada home insurance written premiums grew by 6.8% in calendar year 2018 and by an estimated 6.3% in 2019. So again, if we look at the last recession to get some idea of what the potential impact would be of this COVID-19 pandemic, looking back again to the beginning of the Great Recession, in 2008, homeowners insurance premiums reduced by 1.7 million. In 2009, we actually saw an increase in written premiums of 1.5%. And then that was followed by another reduction of 1.1%, 1.3%, and then in 2012, we had 0.1% growth. So we saw from the last Great Recession that we really had a 5-year period where Nevada written home insurance premiums remained relatively flat. The division does project that the effects of COVID-19 on fiscal year 21 written home insurance premiums should be minimal, and we could even possibly experience a slight gain in written premiums similar to what the state saw in 2009. So this slide contains a 12-year snapshot of Nevada's total written insurance premiums from 2008 through 2019. And our written premiums went from a low of 10.9 billion in 2010 to a projected 2019 written premiums of $18.8 billion. Again, for a historical perspective, looking at the state's written premiums both before and after the 2008 and 9 Great Recession. Prior to the Great Recession, we experienced in 2005 a 9.5% increase, 8.2 in 2006, and 4.7 in 2007. So we had a pretty healthy insurance market prior to the recession. You can see from this chart, written premiums then reduced in Nevada for 3 straight years from 2008 to 2010 and remained really relatively flat from 2011 through 13. 2014 was the first year of the Affordable Care Act and the state's Medicaid expansion. And during that year, we saw written premiums increase by 12.4%, followed by an 11.5% increase in 2015. And while it's difficult to predict the length of the COVID-19's impact on Nevada's economy, at least the severity of the Great Depression does provide some relative perspective about the potential impact on insurance premium taxes going forward. The Nevada Department of Taxation shared their insurance premium tax collections for the past 4 years with us. And this slide reflects the premium tax collections broken down by quarter during the past 4 fiscal years. And I think it is important to note that during this 4-year period, premium tax collections increased every single quarter compared with the quarter of the previous fiscal year. So again, I think this was a great example of showing the health of the insurance industry leading up to this pandemic. Now, the fiscal year 2020 fourth quarter results reflected in this chart do include written premiums from the period of April through June of 2020, which represents insurance premiums and tax collections after the start of the pandemic. So we at least have this limited snapshot to what happened to premiums right after the pandemic started. And it's of note that in spite of the pandemic, the fourth quarter fiscal year 20 premium collections were still roughly $3.5 million higher than the same period during fiscal year 19. And this last chart contains really the same information in the previous chart. However, the information is grouped by fiscal year. And while it's a challenge to prove a definitive trend using only 4 years of data, it might be worth noting that in fiscal years 17, 18, and 19, the fourth quarter collections of each of those fiscal years exceeded their corresponding third quarter collections by an average of 11%. So there was a fairly significant increase in premium tax collections shown for the fourth quarter of those years. However, in looking at the fourth quarter of fiscal year 20, the April through June premiums and collections actually reduced by 6.3% compared to the third quarter's collections. So while the fourth quarter did represent an increase over the fiscal year 19 fourth quarter, it represented a 16% change from the average fourth quarter results of the previous 3 years. So in closing, the pandemic's created some unique circumstances regarding Nevada's insurance markets. From discounts and credits given to consumers due to reduced driving, expected reductions in workers' compensation premiums due to unemployment and lower risk classifications from working at home, to the effects of unemployment on workers' health insurance premiums, and again, the expected increase of premium taxes due to increased enrollment in the state's Medicaid MCOs. We know we're looking at a very different type of experience than what we've seen in the past. The division did perform an analysis of the potential impact of COVID-19 on the fiscal year 21 state's premium taxes. And again, it's a challenge to know just the severity and the length. And we really looked at kind of a best case and a worst case scenario. And again, this analysis did not take into account what's going to be the potential increase in premium taxes from the enrollment increases in the Medicaid MCOs. So excluding the Medicaid MCO effect, our projection in a best case was expected reduction of 3.5%, or roughly $15 million in premium taxes, to a worst case of potentially 6.8%, or a $31 million reduction during this time period. But hopefully the elasticity of insurance premiums, as we saw after the Great Recession, where we had relatively minor changes over that long period of time, hopefully we're still going to see insurance being a relatively stable source of revenue over the next few years. And with that, Jeremy and I would be happy to answer any questions you might have.
Thank you so much. Craig Billings here. Just a quick question from me. I have seen the fully insured and the fully insured providers in the market offering lower premium plans, really to help employers who are suffering from a decline in revenue, with different benefits, lower benefit levels, essentially. And I'm guessing that it really would have an immaterial impact on your view on premium taxes relative to a decrease in the number of lives covered. The biggest lever, I assume, on the health side has to be lives covered as opposed to changes in premia overall. Is that a fair assessment?
Jeremy, you want to take that?
I would say overall that probably will have a minor impact, because ultimately, I want to say the statistic, and Heather might be able to comment more, but I think the statistic is about 85% of individuals in the individual and small group markets are actually subsidized. So there's typically less of a concern about what the actual monthly premium is for a policy, because of the fact that there's going to be some sort of subsidization that will be kicked in for the premium.
Thank you. Any other questions from the forum? All right. Well, thank you very much. Really appreciate the presentation.
Thank you.
Mr. Chairman, then with your permission, then I will proceed. That sort of concludes the agenda items with regards to having the outside presenters. All right, we still have the Silver State Exchange. I apologize. Sorry. And I see their information is up. Sorry, my apologies.
Hi, everybody. I hope that you can hear me and see our slideshow. Is that up for the committee? Okay. I think I heard a yes, and you can hear me clearly?
Yes, we can.
Okay, thank you. I'm Heather Cordulic. I'm the Executive Director of the Silver State Health Insurance Exchange, and I'm joined today by Jennifer Krupp, who is our Chief Financial Officer. We really wanted to show you all a picture of what's happening in Plan Year 20 and give you some kind of best guesses about what we anticipate having happen in Plan Year 21. I did want to say that the last time we presented to the Economic Forum, we were operating as a state-based exchange that used the federal platform, or otherwise known as healthcare.gov. Since then, we have transitioned to becoming a fully autonomous state-based exchange and have enjoyed some of the flexibilities and autonomy that has brought to our state, and we'll get into a little bit more about that soon. Just to give you a quick list of our mission, of course, is to always work on increasing the number of insured Nevadans. And as I've said before, the Silver State Health Insurance Exchange is the state agency that runs and operates the online marketplace known as Nevada Health Link. We connect Nevadans who are not insured by their employer, by Medicaid, or by Medicare to health insurance. We also are the only place that Nevadans can get access to federal subsidies that help offset the cost of those monthly premiums. And again, like I said, we're a state-based exchange and located at nevadahealthlink.com. Our agency is solely self-funded, so we do not use any federal or state general revenue to support our operations. In Plan Year 20, we had 27 qualified health plans from 3 different carriers, whereas when we look into the future for Plan Year 21, we have 50 qualified health plans that will be available on the exchange from 5 different carriers. In 2020, we had Health Plan in Nevada, Silver Summit, and Anthem. And in 21, we'll be joined by 2 new companies named Friday Health Plans and Select Health. Back then, we had 2 catastrophic plans, 8 bronze, or back now, I guess, Plan Year 20, 14 silver and 3 gold. And most of those plans were available to everybody in Washoe, Clark, and Nye, whereas the other 3 counties, or 17 counties, were able to select from 17 plans. Moving into Plan Year 21, Clark and Nye counties will be able to select plans from all 5 of the qualified health plan carriers. And the 17 other counties will actually have 3 carriers because Friday Health Plans has decided to join all 4 of our rating areas and will be available statewide. This is a breakdown of our enrollment for Plan Year 20. You can see that, no surprise, that most of our consumers or our members are in Clark County, with the second largest population being in Washoe. And for Plan Year 20, we had most of our consumers enrolled in silver level plans. And of course, the average premium before subsidies were applied to those plans was $775 per month. After subsidies, the average was $186 per month. As Jeremy alluded, 80% of our consumers are receiving some form of subsidy to assist them with the cost of their premiums. So 80% with advanced premium tax credits, and then 41% are receiving cost sharing reductions. With that, I will hand it to you, Kim.
Thank you very much. This slide demonstrates a year-over-year enrollment, and as we look at these enrollment trends, one of the key considerations we want to point out in Plan Year 2020, as Heather indicated, the exchange transitioned to a fully autonomous state-based exchange. With that, it allowed us the opportunity to establish and get access to our own data and statistics, but that also established a new enrollment baseline for us. So measuring the impact of how the pandemic has affected the exchange has been particularly challenging for us this year. We are using different data methodologies versus what CMS used. So it's been not a line-for-line sort of comparison that we can make at this time. But however, as you can see from the enrollment trends, we did experience a slight decline from 2018 to 2019 in our enrollment figures. And as Jeremy had alluded to in the previous presentation as well, that was the first year that the individual mandate was not in effect. So that could be one of the reasons, though we don't especially know for sure. When we started 2020, we did know that about 14% of Nevada's overall population, or just under 400,000 people, were uninsured. Of those who were insured, roughly 3% were covered by plans on the exchange. And then prior to COVID, the exchange was aware that there were at least 100,000 uninsured Nevadans who were likely eligible for subsidies on the exchange. So as as unemployment rates remain high and people are losing access to their employer-sponsored plans, we do expect that number will go up. Thank you. So our open enrollment demographics, and these are our final plan selections as of December 15th, 2019. And these are for people who are enrolling into health insurance plans on exchange plans for plan year 2020. So we do operate on a calendar year, but we had 77,410 final plan selections. Of that, roughly 26% were the 20,111 people were new consumers. That means that they did not have health insurance that was sold on the exchange to an on-exchange plan in plan year 2019. Okay. Our demographics. This slide represents the open enrollment age cohorts. As you can see, the highest age bracket for plan selections or enrollments is the 55 to 64-year-old age group, followed by the 45 to 54 age group. Overall, this age group represents 16.7% of the state's unemployed population as of September 20th. Another 20.4% of the state's total unemployment rate is represented by those in the 45 to 54% age group. Nearly 37% of the state's unemployment rate is comprised of those in the same age group who purchased insurance from the exchange. This does lead the exchange to believe that there will be additional enrollments as people fall off their employer-sponsored plans and seek insurance coverage on the exchange. The same is true for consumers who identify as Asian. In Nevada, the Asian population makes up 8.7% of the total population, but it does make up 23% of the exchange's total enrollments. However, 10.9% of Nevada's unemployed population identifies as Asian. Hispanic or Latino populations make up 26.7% of the state's unemployed population, and those who identify as white make up 49.7% of the unemployed population. And this data is through Dieter's most recently published information for August of 2020. So that was kind of a snapshot in our predictions for where our open enrollment data went, but we did want to kind of give an update on enrollments as of June 30th, 2020. And so this does take into consideration our special enrollment periods. And so people qualify for special enrollment periods, as you know, if they have a qualifying life event. Some of those can be like the birth or adoption of a child. They can be a change in income and a loss of a job. So our total current enrollments as of June 30th were 58,543. That does represent a 24% reduction over our open enrollment plan selections. And we did notice a slight change where 83% of the plans, of the active plans as of June 30th, did receive subsidies, whereas 17% were unsubsidized. So that's demonstrated a little bit better by this slide here. You can see the blue is the open enrollment plan selections, whereas the green is where we were as of June 30th. So plan selections with APTC, or the Advanced Premium Tax Credit, did increase by 3%. Plan selections with CSRs, or cost-sharing reductions, those actually increased by, 15%? Anyway, I'm nervous and it's live, so my math might be wrong. Anyway, so we did see quite a big jump in the proportion of our plans that qualified for cost-sharing reductions, and we did see a reduction in the plan selections, or the proportion of our plans that did that were not subsidized or did not have any subsidies. This can be for a couple of reasons. It could have been that those who did not get subsidies found that their insurance was no longer affordable, it could have meant that they transitioned into different insurance options. They perhaps could have gone to Medicaid, or they could have just chosen to disenroll. We don't have very strong indicators at this point in time as to say what exactly happened or why those numbers changed, but it is an interesting trend to see so far what is happening. And then we did want to talk about the federal poverty levels for subsidized plans as of June 30th of 2020. So subsidies are based on the consumer's income level, which is measured as a percentage of the federal poverty level. So on exchange plans, people qualify for subsidies. In most cases, if they are between 138% and 400% of the federal poverty level. You will see in this chart that we do have some people that fall in that 100 to 150% range. And those tend to be special enrollments, people who don't qualify for Medicaid
for a variety of reasons.
For a variety of reasons. But the one thing that I did want to point out is that this demonstrates household income as a percentage of the enrolled population who receive subsidies. 75% of subsidized plans provide coverage to those who are living at or below 250% of the federal poverty level. To provide context, a family of four with an annual household income of $65,500 is at an annual income of 250% of federal poverty level. The median household income in Nevada is reported by the U.S. Census Bureau. It's $57,598 with an average household size of 2.68 persons. So that means that half of Nevada households have an income above this figure, and half of them have households who have an income lower than this figure. A family of three with an annual income of $54,300 would be at 250% of the federal poverty level. So our special enrollment period that we were fortunate enough to be able to have earlier this year, because we are now a state-based exchange. Well, the special enrollment period would happen regardless. I'll talk about our exceptional circumstances special enrollment period shortly. But to date, or as of June 30th, we had 367 requests for special enrollment periods. 35% of those special enrollment requests were determined to be Medicaid eligible, and so that totaled out to about 17,000, just over 17,000 individuals. So that's a fairly big jump for us in the first 6 months of the year. And then 4%, which was around 2,300, were due to were granted special enrollments due to the loss of qualifying health coverage. Again, though, this is through June 30th, so this is still, just as we're coming out of quarantine, people are still kind of recovering, trying to find out if they're going back to work, at this point in time. So people who may have been furloughed or, we're still kind of on the sidelines waiting to go back to work, probably didn't know one way or another, like what was going to be happening with their employment status. So we expect these trends to change again as we continue through plan year 2020 and go move into plan year 21. Now we'll talk about the exceptional circumstances special enrollment period. This ECSEP was an emergency special enrollment period related specifically to the COVID-19 pandemic. It was open from a period of March 17th to the 15th, 2020, and it was essentially an open enrollment period provided the consumer had not had an existing plan year 2020 plan that had been canceled due to non-payment. So from that special enrollment period, there was a total of 4,676 enrollees, and we have the month-by-month breakdown. So March was 1,397, April 2,026, and May 1,253. Next.
So this is where I'm going to take the reins again and talk about kind of what we are looking at in terms of what to expect in our enrollment for a COVID-19 world. And of course, as Moira Rose says, one may never know what may happen. Here are a few things that we know for sure, nothing for sure, but here are the things that we're looking at in terms of getting a gauge on what we can expect from this next plan year. We are clear on the fact that unemployment and people losing their minimum essential coverage is going to have an impact on exchange enrollment. We know that the presidential election will have significant consequences on the future of healthcare and specifically on the future of the Affordable Care Act. We know that the Medicaid agency has been holding off on redeterminations as a result of some of the rules written into the Families First Act. And as Medicaid starts to go through their redeterminations on the hundreds of thousands of Nevadans who have become, well, I guess we're in the hundreds of thousands of Nevadans who have become eligible for Medicaid, that there will be many people who are going to be ineligible because they've either gone back to work or their income puts them out of the eligibility threshold. So we are partnering closely with Medicaid to make sure we're capturing people and not letting them slip through the cracks and going without insurance. As Jennifer highlighted before, there are a lot of special enrollment period activity. The exchange is preparing to significant and fluid special enrollment periods throughout the next entire plan year and are enhancing our technology to be as readily available and consumer friendly as possible. We're also working on guiding our licensed professionals, over 700 brokers and navigators across the state who are partnering with the exchange for this open enrollment period. We're training them about health reimbursement accounts. We know that many small employers are finding it hard to continue to offer health insurance to their employees, and as a result, may be offering health reimbursement accounts. We want to make sure that those employers and those employees know that the best options in terms of comprehensiveness and affordability are on the exchange. Another significant factor in the COVID-19 landscape is really related to the kind of future of claims for our insurance, for our hospitals and our providers. We know that they experienced significant decreases in claims that were being sent. And so that has an impact on the medical loss ratio that insurance companies can collect. And we know that that will be kind of a fluid situation, along with the fact that there are unanticipated and not very well vetted ideas on how much coverage is going to cost as the population gets sick with COVID, determining the kind of severity of that sickness and what those costs will be. Well, I would suggest that all of the new carriers are minimum average rate increases on the exchange for this next plan year. And one thing that we've not yet mentioned is that our board of directors has extended our open enrollment period for plan year 21. So we will run from November 1st through January 15th, giving Nevada an extra 30 days to get enrolled for this next plan year. And all of that is actually really good and good signs for the exchange in terms of stability and growth. However, there's never been a drama-filled or free year with the Affordable Care Act, and this year is no different. The exchange is, of course, working with our licensed partners across the state on how to navigate COVID-19 in terms of enrollment and ensuring that they have the ability to do virtual enrollments, telephonic enrollments, and that they're following CDC protocol, state and CDC protocol when they're having in-person enrollments. The Supreme Court is, of course, as is well publicized right now, hearing the Affordable Care Act repeal case or severability case on November 10th. While we don't anticipate the Supreme Court to make any ruling on that until well into plan year 21, we know that that will offer a moment of concern and confusion for the thousands of Nevadans who are currently insured on our exchange plans. The election year, of course, is going to have a significant impact on what happens with the Supreme Court case and what happens with healthcare in the future in terms of the longevity of the Affordable Care Act and other plans that may not be as comprehensive. The other thing that has kind of borne itself lends itself to some confusion that we've seen this last plan year and throughout this special enrollment period is the difference between the way that the federal government requires the accounting of income on exchange or for Medicaid. So in terms of unemployment, the federal pandemic unemployment compensation, that additional $600 a week that Nevadans were getting in unemployment and the soon to be deployed lost wages program, both are counted as income when you're counting income for the exchange. However, That is not true when you're counting income for the Medicaid. All of that means that we know we're going to be watching a significant churn between Medicaid as they continue to do those redeterminations I mentioned, and as Nevadans go back to work or fall into long-term unemployment. We know that that's going to make a more significant churn than we've experienced in years past. We also always compete with these aggressively marketed, and I say this loosely, plans that are competing with the exchange. There are things called short-term limited duration plans, health sharing ministries, other plans called indemnity plans that sometimes present themselves as being Affordable Care Act compliant or subsidized, and they are not, in fact, either of those things. And so the exchange has a robust marketing and search engine optimization plan that tries very hard to combat that. With that, this is our contact information, and we are happy to answer any questions that the committee might have.
Thank you very much. Craig Billings here. Just a couple of questions. Can you just help me understand? So the 77410, which was the enrollees subsequent to the 2020 enrollment period, that falls in June, that falls to 58,543. Am I correct? And that's really just through lack of payment of premium, et cetera, right? That's just natural attrition?
Yes.
Okay.
However, we have seen the natural attrition in years past has averaged around 15%.
Okay. And then how does that then relate to the 5367 during the special enrollment period on June 30, 2020?
Those were essentially the number of requests that were made in applications.
I'm sorry, the number of?
Those were the, I'll take it. Those are the number of requests that were made for special enrollment periods. However, not all of them were granted, and many of them, as we were indicating, went to Medicaid and were Medicaid determined.
Okay, I see. And then the exceptional circumstances total enrollees, I guess I'm not totally surprised. It looks like a relatively low number. Is that below your expectations?
It was, but I would also just suggest that if you look at the unemployment data, you can see that primarily people who became unemployed were in the lower income range, and that thus making them eligible for Medicaid. And you can see that by the enrollment figures that Medicaid had of nearly 18,000 in the month of May alone. And so I think that churn is going to be something that we continue to have to pay close attention to.
I see. And I guess I would just a comment to add to that. You know, many of the furloughs up and down the Las Vegas Strip anyway included continued coverage of health insurance, oftentimes through the end of this month. So kind of coinciding with your the commencement of your open enrollment period. So
yeah, we're certainly ready to talk to those folks. And I would just add that we know many people have been unsure about their continuation of their work and in that furlough status and purchasing COBRA plans. So we are trying to get the word out to Nevadans that COBRA can be pretty expensive and that there are equally comprehensive and more affordable plans on the exchange.
Got it. Thank you. Any other questions from the forum? Thank you both. Appreciate it. Russell, back to you.
Thank you, Mr. Chairman. And that concludes all the presentations that we had scheduled for the agenda items. So then the remaining agenda items are more sort of your staff going through the general stuff that's part of the Economic Forum's October meeting in terms of that information set. And so with that, I will proceed with agenda item 13, which is the report and discussion of FY20 actual collections compared to the following. And so here we're going to provide you information on how the FY20 actual collections compared to the Economic Forum's May 1st, 2019 forecast adjusted for legislative actions, but also then provide you the information how the actuals compared to the June 29th Budget Division Fiscal Analysis Division consensus forecast. And that was the forecast that was used to make the adjustments to the general fund budget during this 31st special session. And so, Mr. Chairman, members of the Economic Forum, I'm not going to spend a lot of time on this agenda item. That's not to make light, I think, as your staff for this body in terms of the importance of the information of keeping track of and reporting to this body how the actual collections compare to the forecast. But I think as forecasters and as this body, right, we tend to try and look at how the actuals did compare to our forecast and see what information we can learn from that for when we get ready to do the next set of forecasts, right, in terms of over forecasting and unforecasting and attempting to determine why. But I think all of you can appreciate, especially given the presentations that we've had today, that looking at the FY20 actuals and comparing them to a forecast that was done back in May 2019, and you're going to see here, even one done at the end of June 2020, that exercise then becomes more complicated to glean any information from it in terms of, I think, a forecaster or this body would try and utilize. So with that as my opening comments, I will just mainly go through what the tables are so that the members of this body know what's being displayed and any members of the public listening, and then allow everyone to go through and look at it on their own time. So on page 229 of the printed packet, you'll see table 1, and this is the table that we generally put together that shows you, we show you the information again for FY 2019. This information would have been presented back at the December 2019 meeting. But then you see on the right-hand side of that table, FY 2020. So we're showing you the December 3rd, 2018 and the May 1st, 2019 forecast for the major revenue sources, as well as what we call the major minor forecast and then total general fund. So I think there is just, the important thing is, right, we can go look at page 234 of the printed packet again, table 1. On the lower right-hand column of that, you see the total general fund revenue. This would be the net actual after all the tax credits that are in play, that the Economic Forum's May 1st forecast for FY 2020 was missed by approximately $369 million, or about 9%. And so, but, right, we know why, right? We've heard that, we've all known, and then you're getting more information on that today. Then table 2 that begins on page 237 of the printed packet is just the table that provides the same information for December 3rd, 2018 and May 1st, 2019 for FY 2020 forecast compared to the actual for all the general fund revenue sources listed there. And that's in the tabular format is that we generally refer to as the Economic Forum's forecast table presentation format. What I think is probably might be more relevant to just make sure that the members have seen it is table 3 on page 247 of the printed packet. So at the June meeting, we provided this body the June 29th consensus forecast for the general fund revenues that we did individually and then the total. That, again, was the revised forecast for FY 2020, and then we had the revised forecast for FY 21 that were used to make the budget adjustments. And so here we're showing you the Economic Forum's May 1st, 2019 forecast, the June 29th budget fiscal consensus forecast. And then on the right-hand side, we show you FY 2020 actual and then the forecast errors. And so, again, you can just see the information. And one of those that we did miss is sales tax, that it came in obviously below the Economic Forum's May 1st, 29th. But it came in above what we thought based on the June 29th. And we would have had the information available through the business activity period April when we were doing the June 29th. So we had 1 month of sort of what we call the sort of, not a complete shutdown, but it was that the gaming industry was completely shut down. And so we knew we were losing a lot of our visitors and knowing what they did. So you can see with the sales tax, but if you've seen some of the presentation today of trying to figure out the stimulus money and when and where that was coming into the economy. And when I get to a later agenda item, I'll make a few other comments about where we think we see some of that in the data. And so again, we'll allow the members to just go to that table, and you can see what happened relative to the forum's forecast, and then relative to the June 29th. But I will point out to tell you just how incredibly difficult this is when we were trying to do it in June 29 of this calendar year, and possibly how difficult it's going to be for the forecasters in this body going forward here is, so right, you go look at, it's down there, it's the line, the cigarette tax, again, on page 247, table 3. So as you just scan across there, right, what did we do as forecasters? We thought with losing the visitors that, gosh, some of those have to smoke. So you thought there would be degradation in the smoking tax because of the pandemic and the yanking the supply curves out of the economy, or at least pulling back on some of those supply curves, especially, as I stated, with the visitors, but also probably people having their budgets affected might curtail some of their smoking behavior. But so you can see we lowered the forecast then by $12.3 million compared to what this body forecast back in May 2019. Then go look on the right-hand side. That was a mistake. We should have kept the Economic Forum's May 2019 forecast for cigarette taxes because it only missed by $44,000 versus it came in $12.4 million higher than what we thought when we did our June 29th forecast. So that's the one when we put this in, we were like, do we have the numbers in the right cells? And in fact, June 2020 of FY20 for the cigarette tax was the highest month of that 12-month fiscal year period. In fact, that it was around $15.7 million. It was close to the two highest months of FY 2019. So I'm only saying that to sort of provide some information that, hey, it's pretty tough to figure out what goes on with tax collections in a pandemic. And so with that, Mr. Chairman and members of the forum, if there aren't any questions, I will conclude this agenda item. And again, I'm not trying to make light of the importance of these numbers. I just think we're concentrating more on trying to figure out what we're going to do for 21, 22, and 23 versus what actually happened for FY 2020, given the informational content in it.
Russell, this is Marvin. It's going to be really difficult, it seems to me. We've got a situation where as you mentioned, we had the effects of the federal stimulus money showing that, and that's ending now. But we've also got increased employment over what we had at the depths of the early in the spring and summer. So we've sort of got an offset on those two when we try to predict what the future revenue is going to be, plus, of course, all the other unknowns as to relates to when's the vaccine going to be available, and that lag on conventions that the chairman and Mr. Hill were discussing among themselves. That's going to be another factor in there, and it seems like it's going to be a very, very difficult situation for us, given all of those unknowns, even when we come to December.
I would concur, Mr. Levitt, because the staff, as my two colleagues, Michael Nakamoto and Joe Real, as we've been working through this, thinking that sort of you could say, well, other than having to try and figure out when a vaccine will be approved and when that vaccine will be approved for mass distribution to the public, and when and if the federal government may do another round of stimulus and what that would be. And right, we also have the election out there that could have an effect on things. It's otherwise a straightforward forecasting process, right? Right? So.
Yeah.
So, Mr. Chairman, if there's not any questions, and actually I don't see Chairman Billings on the screen. Sorry. I just wanted to make sure I hadn't lost you, Chairman. I apologize. And so if there aren't any questions or other comments, then we can proceed to agenda item 14, and that will be my colleague, Michael Nakamoto. And so I will turn things over to him.
Thank you, Mr. Chair. Members of the forum, for the record, I am Michael Nakamoto, Deputy Fiscal Analyst with the Fiscal Analysis Division of the Legislative Council Bureau. Under Agenda Item 14 is the forecast error accuracy report, which begins on page 249 of the forum packet. Like Mr. Gindin before, for Agenda Item 13, I don't plan on spending a whole lot of time on this. But just as a little bit of an overview, this report is one that we go through on a regular basis. Every year we update it with basically the historical record of the Economic Forum in terms of how well they did, basically the numbers that were presented in the prior agenda item that are carried forward and brought as a historical record. The report that is there, it's 62 pages, and I'm not obviously going to go through the whole thing, but just as a reminder, there are historical statistics on the state sales tax, the gaming percentage fee, the insurance premium tax, the casino entertainment tax, which became the live entertainment tax after the 2003 session, the cigarette tax, the modified business tax for non-financial institutions, for financial institutions and mining companies, as well as total modified business tax, the real property transfer tax, and total general fund revenues, as well as just some historical data for the special economic forum meetings that were held in January of 2010 and June of 2008. All of which has been part of this document for as long as I have been part of this process. What I am going to focus on just in my brief comments on this particular item, Mr. Chair and members of the forum, is on page 263 of the packet. It's kind of an overview of the document for some of the selected majors that have been part of the forum process. And this is basically the one that goes through and shows the absolute or average and absolute average dollar forecast error for each particular forecast that the forum has produced for the major general fund revenues on this sheet, as well as the total general fund. The only thing that will have changed from this report, as opposed to the one that was presented by Mr. Gindin at the December 2019 meeting, is the 1 year ahead forecast. That would be the December 2018 and May 2019 forecasts that were prepared for FY20, the fiscal year that just ended. And so I thought I would just point out a couple of the differences from the previous report to the most recent one that is in front of you today. For the state 2% sales tax, you can see that the average error for the 1 year ahead forecast for December was approximately minus $8.4 million. And for May, it was minus $10.4 million, which means on average, over the Economic Forum's lifespan, and this is going back to the first forecasts that were done in December of 1994 and May of 1995. Once you took all of the positives and the negatives and took them together and took an average, the Economic Forum, on average for that 1 year ahead forecast for December, over forecasted the state sales tax by approximately $8.4 million for the December forecast and by approximately $10.4 million for the May forecast. Going back and looking at the tables that we put together for Agenda Item 13 on page 229, the Economic Forum for the December forecast for FY20 missed the state sales tax, or the 2% sales tax, by almost $85 million. The forum over forecasted by almost $85 million for FY20 for the December forecast, and for the May forecast, the forecast was over by approximately $96.3 million. So that obviously is going to move these averages. So the $8.4 million average forecast error for the December forecast for this report previously was just short of $2 million, a minus $2.2 million for the December forecast, and the $10.4 million average forecast error was a minus $3.2 million. And that is actually going to be the story, if I were to go through all of these, that I would tell, of just how one forecast, and especially everything that we've heard today about the pandemic and the effects that it's had on our economy and especially on the revenues, how one forecast can change this report. Now, not all of them are going to be bad. Mr. Ginden was talking about the cigarette tax and how the forecast for the from May of 2019 for FY20 was off by $44,000. So the numbers for the cigarette tax, when you get down to it, are actually more favorable. For that May 1 year ahead forecast, the average of minus $3.5 million for this report, it was actually minus $3.8 million for the December 19 report. So it actually got better because we were that close to the forecast. So it's a case of some of them were not so great and some of them we did all right. But that is really what I wanted to go through just as an update, because this is a report that we do on a regular basis. It has been updated for the FY20 actuals. And that is all I really had for this agenda item. So if there are any questions, Mr. Chair or members of the forum, I would be glad to answer them. Thank you.
Thank you. I don't have any questions. Do any other members of the forum?
I don't see any, Mr. Chairman. So with that, then we can proceed to agenda item 15, which is my colleague, Joe Rio, and he's at the witness table here for his presentation.
Thank you, Mr. Chairman and members of the forum. For the record, Joe Rio, Deputy Fiscal Analyst with the Fiscal Analysis Division. Agenda item 15 starts on page 311 of your packet. I'll bring the slides up on the screen, and I won't go through all of them here, but I just wanted to highlight these because they are part of the regular information that's provided to the forum. And so the information has been updated since the last time you saw these tables with an additional year of data. So I'll just highlight some of the information. And of course, a lot of this is repetitive based on the prior presentations. So just briefly looking at the U.S. employment situation, you can see that, as has been displayed previously, that this is all on a quarterly basis, that from 2020 first quarter to second quarter, that U.S. employment fell by 12%, or 18.2 million jobs. And then we just show the comparison to the Great Recession. Looking at Nevada's employment change, again, first quarter 2020 to second quarter, not as dramatic, minus 16.1%, 229,000 jobs lost, whereas relative to the Great Recession, it's not quite as dramatic as, or it's actually bigger in percent terms, and then more jobs lost relative to the prior recession. And of course, previously it was the construction industry that was the major industry that was affected. This time it's leisure and hospitality employment. And we see that first quarter to second quarter decline of 31%, 109,000 jobs. And of course, we've seen that some of these jobs have come back, but probably only about half of the jobs that were lost have returned. And of course, the challenge for us is going forward, what the industry is going to look like. This is just a comparison of growth rates. 2019 second quarter to 2020 second quarter, again, U.S. down 11.2%, Nevada down 15.9% over that same period. The next few slides get into population reference and consumer price index for inflation, because we look at this both on a per capita basis and inflation adjusted basis. So I just wanted to point here that the CPI portion, it's down only 0.4% increase for the second quarter of 2020. Whereas a year ago it was 1.8%, and then in the period prior to that we were really above 2%. So in inflation adjusted terms we'll see some improvement in a lot of the series that we look at because the inflation rate's being held down a little bit. That's primarily because of the energy component of the CPI. In the purple line there you can see as the energy component falls, so does the headline CPI rate. And so that's really what's been driving the reduction lately in the CPI. So across most of these things, you'll see an improvement in the inflation-adjusted terms. Really, for this report, I wanted to highlight these. This is a new piece of information that's added to this series, is the components of personal income. And we've seen this previously in the prior presentations, in that for the U.S., the wages are typically, 50%. In prior periods, it's more than 50% of the total components of personal income. But with this 2020 first quarter to second quarter, we see the decrease in the wage component in terms of a share of total personal income decreasing from 50.2% to 43.3%. And of course, the offsetting increase in the transfer payments that we've talked about, increasing from 17.1% to 27.9% at the national level. So that's, of course, again, the stimulus payments, unemployment compensation, things like that. And of course, Nevada, an even more pronounced shift in that components of personal income, in that wage and salaries decreased from 48.9% to 38.6%, and then the transfer payments increased from 17% to 32.3%. So that's, again, the impact of the additional stimulus dollars flowing into the economy. So when you look at total personal income at the U.S. level, it looks like it's great in that it increased by 7.6%. But of course, that's driven by that stimulus and the transfer payments, whereas, of course, wages for that one quarter has fallen by 7.2%. Nevada, an even more sort of pronounced divergence here between wages and personal income, in that personal income increased 11.9%, but the wage and salary component of that decreased 11.7%. And this is just the growth rates for the U.S. and Nevada side by side. And again, you can see the sharp increase in both, but Nevada at 15.6, outpacing the U.S. increase for this latest quarter. And again, the other side of that, the wage component decreasing 4.7% nationally and 8.1% in Nevada. So then when we switch to look at things on a per capita personal income basis, similarly, you see U.S. increase 7.2% on a per capita basis, and then inflation-adjusted terms, of course, a stronger increase at 8.1%. Looking at Nevada, even more pronounced, per capita personal income increasing 11.7%, inflation-adjusted terms a little bit stronger again, 12.7%. Again, the side-by-side comparison, both U.S. and Nevada, you can see that Nevada's increase almost got it to where the U.S. was just a quarter ago. Of course, when we look forward, we anticipate that that stimulus is going to disappear and that these increases in personal income are going to have to fall again. And again, the inflation-adjusted similar increase. This is just looking at the growth rates in per capita personal income side by side, U.S. and Nevada, in nominal terms as well as inflation-adjusted terms. We've just kind of seen the increases there. Now, looking at wage and salaries, when we see total wages and salaries have decreased, but then when we look at it on a per capita basis, or I'm sorry, per employee basis, we see that it's actually increased at the U.S. On a nominal and inflation-adjusted base. It's 5.5% and then 6.5%. Again, similarly in Nevada, the increase 5.2% per employee, and then again an increase in inflation-adjusted terms. And then this is just the side-by-side comparison. So relatively comparable U.S. and Nevada growth over this last quarter on a per employee basis. And again, inflation-adjusted terms, a similar increase. And then, of course, the same concept there in the growth rates, in that Nevada's increased over the year 9.3% in wages per employee, U.S. 7.5%. And again, looking forward, as we see the employment return, we'll see these wage growth rates come back down. Again, inflation-adjusted terms, the same concept. This is one where it's an improvement that's not affected in terms of the COVID situation, because this is all through just 2019 and median household income. Nevada, this is one where we've been kind of comparing it to the prior peak. And so U.S. Median household income has increased 36.6% over the prior peak in 2008. Nevada, not quite that good, only 29.5%, but you can see we've now surpassed the level of median household income in Nevada versus the U.S. And again, in inflation-adjusted terms, we've also again now surpassed both the previous peak for Nevada back in 2007, as well as surpassing the U.S. Level of median household income. And then, of course, the growth rates just showing the improvement over this last year. And again, this is sort of, we don't know really what the impact's going to be after when we look at 2020's numbers, but this was encouraging to see that we'd received that kind of income growth lately here in 2019. The last couple gets into the general fund revenue per $1,000 of personal income. And of course, because of the decrease in revenues, we see that has fallen considerably here in FY 2020. And then just the growth rates associated with those. So that's all I had for that agenda item, and I'd be happy to answer any questions that members might have. Thank you.
It doesn't appear that there's any questions. So what I just wanted to add is my own, because given all the other information that's been presented today, and then as we as staff look at this information, compile it, when you hear all this, you get a slightly different context because your information set changes. And so a couple of the slides that I think that they'll look at are when Mr. Reel was presenting the ones of the components of personal income, and you see the transfer payments. And so that blue line, when it kicks way up, and then you also have the chart where you see personal income kicking up, but wage and salaries kicking way down, right? That stuff is pretty counterintuitive when you just look at it. So then you go in and look at the components. And if you really want something that, puts it in perspective is, right, we all think about the Great Recession. We modified the word recession with great, right? And then we look at some of these numbers and go, what are we supposed to call this? We call it a pandemic, recession, induced recession. But one of the components that obviously makes up transfer payments is unemployment insurance benefits. And so if you go to pull that series out and you plot it through 2020 first quarter, it makes the Great Recession UI payments look like a mountain. You go add the 2020 second quarter and it makes the Great Recession UI payments look like a little hill. That's the magnitude of what we're seeing, the federal stimulus that Mr. Guerrero and others have been talking about today here in terms of how much was put into the economy. And we can see some of that showing up in the economy, obviously, and we see it in some of our tax bases, especially the taxable sales. We also see it in the modified business tax because of the decisions that were made by the casino industry as well as other business sectors to continue to pay their employees, keep them on insurance benefits, which is driving, right, many of our tax bases. And so part of the conversation that's been had today is that without additional stimulus, we know we got to see it here in the numbers of the $1,200 check, the $600 extra in unemployment, the $400 in UI. You're seeing that show up in some of these numbers that the Bureau of Economic Analysis is reporting for wages, transfer payments, income. And then we can try and see where that's showing up in our taxes. And so that will be one of the very important elements of as we forecast is, will there be additional federal stimulus or not, and if there is, what will be the order of magnitude? So I just wanted to say that when you look at these, and I would have never thought in my career as an economist that you'd show me an employment chart and it looks like a bird flying into a window, right? It just sees that kind of pronounced fall. It's just crazy. So with that, Mr. Chairman, that sort of does include, I think, that agenda item. And so then the next agenda item is agenda item 16, which is the presentation on historical taxable sales and gaming market statistics. And again, this is part of the record of the economic forum that's been going on of updating the gaming charts and the taxable sales charts. They have been updated through August business activity, September's collections for the gaming. I did update them all, but I do want to point out and make it part of the record that you saw some of the charts that others put out. The scales just get too crazy to show April, May, when things basically fall to zero. So for many of the charts, I took those 2 months out. So you'll see the line end and then see it start again down below, especially for the win per unit and hold percentages and things like that. The data just got too crazy because of the effect of the pandemic on that business sector and then the data being reported by the industry to the Gaming Control Board. But I would say, hey, for the members, start looking at those because that's the data that your forecasters have that we're going to be looking at. But I think, as you can expect, this is one case where it's hard to figure out the signal in that history as to help guide you for the future. The taxable sales data has been, those charts and tables have been updated. Again, it's a very interesting thing when you go and look at it. So the one comment I will make is there's a set of charts there that shows you on a fiscal year by county. So through February, we had 3 counties that were down in terms of their taxable sales through February compared to the same period in FY 2019. At the end of FY 2020, those 3 same counties were still down. The one other county that we added was Clark. Clark was up 6.5% through February. They ended up being down 4.5% through the complete fiscal year. All the other counties that were up through February stayed up. And in fact, when we started seeing the monthly data that the Department of Taxation was reporting, you knew something was going on in some of the categories. Right, that stimulus money was out there and people were spending it. And that's one thing you don't know is, will they save some more of it or will they spend it? And so one of the categories, if you go look at the set of charts that I first presented at the June meeting, shows you by NAICS code and I've ordered them from largest to smallest. So I've updated those charts, and so there's a set of charts for the statewide Clark and Washoe that shows you exactly that data. It shows you July through February, then it shows you March through June, and then it shows you the complete fiscal year for statewide Clark and Washoe by the NAICS codes. And then there's another set of charts that lays those 3 markets together, but for the complete fiscal year. And again, I would say that the forum members, that if they have the opportunity to look at those, that they're set up to be printed on 11 by 17 paper. They will print on 11 by 14, and you don't need an electron microscope to read them. But if any of the members want, let us know, and we can print them out and get them to you in the tabloid-sized paper. But when you go look at one of the categories, auto sales, we were seeing, especially in Clark County, but especially up here in north in terms of Carson, Washoe, very strong. And it was hard to fathom. But then when we went and looked into that NAICS category, well, it's not just autos. It's recreational vehicles, right, or RVs. ATVs are in there. Boats are in there. So we were able to get some more detailed data from taxation to try and look at that. And you can clearly see those other categories. So a few of those months when the partial shutdown or the shutdown, there was double-digit growth going on in those categories. So you saw that stimulus money out there having an effect in some of these categories. But you clearly then saw where it was having its effect is more in Clark County, being Clark County's more dependent upon the visitor market. And when you go look at those, it's NAICS 722, food service and drinking places. When you go look at that, you can see the relationship that goes on between the different markets. For FY 2020, that for the complete fiscal year, the statewide was down 15.7% in that category, but Clark was down 17, Washoe was only down 9.6%. So again, as we're looking through this data, we're trying to figure out what can it tell us about what's going on, losing the visitors, but then having the stimulus money and then thinking about, well, are we going to be able to get the visitors back and are we going to have additional stimulus money? So with that, Mr. Chairman, those were the comments that I wanted to make with regards to the charts and tables that have been updated for the members of this body and made part of the public record. And again, I will continue to try and think through an update, but I think maybe more of the discussion will be for the November and or December meetings about this data, Mr. Chairman. But if there are any questions on this agenda item, I can attempt to answer them.
Thank you, Russell. I think part of the rationale for slogging through all of this today, and I certainly appreciate my fellow forum members doing that, is to really try to get a picture of a broad-based picture of the levers that we're going to have or won't have going into the forecasting process. And I think the trends kind of get distilled down into a few pretty clear levers, right? The juxtaposition between North and South is pretty striking. I think we saw that throughout the course of today. The dependency on stimulus really all the way through the point of broad-based distribution of a vaccine is clearly going to have an impact, particularly in the southern portion of the state. And I think it's really hard to understate that. And I think some of the comments you just made touch on that in both this section and the prior section. And so I think, I know we'll get into instructions for the future meetings, but having a sense for stimulus and stimulus activity and knowing what we're going to be likely in for throughout the course of 21, at the point at which we're having to make decisions around the projections, feels like it's going to be just incredibly relevant, which obviously we don't control and no one in the state controls. But it certainly is a unique time, but I think the kind of 2 or 3 big picture themes came out extensively today in numerous places, at least for me.
Thank you, Mr. Chairman. If I don't see any other comments by the forum members, so I think you segued there to the next agenda item is agenda item 17, the instructions to the Technical Advisory Committee. And so I just have this agenda item on here because I can't talk to you about it unless it's here. But I believe at the June meeting, the forum and the chairman did provide the directions. This is sort of which will be the major revenues and which will be the non-majors. And that decision was made to keep the set of majors the same at the June meeting. And so this would just be the opportunity if the members of the forum want to change those instructions from the June meeting. If not, I believe we can move on from this agenda, other than for me to tell the forum that, right, when we will be probably having the TAC, as we call it, meet late October or early November in relation to when we set the November meeting for the forum and when we get the data from the Gaming Control Board and Department of Taxation. But it would most likely be in that last week of October, early November, that we will have the TAC. And we have already sent the request out to all the executive branch agencies for them to provide their forecast for FY 2020, FY 21, FY 22, and FY 23 for their revenue sources that make up the Technical Advisory Committee's duties and responsibilities as directed by the Economic Forum. So with that, unless there's any desire for the forum to change the instructions to the TAC and staff from the June meeting, then I think we can move on from this agenda item, Mr. Chairman. And
sure.
I'm not seeing. So then, segueing again, agenda item 18 is the scheduling of the future economic forum meetings. And so Judy Lyons, who's the secretary to this body, had polled you for the week of the 9th, and looking at the schedules, it would look like the 10th or 12th because the 11th is state holiday. So if we want to here today, we can set the 10th or the 12th here, or if you don't have your schedules and can't clear, I can then have Judy work with all 5 of you to find a date. But if we'd like, we can set that date here, Mr. Chairman, as either the 10th or the 12th.
I'm indifferent between the two. So I don't know if any other members of the forum have obligations on either of those days.
Either day's fine with me.
I'm open on both of those.
I have a bit of a leaning for the 10th if possible.
Sounds like the 10th. And I would just, Russell, I would just ask that somebody checks with Linda Rosenthal.
Sure.
And Ms. Rosenthal did let me know that that week they may be having their quarterly earnings calls. So her schedule, right now she doesn't know exactly when they'll be, but I can work with her. But it seems to me that the 10th, Mr. Chairman, may be the preferable date. And I'll just be honest with you, staff, it might be better to have it in the 10th versus, because then that's a couple, because otherwise the 12th, and then we just push it closer to the 3rd. And I know you guys look at it and go, what's 48 hours? But for us, 48 hours and getting the data seems like a week at times. So if that is possible, we could look at the 10th, and then we can then I'll have Judy send out an email, and then Ms. Rosenthal would know, and to the extent she can try and work her schedule to avoid the 10th.
Thank you.
So, Mr. Chairman, is that okay with you then as the chair? Then we just try and proceed with lining up the 10th as the meeting date?
Sure, why not?
Okay. Thank you, Mr. Chairman. And so with that, I will obviously be keeping in touch with you as the chair as we proceed to the November 10th meeting. And then I think we've already sort of at the June meeting, and everybody looked at their schedule, that December 3rd, and that's as far as we can push it out statutorily. And so hopefully everybody's schedules would accommodate the December 3rd still here today. And we don't have to set it in stone, but it helps us for planning and arranging rooms. And, given the environment that we're in, most likely we'll be doing the November, December meetings virtually. But we'll work with the chair and talk to folks about the possibility of it being less virtual and a little bit more physical, if possible, if that's the chair's direction.
Thanks, Russell. We can talk offline.
So with that, I think that concludes the agenda items in the packet, except for agenda item 19, which is public comment. So which then again, Mr. Chairman, will let BPS see if there's anybody that's in the queue or trying to get into the queue for public comment, if that's okay with you.
Thank you, Mr. Chair. This is broadcast. We typically take a 2-minute pause to allow for connectivity. I'll begin now. Thank you, Mr. Chair. The public line is open and working. There are no callers at this time.
This, Mr. Chairman, then, Russell Gendon. So that concludes the agenda items for today's meeting, except for the last one that you can take care of when you're ready as chair, which is adjournment. And I would just personally like to thank all the members and all the presenters for working with staff to be able to get this virtual meeting set up and be able to execute it with just a few hiccups. But I think that's expected in a virtual world, so.
Thank you, Russell. Thanks to everyone who helped arrange the meeting, and of course, everyone who does, you and your colleagues who do the analysis. Let's adjourn the meeting.
Thank you.
Thanks. Bye.